Aditya Malik, and once again, it's an honor and a pleasure to welcome you to this summit. Now, as we begin today, let's all of us embark on a captivating exploration of the multifaceted world of healthcare, a realm teeming with groundbreaking innovations, profound insights, and boundless possibilities. Together, you and me, all of us, we gather to celebrate the visionary leaders, experts, and tireless innovators who continue to shape the future of healthcare. BW Healthcare World exclusive healthcare community of BW Business World extend a heartfelt welcome to each one of you as we take on this transformative journey together. Within the halls of this summit, all of us will pay homage to luminaries of the healthcare industry, honoring the contributions and also the unwavering commitment to excellence. The BW Healthcare Excellence Summit stands as a beacon of enlightenment, a platform where leaders, visionaries, all of them will converge together to share their insights and also the expertise. Through this curated program of ours, comprising of panel discussions, of interactive sessions, of keynote sessions as well, we all will endeavor to ignite dialogues, of course, and also foster collaborations. Today, we are privileged to be joined by an illustrious lineup of speakers, a collective of visionaries, innovators, and thought leaders as well. And now, before we move forward, may I please request our team to play the community AV to give us a sneak peek into the world of BW Healthcare World. BW Businessworld, led by Dr. Anurag Batra, Chairman, and also the Editor-in-Chief of BW Businessworld and Exchange for Media Group, is the fastest growing business media house in the country. With a network spanning across 23 niche business communities and 8 magazines, BW Businessworld is proud to be entrenched in various verticals in the domestic as well as global business ecosystems. And with changing times, BW now has a massive readership in the digital space as well. BW in its portfolio has 23 niche B2B communities that organize conferences and also forums to facilitate interactions between sectoral business leaders and also create a conducive environment for collaboration. To keep yourself updated of all the developments, please subscribe to Business World Group magazines. I promise you, it will add to your professional quest for knowledge and also insights. The latest edition focuses on the year that 2024 holds for healthcare, whether it is M&A, quality, or tech advancements, including AI and also robotics. Now, this magazine covers aspects related to the business of healthcare. Also, it covers an overview of the deals that happened in 2023 and the trends that are suggestive for this year, that's 2024. Today's digital broadcast transcends the confines of these physical worlds as well, and it's time for all of us to also sort of adapt and acknowledge the digital world. You can all join us on our social media channels and also on the BW Healthcare World platforms and also on the website of www.bwhealthcareworld.in. That's also where we will be live. And now, may I please request our team to play today's event TV? That's all that we have for you today. And also, if you wish to share any of your insights, etc., on the online world, please do so. And also tag us. Also use the hashtag BW Healthcare Excellence Summit. Once again, a very warm welcome to all of you. And this summit wouldn't have been possible without the partnerships of all our partners, of also their confidence and the support. I also take this moment to thank all of them. Today's summit has been organized by BW Businessworld, our event sponsor BPL Medical Technologies Private Limited, a knowledge partner Samsung, a healthcare partner Lupin, a healthcare partner again Reliance Foundation Hospital, and event partners Joy Travels Private Limited, Fendrum, Beanley Coffee, JustBath.ai, The Thick Shake Factory, Reality Plus, Exchange for Media, IWM Buzz, Impact, and Pitch. May I please request our team to quickly play the partners AV?
A proud legacy, matched only by a pioneering spirit. We are BPL Medical Technologies, made by India for the world. We are defined by innovation, driven by quality, inspired by excellence. From launching the first color televisions in India, we have consistently been at the forefront of cutting-edge technological innovations. In 1967, we launched the first single-channel ECG machine in India. The 2013 investment by Goldman Sachs, along with a partnership with Korea's Alpinion in 2014, allowed us to consistently break the mold when it comes to excellence in manufacturing and early adoption of new technologies. Our strong presence both in India and across the globe ensures that we are up to date with the latest technologies. Our ISO 13485 certified manufacturing units in India are outfitted with the most reliable and advanced equipment, making us the benchmark for quality and service across the country. An expertise in state-of-the-art medical devices puts BPL Medical Technologies at the forefront of the healthcare industry.
We are very confident that we will definitely grow more than the market grows in terms of percentage, because our excitement, our overall direction to achieve BPL Medical as a #1 medical device company, as an Indian manufacturer, is very high.
Cardiology, critical care and surgery, women and child care, imaging, home care, and other consumables and accessories. Our portfolio, along with our large network of channel partners across the country, allows us to ensure customer satisfaction throughout their journey. We stand behind our promise to better lives every day. We believe in working towards a brighter India and a healthier India.
A big thank you again to our partners and our sponsor as well. And I want to formally welcome all of you Please join me in welcoming on stage the CEO of BW Healthcare World and also of BW Wellbeing World, Harbinder Narula, everybody, please.
Thank you, Aditya. So first of all, thank you so much for joining us this morning. And like Aditya said that, all these kind of events, conferences, seminars, they're not possible unless the industry comes forward and acknowledges the work that we are doing and supports. So first of all, thank you so much to all our sponsors uh, for making this possible. Second is, while we are this is our seventh excellence summit and awards that we are doing. 2 years ago, we took a conscious call to turn this into a bigger and better domain. So we started our magazine, we launched BW Healthcare World. We started doing our roundtables. We also became a prominent player when it comes to digital. And today, I want to express my gratitude to the industry for accepting us and helping us become a player of prominence. But apart from what we do, there's a lot of responsibility. Just yesterday, I was at a conference where we were talking about the role of media, and I was invited to speak. And one thing that came out was that when it comes to domain where healthcare and well-being is involved, there's a lot of responsibility that we need to have while we report, because people are creating perceptions, forming their opinions, and sometimes taking a call on what they should be doing based on what is being said in the media. Now, one of the things, I really wished Dr. Batra, who's the chairman of Businessworld, would have been here, but unfortunately, he came in very late last night from Dubai, so he'll be joining us a little later in the day. And I was wondering what I should be talking of rather than just saying welcome. I really wanted to urge the industry to take one thing and work on it jointly along with media. And this is a request which is from the doctors, with the industry, the pharma company, the medical equipment players. One thing that has changed over the last 3 or 4 decades in how the healthcare delivery is happening in India is that we have somewhere lost the trust of the patient in the healthcare system. And this is something which is imperative for all of us to work upon and bring back. Now, how do you do that? So while I was making my notes this morning, there were certain things that came into my mind, and one was the role that we are playing as a media player is the communication. I think there needs to be clearer communication so that people are able to understand the intent with which what is being said is being said. Second is, I think somewhere down the line, we have seen that there's a lack of transparency. And it is not because we don't want to be transparent, but it is because most of us do not have enough time. I mean, if you go to the doctors, the country that we are in, with the population pressure that we have and the number of patients who go to these care delivery, the doctors and the hospitals, the amount of pressure that they have, they're not able to devote as much time what they really wish to do with every patient. And the message that is going out is that, doctor kuch bata nahi rahe, transparency nahi hai. I think this is another area where we should focus on bringing efficiency in the healthcare delivery. So this is one of the topics that we are addressing today in the conference. And then is the empathy and compassion. I don't agree when we say कि आज empathy नहीं है, empathy है, लेकिन लोगों को दिख नहीं रही है. So I think that is where we need to focus on. We have so much of technology advancement that is happening today that sometimes we are not able to keep pace with it. We are all talking of AI, blockchain, ML. But what is happening is that it is also bringing certain challenges along with it. And some of the challenges are things like privacy and security of the patient. So I think that is what we need to take care of. Last but not the least is quality, the focus and emphasis on quality. Quality has always been there. Quality has always been the intent. Patient has always been the center of the healthcare delivery. But what is happening today is that, we are more focused on trying to get that certificate to acknowledge that what we are doing, we are equipped to give you the best quality. But what change that we need to bring is that post that certification, can the quality become the center of the focus of whatever we are doing? So that requires a mindset change. So these are some of the things that came into my mind, and I thought that, while I get this chance to be on the stage and speak to all of you, I emphasize on, our role that we can play in making all of these things a reality. And I feel that we can and we must do this now than later. With that, I'd like to welcome each one of you. Thank you so much for being here. Gratitude. Uh, with that, we'd like to kick off. We have very, very prominent speakers, industry thought leaders, which are going to be with us during the day. And we already have a very, very senior healthcare professional with us today. And so I will not take more time. Aditya, maybe we'd like to welcome our keynote speaker. Thank you so much.
Thank you. Thank you so much for setting the context, sir. And usually we don't do this, but today, our first keynote, our first session will straight away be the kickoff, because the topic for this is on the road to a new India, India healthcare story. And to talk on the same, please join me in welcoming on stage Dr. Ajay Swaroop, Chairman, Board of Management, Sir Ganga Ram Hospital.
Well, good morning, ladies and gentlemen. At the outset, I would like to thank the organizers of the 7th Business World Healthcare Excellence Summit and Awards for giving me this honor of delivering the keynote address for such a prestigious event. Ladies and gentlemen, I am a simple clinical specialist and ENT surgeon by profession, and now a hospital administrator managing the prestigious Sir Gangaram Hospital. I'm not going to give a PowerPoint presentation of statistics of the health spending, infrastructure addition, and government initiatives to put India on the road to New India as far as healthcare is concerned. I'm going to give you an overall scenario of what we were, what we are, and what we aim. India is known for its traditional medicine system. Ayurveda, Siddha, and Unani medical systems find mentions even in the ancient Vedas and other scriptures. The Ayurvedic concept appeared and developed between 2500 and 500 BC in India. Sushruta is one of the earliest known plastic surgeon of India with his own devised instruments, and you will be surprised when we study those instruments. They are comparable to what plastic surgeons use today, even today. However, unfortunately, for centuries, our system of medicine was non-recognizable, mainly because of no standardization and no evidence-based studies. However, ladies and gentlemen, today our generation stands on the cusp of healthcare revolution on various fronts. I would like now to dwell on the existing setup, the shortcomings and challenges. Culture, values, and institutional influence, health technology assessments, and economic evaluations in countries such as the United Kingdom and parts of Europe by affecting the organization of the healthcare system. Nevertheless, no such exists for low and middle income countries which are learning from these nations. India is an example of a country in which HTA is in the initial stages and its struggles might differ from those of other nations because of its cultural and political framework. In a country with dire healthcare needs and divisive inequality, delivering affordable and equitable healthcare is both a challenge and an opportunity. Poor funding and health insurance coverage characterize the current landscape of medical practice in India. The government has already dedicated on a global level to provide universal health coverage to its citizens. Recently, in 2018, it announced the Ayushman Bharat scheme to foster the implementation of universal health coverage. The establishment of a health technology assessment agency in India is crucial to achieve the goal of universal health coverage and to rationalize healthcare spending within constrained budgets or limited resources. In India, the political ideologies greatly influence health policies by affecting decisions related to technology, allocation of resources, and extent of healthcare accessibility to the citizens. Unfortunately, these political ideologies are also tied to caste and religion based needs. As India already faces the challenge of combating corruption and lack of regulation at all levels of governance, it is important to produce evidence based research and do it transparently. The second issue is that of regulatory frameworks, which is affected by the unregulated, uncoordinated, and diverse healthcare market in India. There is a wide availability of low cost alternative treatments and locally manufactured drugs and devices alongside imported treatments. Nevertheless, there is minimal clinical and economic evidence available on these generic medicines and alternative treatments. Thirdly, like in any other low and middle income country, India faces a lack of data on cost and quality of life related to health. The main reason is that healthcare data are often not recorded and rarely digitalized. One of the solutions to digitalize the recordings and make a collective data repository. To reduce the variability of clinical practice, poor diagnosis, irrational use of medicines, and understanding treatments, clear standardized guidelines are also important. Although there is a need to use the existing resources in a manner that maximizes health per every rupee spent, evidence based decisions making in a pluralistic society such as India is a challenge and requires a structure that incorporates and embraces diversity. Public health care is free to every Indian resident. The Indian public health sector encompasses 18% of total outpatient care and 44% of total inpatient care. However, middle and upper class individuals living in India tend to use private healthcare rather than the public healthcare. Additionally, women and elderly are also compelled to use public services. The public healthcare system was originally developed in order to provide a means to healthcare access, regardless of socioeconomic status or caste. However, reliance on public and private healthcare sectors varies significantly between states. Since health is a state subject, this is one of the dichotomy in our healthcare delivery system. The national health policy of the government was endorsed by the Parliament of India in 1983 and updated in 2002 and then again in 2017. The recent four main updates in 2017 mentions the need to focus on growing burden of non-communicable diseases, the emergence of robust healthcare industry, growing incidence of unsustainable expenditure due to healthcare costs, the rising economic growth enabling enhanced financial capacity. Furthermore, in the long term, the policy aims to set up India's goal to reform the current system to achieve universal healthcare. Now coming to financing, which as you all know, India ranks amongst one of the lowest in the world in terms of public expenditure on healthcare due to significant limitations in its workforce infrastructure, along with deficiencies in quality and availability of healthcare services. With a shortage of doctors and healthcare providers who are usually concentrated in urban environments, along with the already low government expenditure on health in India, a large percentage of the population is left unreserved by the Indian health system, which relies on out-of-pocket payment from patients to fund care. These payments hinder a lot of patients from being able to receive proper healthcare services. Despite being one of the most populous country, India has the largest private healthcare in the world. Out-of-pocket private payment makes up to 48% of the total expenditure on healthcare, while government and health insurance funds accounted for 62%. This is in stark contrast to other countries of the world. And according to the WHO in 2007, India ranked 184th out of 191 countries in the amount of public expenditure spent on healthcare out of total GDP. Now, this is a fact which is known to all of us, our policymakers. However, there are constraints, there are priorities, but this is one of the important aspect which has to be looked if we aim to achieve a universal health care for all Indians. Now, it's not that the government has not started a lot of programs. There is a National Health Protection Scheme. The ESI is looking after the health in the organized sector, and the government has a 12th plan to expand the National Rural Health Mission, the Pradhan Mantri Jan Arogya Yojana. And finally, the public and private partnership. This is one area where a lot of emphasis has to be laid, because I feel this is what is going to be the game changer for a country like India. Finally, the National Rural Telemedicine Network connects many healthcare institutions together so doctors and physicians can provide their inputs into diagnosis and consultation. This reduces the non-medical cost of transportation as patients do not have to travel to get specific doctors or specialists' opinion. However, this is again in an infancy stage and needs a lot of input technologically as well as financially for it to be meaningful. Now, India, all is not lost. India has emerged as a leader in global pharmaceutical industry, and the time has come for it to leverage its talent pool and cost advantages across the wider healthcare spectrum. What made all of us proud was the sheer resilience and commitment of our people, not just at the leadership level, but at every plant and operative level in the field in the grim days of COVID. In the worst of times, we had to remain open in terms of manufacturing to make products available, not only for India but around the world. India owns about 40% of world production. So to have facilities running and be able to supply products globally showed people's incredible commitment and resilience. Another issue in those 2 years was how we used new communication methods, infrastructure capabilities, and digitalization to be able to work more seamlessly. There was a big jump in the adoption of these capabilities, and this has become a way of life, allowing us to operate more effectively. Medical science, ladies and gentlemen, is moving towards a more biologically oriented model. There are more drugs coming out into the market, such as gene therapy, cell therapy, and CAR T therapy, that target specific or very rare diseases. These newer sciences are available globally, but at their price point, they have a limited market. Given the challenges, what happens with the rest of this world, this is where a great opportunity for Indian pharma companies. The other area is medical devices. Healthcare is growing globally, and countries need medical equipment and devices. Currently, most of the equipments are produced in the West. They are expensive, so many countries cannot afford it. India has done very well with pharma production, and the time has come for it to do similarly with medical devices. This is another big opportunity for the country's healthcare sector. India has always done research, but it is incremental. To get from incremental to fundamental research, we need a much larger research canvas. This has started to happen, and this is the way forwards. With regards to artificial intelligence, it is too early for us to understand the concept and the variants of what generative AI can do, but it is something which we must learn because research in the future may happen in this way. So, ladies and gentlemen, finally, in my opinion, Indian healthcare industry is entering its golden period, and that is because of government awakening for the concept of health for all, private penetration, pharma revolution, financing, and above all, the confidence of this generation is going to lead this story to a fairy tale ending. Thank you very much.
Thank you so much, sir, for doing that. The first session, I please request Harvinder sir to join us on stage and also present a token of love and appreciation to Dr. Suru, please. So that's a coffee book that the Healthcare World had published. Thank you so much, sir. Thank you, Arbindoji, for doing that. Thank you. And with that, it's time for our first panel discussion while just setting the stage. And after all our panel discussions and keynote sessions during the evening, we'll also have the award ceremony that's sort of bifurcated in two bits. The second bit are the institutional awards, and the first is for a few of our luminaries who've sort of been veterans in this industry. It's for them first, and then we shall proceed with the other bit. For the first panel discussion, it's on healthcare quality, culture beyond certification. While they're setting up the stage, I shall introduce the speakers of the same. Dr. Ajay Swarup, Chairman, Board of Management, Sir Gangaram Hospital. Urvashi Prasad, Director, Niti Ayog. Ma'am's just on her way from office. She had a meeting to take care of on an urgent basis. She will be joining us. Sunil K. Khetarpal, Director, AHPI, joining us virtually. Dr. Vijay Agarwal, President, KAHU, and also Dr. Kirti Chadda, Chief Scientific Officer and Group at CSR Metropolis Healthcare. And the moderator for this session will be Gaurav Tripathi, co-founder and group CTO, Plexus AG. Let's please welcome all our panelists who are present here and also virtually. Please. And Dr. Vijay and Dr. Kirti are joining us virtually. Can you also please check the mic and the camera, etc. team? Yep. Morning, Dr. Agarwal. Can you hear us?
Yes, I can hear you. I hope that you are able to hear me.
Yes, sir, loud and clear. Welcome.
Welcome. Thank you.
Dr. Chadda, can you hear us, ma'am? Let's just take 10-15 seconds more. Morning, ma'am. Can you hear us?
And hi, good morning. Loud and clear. Can you hear me?
Yes, ma'am. Loud and clear. So, we shall take this forward now.
Thank you. Thank you, Businessworld, for organizing this and having such a fantastic panel early in the morning itself. And I'm honored to have such a panel and where I'm asked to moderate, sitting with all the luminaries. Yeah, I'll try to first stick to the time. We have a lot to cover, but I'll make sure that we are able to get the best from them while making sure we don't exceed. Here at healthcare quality, when we look at, it's really how do we look at quality, and healthcare? It's really there are multiple parameters. It's not just safety. It's not just being patient centric. It's not just being on time. It's not just the effectiveness. And so that's where, as I see healthcare quality, it's a combination of a lot of factors which play together. And given that healthcare itself is so complex, and when we talk about healthcare delivery, the entire end-to-end healthcare, quality definitely is something which is looking at all dimensions. And that is what we are trying to cover in this panel with our esteemed panelists, that how do we look at healthcare quality and how do we ensure that we are really getting onto the top. Okay, I'll start. First question for you, Dr. Swaroop. As a leader in one of the India's premier healthcare institutions, Sir Gangaram Hospital, how do you define and cultivate a culture of quality beyond mere certification? It will be great if you can share any specific initiatives or practices implemented at your hospital that have contributed to fostering a culture of excellence in healthcare delivery.
Well, hello. Well, thank you very much for having me on this panel. Now, you see, quality, if we go by the textbook, there are definite parameters of health quality, ranging from infant mortality rate, maternal mortality rate, mental health, and so on and so forth. Now, in developed countries, these parameters have been given up, but unfortunately, we still in this country have to look at these basic parameters if we are talking of healthcare quality as a whole in the country. Now, since you have specifically said quality in Gangaram Hospital, that again changes the scenario, because firstly, it's a totally urban setup. It's one of the super specialty, multi-speciality hospital. So the quality parameters for us are slightly different from what it is to the rest of the country. Now, as far as we are concerned, quality starts as soon as the patient enters the hospital, and how he is received, what is the patient satisfaction, is there adequate digitalization, is there adequate technology which is available to the patient, because patients who come to our hospital or to comparative hospital are now very discerning, and the younger generation as well, you are part of it, are now so much dependent on technology that one of the quality parameters is how he is looked after, how his card is made, how his admission is handled, how he is directed to the hospital doctors. That is one of the, as far as now being the chairman, I feel that has become one of the paramount criterias of quality. So we start from the beginning. Then, of course, as far as medical specialists are concerned, there is no ambiguity about that. You have to have highly qualified, as far as possible, highly experienced doctors in various specialities and subspecialties. Now, as you are all aware, medicine, general medicine as we knew it 20 years ago does not exist. It has been subdivided into so many subspecialties: gastroenterology, pulmonology, hematology, etc., that quality is definitely on the rise, because all these people are super specialists. Apart from doing their MD medicine, they have super specialized in their subspecialties. So that is one aspect of healthcare professionals. Once the patient has been seen, we are, as you know, more dependent on diagnostics. And that is where quality again plays a very significant role. Diagnostics are the mainstay of our diagnosis and treatment. And The world of diagnostics is so dynamic that it is changing every minute, every second, and we have to keep abreast as far as possible within our limitations. But that is one big area where a quality control is a must. And as far as your last portion of what we have done, we are trying within our constraints of having the best of everything. And once you have the best, it is expected that quality will follow. So that is what is our initiative.
Thank you. Thank you, Dr. Sarup. I think when we talk about quality, definitely the certifications is what comes to the mind immediately. And that's where my first question to Urvashi is, how does Niti Aayog envision in fostering a cultural shift within healthcare institutions to look at or prioritize quality improvement beyond just the certifications?
Okay, so before I answer your question directly, I think just a couple of context setting sort of facts for the health system that we have in our country. So firstly, it's a very heterogeneous health system. When you talk of healthcare, you're not just talking of big hospitals, right? You're talking about all sorts of healthcare establishments, smaller establishments. You're talking of setups, clinics in the primary sector. So that is one layer of complexity that, it's a very, very heterogeneous space. The second is that there is still a lot of informality in our health sector. If you see the primary care in rural areas, it is still dominated by a lot of informal providers, or these are very small establishments, 2-bedded, 3-bedded, even in tier 2, tier 3. So we have that challenge, that layer of complexity which is added on. And that is why certification as a basic is very, very important, because, in healthcare, you have to meet at least certain basics. And I think that is what we're still grappling with a large part of our health system. These are not the organized big hospitals that we're talking about, right? We're talking about the much smaller establishments in smaller cities, towns, and rural areas as well. So we're still grappling there with the basics, and therefore certification, etc., is still very important. But I think we're also at the other end, where we have hospitals and healthcare facilities which are truly at the cutting edge. And I think there, of course, we're getting more sophisticated in how we are thinking about patient satisfaction. Now, again, this is the other unique thing about the healthcare sector, that, your customer is not a typical customer. There's a huge information asymmetry in this sector. So sometimes as a patient, I don't even really know, what does quality mean, right? Beyond the things of, okay, how easy is my registration, or how easy is it to access the doctor, or how much time does the doctor spend with me? So those are, of course, things that, most of us can sort of talk about. But beyond that, what does quality in healthcare entail is often very difficult for a lay person to, necessarily be able to judge and assess. So I think that is also an aspect that, we are focusing on. Is empowering patients themselves to better understand and be able to differentiate what is quality, what is not, in the healthcare space.
Thank you, Urvashi. Next question to Dr. Agrawal. As the president of Consortium of Accredited Healthcare Organizations, CAHO, what strategies does CAHO advocate to encourage healthcare institutions to embrace a culture of continuous quality improvement beyond just the accreditation requirements which are there?
Yeah. So good morning, and thank you, Businessworld, for having me here. See, I think the first thing is to understand the role that is being played by accreditation to promote patient safety and quality. And to understand this, let's realize that a country like United States, which have many like Gangaram hospitals and the top hospitals like ours, that is being represented by a country like United States. And in that country, and which is spending the GDP of my country on their healthcare, unlike we are in the lowest strata. And the preventable medical errors are the third leading cause of death in that country. So somewhere along the line, we have to understand that accreditation and patient safety probably are not going hand in hand. And like what Madam previous speaker said about quality, I think the major part of quality has to be linked to the preventable medical harm. And that's the focus that what we are trying to advocate is, first thing is the realization by the healthcare institutions that when they get accreditation, it is not the end of their quality journey, it is the beginning of their quality journey. Unfortunately, most hospitals are just trying to understand how do I get the stamp of accreditation, and therefore even those practices are given up soon after or 1 month after the accreditation is over. I had been the co-chair of the accreditation committee, and I can tell you almost every institution coming for re-accreditation or surveillance, instead of showing improvement, was showing deterioration. So I think the important thing is for us also to understand what is accreditation. Accreditation is an evaluation of your good practices. And we are not focusing on good practices in every department and function. Rather, we are focusing on how do I pass this exam. And that's why I'll say that probably the shift of focus, accreditation has given a very huge amount of, I would say, focus on the issue of patient safety. It has produced the whole breed of people whom we call as quality managers. But the quality in cardiology will not be practiced, cannot be done by that quality manager. That quality manager can only show him the mirror. And his position hierarchical is typically not that high. So we have to understand that let us try to focus on the issues of quality and patient safety. They are linked together to every department and every function. So for example, if we're coming to admission and discharge, it is mainly the front office manager, etc., who should drive this. While what is happening in cardiology, orthopedics, neurology, or any other specialty, and I think Ajay Sarup raised a very nice point regarding the infant mortality. Now, those are indicators for the public health issues, and that's where the country should be looking at how do I improve these in spite of my having such great hospitals. So my just simple take is, let's create focus on good practices rather than accreditation.
Thank you, Dr. Agarwal. Yes, focus on good practices. So that was Dr. Agarwal from the healthcare organization side. Moving on, let's look at the healthcare provider side. So to Mr. Khetrapal, as a director of Association of Healthcare Providers India, AHPI, how do you look at, how does AHPI promote a cultural transformation within the healthcare institutions, just going beyond the compliance or going beyond the regulations, and how does it emphasize a commitment to excellence in the patient care?
Yeah, thank you, Gaurav. Very good morning to all of you, and thank you, Businessworld, for the opportunity. First of all, I think I would just give you a brief about AHPI. AHPI is Association of Healthcare Providers India, and we are a society, not-for-profit organization, and we represent majority of private healthcare institutions in the country. We have 20 state chapters, that is AHPI state chapters, and across the country we have approximately 20,000 hospitals as members. So AHPI is basically, the main forte is we are into advocacy, capacity building, training, and various other things. Now, to bring a cultural transformation, what we need, most importantly, we need to involve the leaders. Not only leaders' commitment and leadership engagement. Leadership engagement is the most important aspect, which until and unless there is a commitment from the leadership or the leaders are engaged, you cannot bring a cultural change. And secondly, of course, the educational programs. You need to have educational programs within the organization and across the healthcare. Third thing is the quality improvement initiatives. As Dr. Agrawal also mentioned that after certification, after achieving certification or accreditation, you become relaxed, and then people think that it is only the job of the quality manager. So everybody becomes complacent, and they are relaxed. So I think even after you achieve accreditation, that culture has to, quality culture has to be imbibed. It has to be among all the at all levels of staff, and you need to keep on it, because quality is not a one-time affair. It is not a one-time process. You achieve it and then you forget it, but then you need to continuously work towards it and always strive for continuous quality improvement. And another most important thing is that patient engagement and patient feedback. See, if you want to create a culture of quality in the organization, it is very important that you continuously, interact with the patient, you engage you take the regular feedback. Those feedbacks help you to improve. It is not that, anybody, feedback can be a positive feedback, can be a negative feedback, or it can be a comment. So feedbacks are very important. Patient engagement and patient feedback. Then another thing is, somebody who is doing good and you need to pat at his back. So likewise, if somebody is not doing good, so bouquets and big bats, both are important. And awards and recognition for those who are doing good in the organization, so they continue to maintain the culture of quality. And another thing is the collaboration with the stakeholders and knowledge sharing best practices among the hospitals, among the stakeholders, also help you to improve the culture of quality. And lastly, I would say that the ethical standards and professionalism, it is very, very important. So what is a culture of quality? A culture is nothing but your values, your beliefs, your behavior. This is what a culture is. So culture of quality, we talk not only of quality and safety, they go together. Dr. Vijay Agarwal also mentioned, because they are at the core, core of your organization, quality and safety. So ethical standards, following, and addressing the ethical dilemmas in the institute, and maintaining professionalism by each and every staff, especially by the doctors. So these are very, very important to, maintain the cultural and bring the cultural transformation in the organization.
Thank you, Mr. Ketpal. Yes, maintaining the culture of quality, that's important. Moving on, let's look at a specific organization that way. So Dr. Kirti, as a representative of Metropolis Healthcare, how does your organization foster a culture that values quality and works towards continuous improvement in the diagnostic services beyond just meeting the accreditation standards?
Yeah, so thank you for this opportunity, and happy to share our thoughts. So as everybody said, all the esteemed panelists made some very cutting points. Somebody spoke about super specialty, somebody spoke about, just accreditation not being the end, but being the beginning. Someone spoke about, bouquets and brickbats. But so that's what Metropolis has done, right? We've taken the bull by the horn, and we have something called as a complaint meeting or a customer first meeting or a patient first meeting every month. It was started by Dr. Sushil Shah, chairman, 40 years back, and we continue to live that legacy. Now, what happens in that, as was rightly pointed out by many of my co-panelists, that sometimes you may put all the systems in place. You may be having the excellent quality metrics. You may be having excellent quality indicators. You may be having a 0 NC audit. You may be having, 5, 6 accreditations to your credit. And still a patient is unhappy, or a doctor is unhappy, or a report has not gone on time or not gone right, or a service has not been rendered correctly. And, the quality has not been maintained. The sublime quality has not been maintained. And somebody raises a voice, and says, look here, you didn't do a good job with my, patient or with me. One thing is to just ignore it, right? And say, push it under the carpet and say, hey, we have excellent quality. We are, accredited. We have these quality indicators or whatever. And the other thing is to say that, no, we hear you and we will look into the matter and we will get back to you. Okay, so what we do is that we have a session every month wherein we take in from all the cross functions, whether it was a pre-analytical, analytical, post-analytical, whether it was related just a perception or there was actually an error, or whether it was related to a kit not being available or to a home visit not being done on time or to an amended report being released or an addendum report being released, anywhere where there has been a deviation from the quality metrics, from the quality line, it gets called out. And it doesn't get called out in a bad manner. It gets called out in a good manner that, look, there was a problem. Either we need to look at the process, or we need to look at the person, or we need to look at the training. The talent, is the right talent on the ground? Has the talent been trained? Has the talent been sensitized to what the requirement is? And then are we able to deliver the quality that we have got a star for? So just having an NABL logo or a CAP logo, but are you following all those indices every day when no one is watching? And that can only come out when you address the complaints and you look at them, as was rightly said. And one last point I'd like to make, that in our company, quality is not at the bottom or in the side. It's a very big hierarchical position. We have Chief Quality Officer, Dr. Puneet, my colleague, and I'm the Chief Scientific Officer, and Dr. Nilesh, the Chief of Science and Innovation Quality. So we are in the CXO team. So the leadership has got the quality head. So there is no way quality can get ignored in Metropolis, because in the leadership, 3 people are actually driving quality. Yeah. So that's my humble submission.
Thank you. Thank you, Dr. Kirti. So, we looked at what we got the inputs as the culture and how that culture is really moving inside the organization around quality. Moving to how to actually get that culture moving, and how do you really get it done? So, Dr. Sarup, beyond the compliances, what role do you believe that leadership and culture can really play in the continuous quality improvement? And how do you empower and engage the actual healthcare providers, the frontline workers in picking up and championing this culture of excellence and accountability?
Well, we've just been told very clearly by the lady that we've got to have leaders in position who are ensuring quality, rather than calling them, managers or something of that sort. They should be the directors, because just having a standard operating procedure in place and getting accreditation is not enough if people are not following it. And how do you ensure that people follow standard SOPs? One method is that you try to get everybody on board, hammer the importance of quality, so that starting from the lowest person who's wheeling in the patient to the highest person who's looking after the patient, they are all sensitized that there is a concept of quality, and that has to be nurtured, nourished. So that is, I feel, the best way to ensure quality in any organization. And of course, there is the other flip side to is that you have a little strictness. People, as they set carrot and stick policy, people who are departments who are adhering to good practices should be recognized, should be rewarded, while people who are lagging behind have to be initially counseled, and then, well, I should not say it, we go a step further and ask them to either improve or leave. So that is how, in fact, it is a constant struggle. It is a constant struggle for every or any organization. Leave aside healthcare. It is very important in healthcare, but that is true for any organization anywhere in the world, that you've got to maintain quality. Just having once a certification is not enough, because that has no meaning. These certifications are meant to tell you that these are the standard indicators of quality. Now, how you follow them, how you implement them is up to the organization. I mean, you've been certified and you're going to be recertified after 3 years, but that doesn't mean that in that intervening period you keep on doing whatever you feel like. You've got to keep on improving. In fact, as one of the speakers said, once you are reassessed, then majority of the negative points should have been closed by that time, and no new fallacies should have crept in. That is the whole purpose, and that will denote which organization is genuinely following the concept of quality, or which doesn't just wants the emblems on their pad. So it's a continuous process. It's a continuous process, and what methodology you adopt is, well, it depends on the top leadership.
Thank you. Thank you, Dr. Sarup. Going to the policy side, is there anything that can be really looked at from a policy level? So, Ms. Urvashi, can you elaborate on any specific policy interventions or incentives that Niti Aayog is considering to promote this holistic culture of healthcare quality across public and private providers?
Yeah, so, like I said, that given our heterogeneity, even the interventions, have to depend on what type of provider we're talking about, what level of the health system, and there's obviously different kinds of initiatives catered to each of these. So if I see within the public sector, if we just look at the primary care level, which is I think a very important level, and should become an even more important level for the country, because you can't care for such a large population only through hospitals. So I think if the primary care facilities, we have brought in a lot of these guidelines. For instance, there's a Kayakalp, it's something called a Kayakalp guideline, where through a process of it might be the basics, but like I said, in a lot of these facilities we are still grappling at the basics. We are trying to bring about an improvement in the general atmosphere of these facilities, and the quality of services, and of course the safety of patients, which is the ultimate really in a healthcare setting. And interestingly, we do use rewards and recognition and incentivization through these guidelines, and to what extent facilities are adhering to these guidelines, and we've seen fairly significant improvements in many of the facilities, because after we have started actually putting these in place and monitoring. So I think that is definitely a route that we are taking. We have a separate initiative for district hospitals, and there we have also built in patient satisfaction. So through mobile applications, we have something called Mera Aspatal, where people can actually provide their feedback. I mean, that is something we're still building on, and we keep improving that. But the idea is that you can provide feedback on district hospitals, and in fact, Niti Aayog has done a fairly rigorous assessment of all these hospitals. We haven't necessarily put out a ranking, because we're still seeing what makes sense, and sometimes it's hard to compare like for like across states, across the size of these hospitals. Various factors are there. But we've certainly done a very rigorous assessment, and we provided that feedback to states. So that's happening, at the district hospital level. So I think at each level we have separate kinds of initiatives. But like I said, we're still grappling with a lot of the basics in a large part, of our country still, especially at the primary, care level. And I think we need to have significant improvements there. But also, I think, obviously, when you talk about quality in healthcare, you cannot talk about it without addressing the quality of health personnel, the medical personnel. So that is also something that policies, do have a direct impact on. That, we're obviously trying to produce not just more qualified health personnel, but also those with better quality. Because that is again a big challenge in many parts of the country. So equipment, medical equipment, the kind of devices we are using, the standardization, so I think there's so many different aspects when you say quality, and policies are impacting all of these, and we have different kinds of initiatives for each of these. I think for the private sector, like I said, where it's informal or it's still pretty small, it's unorganized, there I think we have a real challenge, because the larger, more formal, more organized setups, they anyway have a clear incentive to, also provide better quality, and they have the systems and processes by and large in place, or they will be in place by virtue of even just learning from each other. But I think the smaller establishments, the more informal ones, we still have a big challenge, because those are still providing healthcare to large parts of the population. So I think that's where we haven't fully found all the solutions yet. But we're certainly focusing on that, and we're seeing how we can integrate those setups with the overall health system.
Thank you. Given, again, we are talking about the culture and how do we percolate it, Dr. Agarwal, if you can cite some examples of any innovative approaches or best practices that CAHO has observed or promoted to foster this culture of quality improvement within the organizations.
Yeah, well, there are many, but I'll just say before I come to the point that, for example, Dr. Ajay Swaroop mentioned that when, for example, somebody is not following practices, good practices, they may even come to a level when you may have to ask that person to leave. But the ground root reality today is that we have such dearth of specialists and the doctors all across the country that even if you are leaving one institution, he's going to be working in another institution and doing the same practice. So the issue is this, that today we have to still, I must congratulate that already the number of postgraduate seats have increased in the recent past. However, I think this whole issue has to be looked at still much more seriously, that we do not have enough number of specialists and the doctors, and their working conditions are under so much stress that today there is a decline in the number of people who are coming to take up the medical profession. So that's altogether a different thing, and it will hugely impact the way we are kind of practicing or doing anything. As regarding what we are able to do is, first of all, to understand that at one time the healthcare delivery was only an issue between the doctor and the patient. Now it has become a multi-stakeholder delivery. It has become like a teamwork. And therefore, every department and every function, and you see every product in the hospital is a different product. It is like, somebody who is coming for a delivery has different expectations, different problems as compared to, let's say, a person who is coming for a knee replacement or who is coming for an ENT checkup. While, one is trying to bring everything together under one kind, as if there is a kind of a common product that I am trying to kind of deliver. It is not. It is, everything is different. And therefore, we have been promoting that there have to be a monthly departmental and functional meeting in every department. So say that they understand what are the nuances of their department, what are the feedback from their department, and to start working on it. So these are the areas. where there has been no scope of capacity building, leave aside big institutions, especially in hundreds and thousands of small standalone hospitals, they had no area of capacity building. So KAHO has worked towards bringing a whole army of people who are trained into various aspects of these functions. And therefore, today we run more than 45 training programs, which are very, very well adopted and recognized. We hold a number of annual conventions. And over a period of time, we can say that we have been able to inculcate quality and patient safety as a very distinct discipline beyond accreditation. So we are working, for example, we have been holding monthly webinar on every first Tuesday at 5 p.m. with ISQA. ISQA is the International Society for Quality, which does the accreditation of the accreditation bodies. So there is a KAHO ISQA webinar on every first Tuesday, and we have requested hospitals to start making every first Tuesday, 5 p.m. as a monthly quality meeting, where they should call people from their other departments. They can start listening to the concepts of quality, and even the nearby small hospitals. So we need to reach out to each and every segment of the healthcare engineers, nurses, doctors, technicians, paramedics, and reach out to them to sensitize them about the issues of patient quality. And that's what we are doing.
Thank you, Dr. Agrawal. We have run out of that time, but can we have 5 more minutes or? Yeah, I'll just wrap up. Okay. So very quickly, Mr. Ketapal, if you can tell us on how AHPI is looking to collaborate with other stakeholders, whether it is government agencies, industry associations, patient advocacy groups, and everybody to have this culture of healthcare quality improvement across the system.
First of all, I would like to say that we are not looking to collaborate. We have already collaborated with various stakeholders, because it is an era of collaboration. You need to involve people and you need to work hand in hand. So AHPI has collaborated with various industry partners, with the government, and with the accreditation body like NABH. With the AHPI advocacy, we have been successful in implementing this QR code on the 300 essential drugs, which ensures patient safety. Then we have also collaborated AHPI and ISRO collaboration. So we are working on doing a study on air quality monitoring using the space inputs. We are working with ISRO. So this is a collaboration. Then we, Quality Council of India, under its board, NABET, National Accreditation Board for Education and Training. So they involved AHPI in providing resources for conducting assessment of nursing and paramedical institutions in the state of Uttar Pradesh. That is, for grading of the institutions. There are about 700 of nursing and paramedic institutions in the UP district, in UP, across all the districts. So we provided them resources. This is again a collaboration. And then, of course, AHPI is part of various high-powered committees, a committee, quality steering committee set up by the National Health Authority. AHPI is a part of it, and AHPI is a part of technical committee on grading of hospitals, which committee is constituted by NABH. Dr. Alexander Thomas, our past president, he is the chairman of that committee. And then we have, again, AHPI is a part of the BIS committee, technical committee of BIS on health and sports and fitness. So AHPI is that way, even training sessions. We have conducted various training sessions across all the, healthcare ecosystem on various modules like healthcare quality, nursing excellence, infection control, communication in healthcare. So this is how we involve stakeholders and work together. And also, of course, we promote accreditation among our member hospitals, NABH accreditation.
Thank you, Mr. Ketpal. So, final question to Dr. Chadda is how do you look at the main challenges that you see in promoting and sustaining the culture of quality improvement in the healthcare sector? So from Metropolis perspective as well as in general, and how do you propose overcoming these challenges?
Yeah, so the challenges are diverse, right? First thing somebody brought about talent. Talent is very, very important because if your basic education, your basic experience, and your basic, this thing is not all right, then you are not going to be able to. If you don't have that knowledge, only you're not going to be able to display this thing. That's why the whole concept of having specific people for specific needs is very important. Secondly, their orientation toward the job at hand, what the requirement is, that is very important. So we have something called as an M-Parichaya, in which we acclimatize the person to what he's supposed to be doing. We have something called as an M-Buddy, in which the person is, sort of held, by the a buddy that, look, this is your job really. And then, we have something called as a Net Promoter Score, by which we actually come to know the promoters, the detractors, and it helps us to, again, clinch what was the real problem and what is the real solution. So as I said, we go very aggressive in this because there is no other way. You have to be aggressive in your pursuit of quality, and you have to have very clear quality indicators, risk assessment scores, net promoter score, which is actually telling you what is the requirement. So I think aggression followed by good indices and leadership roles taking on the quest for quality. And filling the talent positions, not at all, compromising over there, and then putting them on a constant learning management modules. We have something called as a LMS and a skill development. So constant skill development is also very, very important. So yeah, that's the key.
Thank you, Dr. Chadda. So we've heard the panelists. I think if I try to just summarize it quickly, so quality starts the moment a patient walks into the hospital, and it's not something which is done for a day for passing the exam. It's something which needs to be there, evident, and being practiced every single day, every single hour at institutions. And to enable that and to really get that going, what we hear is need to be the culture, and that culture, for promoting that culture of quality, it really needs to come top down from the leadership, and of course taking into account the capacity building and the right trainings that is required for the workforce, whether it is frontline or even at the mid level leadership. So I think that we have a good takeaways from the panel, and I'm hopeful that everybody who is listening to it now or later will come across, we'll see how we can really take up these points and get our healthcare ecosystem to that desired quality. Thank you, all the esteemed panelists, and thank you to Businessworld once again for organizing this. Thank you.
Thank you.
Thank you so much. May I please request Chandrasekhar Sibbalji, Senior VP, Fujifilm India, to please join us on stage and present a token of appreciation to all our panelists and also our moderator. Also, a big thank you to Dr. Vijay Agarwal and Dr. Kirti for joining us virtually.
Our pleasure.
Thank you. Thank you so much. You're leaving.
Also, thank you so much, Gaurav, for moderating that. Thank you. A picture, please. A group picture, please. Please come. Thank you. Thank you so much. Thank you. Thank you. And with that, quickly let's move ahead with the next panel discussion, which is on focusing on predictability leading to prevention, AI and genomics. And to talk on the same and to share the views as well, please join me in welcoming our next set of panelists. Okay. Dr. Harsh Mahajan, founder and CEO of Mahajan Imaging, Chandrasekhar Sibbal, a senior VP, Fujifilm India, Anand K, MD and CEO of Ageless Diagnostics, and this session will be moderated by Dr. Arjun Dang, CEO of Dr. Dang's Lab. Let's please welcome them, ladies and gentlemen. Thank you so much. Arjun, we'll just wait for them to settle down. Can my team just help our audience members to settle down, please? So we can then start. Please.
Hi everyone. Super excited today for a phenomenal day yet again organized by Businessworld. A big thank you to the organizing committee and for having me here and giving me the privilege and honor to be moderating a panel that is full of stalwarts from the healthcare industry. And super excited to be attending the sessions today and also for this particular session. And before I begin, just a background to the topic that we have. And the healthcare landscape is undergoing a significant transformation. And like all of us know, being driven by AI and genomics. And this powerful combination holds immense potential to revolutionize preventive healthcare, enabling early disease detection and personalized risk assessment. What I actually feel, and when I saw the topic, more than predicting disease, it's actually assessing the risk of various diseases. And that is what all of us have seen and learned in the entire diagnostics domain. And without much ado, I'll quickly start with my questions. And my first question is to Dr. Harsh Mahajan, sir. And sir, a recent study that was published in Nature found that AI algorithms could outperform radiologists literally in detecting breast cancers on mammograms. And a study in the Lancet also endorses that AI and radiologists working hand in hand work better than either of them. Obviously, with Vidur and Kapil and the great work that you've done, how do you see AI-powered tool impacting individual disease risk prediction?
Thank you very much, Arjun, and thank you to the organizers for having me here. Now, AI is coming in every facet of life, and in radiology, in the healthcare scenario, because radiology has been digital since 3 decades or more, it was but natural that it would be radiology which would be the initial focus. You talked about these publications in the Lancet. It may really surprise a few who are in the audience to know that the first paper in the Lancet on AI actually came from India. This was way back in 2018 from our group along with our collaborators, Cure.ai out of Mumbai. And this was on head CT scans. So the very first. So now coming to your specific question, there is no doubt that a radiologist, maybe not at the present point of time because the science is still evolving, but a radiologist with AI will definitely replace a radiologist who doesn't use AI. There are certain aspects of AI, and you alluded to X-ray mammograms. Also, we know for chest X-ray, there is a recent paper in which we were a part out of Mass General, Harvard Medical School, which showed that AI was able to pick up missed findings on chest X-rays from multiple. This was a multi-centric study. So one thing is definite, that use of AI for a radiologist will make an average radiologist good, will make a good radiologist better, and the better one excellent. And not only would it improve accuracy, it has also been shown that it will improve productivity. So today, if I'm able to report 25 or 30 MRI scans, going forward with the use of AI, it actually acting as an assistant to begin with, and maybe over time being able to take away some of my workload, normal versus abnormal. I may be able to report 100 scans. The idea is that I should be able to report 500, something in the field of pathology, where today a pathologist signs out 5,000 reports without worrying about accuracy, quality of the result. So that is where radiology is going. And I do feel that it is going to become a part and parcel, not only of radiology, also of histopathology, which is already beginning, and maybe also for the clinicians in decision making support systems, and ultimately maybe becoming better than the physician based on all the data that is available, to make sense of that data and draw conclusions from it. Thank you.
So very relevant. I always look up to you when you speak, and you speak so well. But actually, just to put it in a nutshell, throughput and accuracy. And I think as long as we achieve both of those with AI. Recently, sir, I was in a restaurant where they had this thing that is a swok. That's basically a fork with rounded edges. So basically, it's something like that. It's like an assistant, it's like a doctor's nurse, but at the end of the day, it enhances patient care and gets the job done easily, and even faster.
It actually will, we hope, it'll democratize healthcare, take it far and wide, take it to areas which are underserved, even in our country and in other parts of the world, and also at the same time be able to reduce costs, which is very, very important, because affordability is a big issue in many parts of the world.
Especially in our country, sir. You're absolutely right. Thank you. Thank you for that. So coming next to Mr. Chandrasekhar Sibal, sir. And sir, recently I was blown away. I had the privilege of visiting Noora. And I think that is one of Fuji Film's investments in Gurgaon, apart from the few others in India. And I was completely blown away with the concept of going there, and the kind of patient care, the hospitality, and obviously the kind of services that are being provided there. Recently, there was a survey by Accenture that found that 70% of healthcare executives believe AI has the potential to revolutionize preventive care. I think Noora is a great example, but still, I think in a country like ours, there are certain challenges that hinder the adoption of AI and genomics as well. So, your thoughts on this, and please enlighten us about this topic.
Yeah, so as Dr. Hirsch is sitting just next to us, he is a pioneer in this field, and thank you very much for calling me on this panel. And AI is definitely now going to be the most important thing for any of the screening things. As you know that we are doing in Neura, all the reports are through AI, whether it is calcium scoring, whether it is a breast examination or a mammography. So similarly, we are doing for the mass screening programs in India. What we are doing is that NTB program of Government of India. We are participating in a full way, and where our vans are going, taking X-rays, and there and then with the help of Cure, this thing, our system is inbuilt with that DR, and it will tell you whether it is positive or a negative, whether it has a TB percentage, what percentage chances are there of having the TB, and then they will go for a gene expert test. So for the mass screening program, this is going to be a very, very big thing. And a country like India, because as Dr. Hirsch will also agree with me, earlier there was nobody used to see those X-rays, because X-ray reporting was very difficult actually. One of the most difficult. People are now able to do one CT, MRI, these are fancy things. But reporting X-ray was like young people were not happy reporting also. Many of the X-rays, chest X-rays go unreported also. As Dr. Saab has also said, there is a study in Mass Journal which they have told that there was a this thing. So basically, missed findings are there. So I feel that AI is going to revolutionize this field, and a lot of developments are happening, and mainly the early detection. Because in India, the major problem is there that we are getting a disease or the cancer is detected when it is a third or fourth stage. And in developed countries where these systematic screening programs are there, Japan, Europe, or US, there the cancers are detected very early stage and they are manageable. So a lot of cost savings will be there for the patient. Patient well-being will be there. Early detection of the disease will be there. So this is going to revolutionize, but it is going to take some time because there are certain challenges of adoption. There has to be a good software. There has to be a lot of resources with the hospital, those teleradiology, or you can say that PACS systems and proper storing of the data. So all those things has to be a prerequisite as a basic thing. Because right now we do not have, many of our hospitals do not have the good quality PACS and a risk system. Unless you have that, and it will require more resources of the computers and computing platforms over that. So it will increase the cost initially, but when it comes to the masses, when you divide it into the number of patients, it will give you a lot of profitability. And as Dr. Saab has also said that one doctor can, earlier you can say that now in India there are 300 and 400 radiologists who do the breast imaging dedicatedly. But India requires 10,000 radiologists if we have to have a mass program. But it is not possible to develop 10,000 radiologists and doing only the practice of breast radiology. So AI is the only solution which can give you the faster, and one radiologist can do a job of 100 radiologists. So that's what AI is going to change.
Great, definitely. I completely agree. And I'll come back to maybe a few questions on the data that we collect from this and the patient privacy as well. But going next to Mr. Anand from Agilus. So this morning only, I read an article in the newspaper where it said how the preventive healthcare domain is giving wings to the industry, and there is a probable increase in the people going for preventive checks as well. I think the elephant in the room in our industry is that the industry is obviously getting commoditized to a certain extent. Keeping that in mind and keeping the increased awareness that people have, and also now the dawn of AI and genomics that obviously labs such as yours are going to are already doing. What do you think that, how do you think that AI and genomics will reshape preventive healthcare and empower individuals to manage their health more proactively?
Thank you, Arjun. Thank you, Arjun. Thank you for the question, and also thank you, Businessworld, for this opportunity. I think as we talked about both preventive testing. So preventive testing, if you see, it's about 20% of the overall pathology industry as of today, as of FY23. And we are seeing that it is growing at the rate of about 14 to 15% year on year. And this is probably the fastest growing segment of the industry. So when we talk about preventive testing and predictive testing, so there are two different categories of testing which happens. So the largely what we see today in India is a preventive testing. Preventive testing is basically an tool of early detection. So whatever we do in preventive testing is not some new test. It's the same test that you're trying to use it in a healthy individual. So it's more about early detection of a disease. But when we talk about how we use AI and genomics, so there is an element of thing called predictive testing, which rather than just detecting a disease early, we are talking about a genetic predisposition to a particular disease. So when we think on those lines, we are quite far in terms of where we go as far as predictive testing is concerned. And that's where genomics plays a major role. Today, if you see, genomics in India is primarily used more in diagnostics and prognostic care rather than in the predictive genomics, even though there is a lot of interest and a lot of work is happening on that side, but still, there are a lot of apprehensions in terms of how we interpret those reports and how these can be used forward. A Mayo Clinic study recently, it showed that, 1 in 8 of people who tested for predictive genomics reported some predisposition. So which means there is something which can really help in improving the overall population health if we can do it in a much bigger way. When we talk about the future, how do we take this forward? One of the key factors in genomics, as you know, is the cost of testing. So as we know, why the sequencing is getting, more economical, we are able to have better sequencing and larger data sets with lesser cost. So this itself is going to help us in, bringing this to more general masses, as well as, how much of data we generate is going to help us with all the AI that we can do on the data to come to those kind of, creating those tables that will help us in analyzing the data in a better way. So I think these are the important factors as far as AI and genomics are concerned, especially in the predictive and preventive testing.
Thank you, sir. I think all of us have experienced the previous decade where, like you said, genomics was more in oncology, and that's where it really started. But I also feel that the predictive part of genomics, people understanding, more importantly, physicians understanding what predisposition is, what are the measures are there to be taken. I think the famous Angelina Jolie story with the BRCA positive created a lot of awareness, but I think the country still needs certain leaps, needs to grow by leaps and bounds in that direction. So, Harsh sir, my next question is to you. And so again, referring to a report by McKinsey, showed that the potential of combining genomics and AI for preventive healthcare. Obviously, you have again been a pioneer in that integrated medicine and integrated centers and diagnostics that Margin Imaging has. But with genomics and imaging rapidly evolving, how can their integration benefit preventive healthcare? Also, sir, I see that a lot of AI companies, startups now are looking at globally to expand their footprint and doing business development prospects abroad. And I wonder, in a country like India, where, like you said, last mile delivery is a challenge, there's so much population, so many doctors, why is India not a hotspot for this? Is it the affordability, or is it the accessibility, or the acceptance?
These are both great questions. And let me take the second one first. I think in India, affordability is the major problem. When we talk of a population of 1.4 billion, 40% of them are able to afford very little. Even 2 square meals a day is a challenge. And so you have only a top maybe 1 or 2% where you could think of them being able to afford almost everything. That's point number one. Point number two, somehow technology or learnings or teachings which come from the West are much more readily accepted in our country. Maybe we are still trying to get out of the hangover of our colonial masters, and I'm sure the younger generation would be out of that very quickly. Third, also the infrastructure for taking all this to tier 2, tier 3 is really impossible when we are still struggling at the primary healthcare level in most of our districts to think that genomics could somehow be taken up at or AI could be taken up at the peripheral level very immediately is very difficult. And that's why somehow the startups are building in India, but building for the world. And maybe at some point of time, the technology would translate down, 2, 3, 4, 5 years down the line. Coming to your first question, and many of these youngsters are doing very well. Coming to your first question, which was how genomics and imaging can play a role together. And we did build 2 years ago a center of integrated diagnostics in this city, where we have tried to integrate a path lab with all the blood tests, with imaging, along with genomics, nuclear medicine, So the entire, armamentarium that is available in diagnostics under one roof, and how is it going to be useful? Genomics, especially when we talk at a population level, or even if we come down to those at high risk for genetic diseases, especially cancers, also maybe, dementias, Alzheimer's, heart disease, renal disease. We know that a large part of these diseases can be genetic. And so just envisage a scenario where out of the 1.4 billion population, suppose a genome testing was 100 rupees or 500 rupees, and the government decided that we are going to run a genomics test looking for those at high risk across the entire population. And out of those 1.4 billion, you're able to pick up 50 million people who are at high risk for cancer. Then you have divided your population into two categories, one at average risk for cancer and the others at high risk for cancer. And once you've picked up these high risk people, you subject them to whatever be the best test for picking up cancer early. Mammography in women, maybe even ultrasound of the abdomen, low dose CT for lung cancer. So your resources could be much better spent. And as Shekhar said, we could pick up cancer early in stage 1, stage 2, maybe even at a very, very early nascent stage where they can be cured. Today, we are picking them up at stage 3, stage 4, where the cure is really in terms of 5-year survival, 10-year survival, and also the morbidity, the costs. So, in preventive healthcare, predictive medicine through genomics could play a major, major role, and tie to that screening, which is done very religiously in those at high risk. I'm not saying that we don't screen those at average risk, because sporadic cancers are the majority of cancers, but those that are at high risk, we can certainly screen them much more diligently, and actually the healthcare system would end up spending lesser if we were to be able to pick these up. Having said that, is genomics the only way to pick up those at high risk? No. There are so many factors: family history of cancer, family history of heart disease, family history of dementia. All of these can also be used to pick up those at high risk, till such time that genome testing becomes so readily available and affordable that anyone could, come into one of our labs and say, "Doc, I want to get this done. And if I'm at high risk, tell me what are the tests to be done." But the future certainly is about integrated diagnostics. We cannot continue to work in silos, and a health check cannot just be testing for blood. And that's it, you've done it. Also, when we talk in terms of health checks, somehow the way it has been till now, these were always done within hospitals and done at very, very low rates, done on equipments which may not be the best, done by juniors who may not be the best. I think for health checks, you need the best equipment, you need the best people to read those scans. Maybe AI in the years to come will play a role in it, but it should not be dismissed as it is, as a silver test. We got silver, health check done for our low-level staff, and golden one for the higher level, medium level managers, and a platinum one for those at the top. I think what genomics risk assessment will also bring in the concept of personalized health checks, doing what is right for the person based on family history, past history of illness, present history of illness, so that the correct testing is done and not everyone being whitewashed with the same brush. Thank you.
Absolutely, sir. I completely agree. One size doesn't fit all, and I think it's tailor making these tests to best get the output of these tests. And so, sir, my next question is to you, Shekhar, sir. And it is often predicted that AI-powered imaging will play a very crucial role, like Mahajan sir has also said. And for example, AI could analyze retinal scans to identify individuals at risk for diabetic retinopathy before symptoms even appear? And what specific advancements do you feel like we already know what is happening in the AI-driven medical imaging world right now? But in the years to come, what do you anticipate is really going to be? What are the disease areas that are going to be worked upon? And what can we expect even from Fujifilm, that's a leader in the space, for the years to come?
Yeah, so we are working and putting a lot of money on developing the AI applications, and we are putting generative AIs and many kind of techniques and all the modalities now. If you take CT scanner or MRI or you take a mammography, in MRI especially, what we are doing is to reduce the scan time, because the most important thing is the patient inside the gantry. The time has to reduce and the openness has to improve. So that time, you can do more patients if you have more time. So in MR, what we are trying to do is to have the better image quality in a lesser time. Each sequences, we are trying to reduce those times. Similarly, CT, we are having many protocols for stroke protocols, etc. When a patient comes and if he has been given a faster treatment, then life can be saved. Similarly, on the chest X-rays, for in the ICUs, when you have a mobile X-ray, there, if you have certain softwares, you can immediately tell, and the doctor can be alerted from mobile X-ray itself that this person has a more problem, and you have to attend to this person. So, in each and every modality, in mammography, in chest X-rays, for early detection, for the screening, so lot of work is being done, and now we also feel that machines, the doctors will take those machines only which are AI-enabled machines. Otherwise, there will be no distinguishing. Suppose I have a mammography machines, GE has, Siemens have, Philips have, but which machine they will be preferring? They will be preferring a machine which can give a faster faster diagnosis, which is able to give them more patients at a better image quality. So those machines will be preferred. So now we are trying to put all those softwares into the machines and bundle that and try to sell it to the doctors. So this is what our endeavor is, whether it is in the screening for mammography, whether it is the MRI, whether it is CT, X-rays. So AI is going to become an integral part of our machines.
Thank you, sir. That's very interesting and looking forward to those advancements. So, Anand sir, my next question is to you. And I think in a country like ours, the government plays a very important role in realizing this potential and with this topic of AI and ML in healthcare. However, there are challenges like infrastructure limitations, fragmented data ecosystems that obviously persist. What specific measures do you believe that the government could take to act as a driving force for AI and ML adoption in India's healthcare framework? And given India's diverse demographics and cultural landscape, what could the government really do to push in this direction?
Yeah, thank you, Arjun. So I think this is also a very important aspect that we have to consider if we are talking about the growth of the genomics and AI and the role of AI going forward. So one of the key factors here is that AI is all about data. So as long as you're not able to have a data in a structured form, you will not be able to analyze the data, do something about it. So that is where the major problem for India is. Even though we have such a huge population which is quite diverse, and with each states having their own requirements in terms of disease burden, the spread of diseases, whether it is communicable, non-communicable, lifestyle diseases, new age diseases. So all these have a pattern across the country, which is quite different from what we find in Western countries, where there is some data that is available through which you can apply and work on these predisposition related things. So when we talk about how do we actually get this data, how do we get the structured data? It's about all the institutions coming together in healthcare. So whether it is a laboratory, or whether it's an integrated diagnostic center, or whether it is a government related organization, or any healthcare service provider or hospital. So how do we integrate this data? I think one of the first steps by the government in this is talking about the Ayushman Bharat health account, or the ABA ID, which probably on the long run is what is expected is that it will create an interoperability between the various setups, and we will talk about how we can bring about that data which is there for the patient from across different ecosystems within the service providers. So how do we bring this data, and how do we actually use that? So in labs like ours in Agilus Diagnostics, what we do is we provide patients with trend reports. That is the longitudinal reports of their own reports over a period of time. But what we really need when we talk about population health is how do we get overall data for the particular community or for that particular area, for that region. If we can actually get that kind of data, so that will help us in actually providing clear, actionable insights for the doctors, for the clinicians to treat the patients. And that's how even our predictability testing and the preventive genomics scenario also will improve with specific reference to India. So that's where I think the government also needs to focus and work on.
Completely agree, sir. I think this data is integral for actually guiding the government also where to actually put in the money on what are the disease areas and where exactly to focus on a larger perspective of the population. Sir, do you have a point? Please.
Yeah, just to say that the government of India has been pretty proactive with them having brought in the ABDM, which is the digital health mission. And here, what the government has envisaged is that all data, healthcare data, would be in digital form, and the government will actually build the skeleton. And both the public and the private sector of healthcare has to actually provide the flesh, so that right from every visit that a patient has to any doctor, even a small clinic, that's envisaged, how long it's going to take, or what are the obstacles in reaching there is a separate matter, but the government does have the vision. And of course, it'll take a lot of doing, it'll take a lot of money, it'll take a lot of change in our thought processes. But if that were to happen, then at the click of a button, you could see heat maps and know TB is more prevalent in this part of the country, and more boys are being born here, more girls being born there. So, and also that data could be used for developing algorithms which we could use for ourselves, both for diagnosis as well as for treatment, because ultimately India will have to find solutions to its problems within. Of course, we can learn from other parts of the world, but we have to find our own solutions. So going forward, it may take 5 years, 7 years, whatever, but the intent is there from the government.
So completely agree. Also intent, and I think they've also incentivized the stakeholders for this, like for the ABA ID. I was on a call yesterday where they were saying that every ABA ID generated by a lab will give them like a 10-20 rupees incentive, and also to the LIS vendor. So I think that's a great way at the end of the day to push this agenda. And obviously they are doing great work in this. And with this, I would like to thank everyone. We still have a few minutes left, although quite unusual in a panel discussion. But I think it's God's plan. If someone has some questions or any comments from my fellow panelists, I would love to have them. There's a question. Can anyone pass a mic?
Good afternoon to everyone here. Myself, Sanuj. I would like to ask a question and would love if any of the panelists would answer it. So, as if I'm correct, there was a mention that the third most leading cause of deaths in our country are preventable diseases. So I was thinking that what all could be done regarding that, and if awareness campaigns could be created, and in which the government can be involved, and the role models can be invited, the brand ambassadors and everything can be done. And then with that, funding can also be created for certain sectors. As we saw in the polio eradication vaccine, Bachchan sir was very actively involved. So I would like your opinions or any other stuff which you would like to comment on.
So that statistic is from the US, where the third largest cause of death in a hospital is preventable mistakes that occur. In our country, we don't have any data. But to answer your question, definitely awareness needs to be increased. There has to be. There was a whole session on quality and looking at providing quality, minimizing errors, being aware of the fact that these occur, and being able to reduce them. And Kaho and Dr. Vijay Agarwal, who spoke, they are taking a lead in doing this. And, we need to sensitize actually the medical fraternity about it. And also, you very rightly said, patients themselves, so that they also ask questions as to why a certain treatment has been authorized or a certain test is being done. It'll be a slow process, but in the West, in the US, where everyone is so aware and educated, and their healthcare system is supposed to be number one in the world, that is where this is the third leading cause of death. So it is a very, very serious issue and needs to be addressed in our country as well.
Thank you so much, sir. Thank you.
Thanks. So another point on the preventive part to your question, and the one who should not be named regarding the cervical cancer campaign that just happened. But otherwise, again, that is also an example of how people are really putting their minds together, not only to spread awareness, but even with a little simple thing as a pap smear. There is a lot happening from the government side. Also, AI now in histopathology and cytology, having reached a certain level, I think great work is being done in the preventive space from that aspect too. Great. Any other questions? Please. There should be a classification of the labs.
Star class.
Well, your wish is granted, sir. There's already work which has been done where a star classification based on not only diagnostics but hospitals. I think it's equally important for hospitals. That whole document has been prepared, and it took nearly 6 to 8 months to do it. And based on that, there are prerequisites that each star rating, in a sense, I don't know what exact terminology it's going to be, whether it'll be called star rating or something else, but that work is on in real earnest, and very soon it would be there.
This diagnostic centers, they have a major role. All high qualified doctors, they are dependent on the pathologist, whatever report they prepare. So the modernization of the upgradation of the lab, that is very important. Qualified pathologist is very important. Experienced pathologist is very important. Accreditation is very important. Certification is very important. Once you get the certification, after 3, you have to wait for 3 years. In between, no checkup of SOPs or the quality checkup or mushrooming the pathologist, not the pathologist, the lab, mushrooming in the state.
There's a lot of focus on that, sir. Labs being run by quacks. NABL accredited labs are very few in number, considering the total number of labs in the country. We don't even have data on how many labs are there in the country. So each and every point you make is very, very valid. And there is focus that is being put on these aspects. and hopefully in the months and years to come, we'll see a change.
Last but not the least, the last question. This AI equipment, Mr. Chandra, you rightly said, it's a very high cost equipment, AI, the new equipment with the AI. What about the existing equipment? How to dispose of this existing equipment? Is there any buyback, or the government will give any subsidy on that if you are modernization or upgradation of the latest equipment or existing equipment?
The government gives no subsidy to healthcare. We pay commercial rates for everything, whether it's land, whether it's loans, whether it's power, whether it's water. So to private healthcare, there is zero incentive or zero concession that the government gives. Point number one. Point number two, regarding the equipments that are already there, there are ways in which these equipments on payment of certain sums of money can be upgraded using AI. But don't think that AI is going to be the panacea for all the problems that we have. AI is slow in coming. It is coming into medical equipment and being able to fasten or hasten the scan times. It is able to lower radiation doses that are given on a CT scan or on an X-ray. And there are also commercially available algorithms which can be used externally to improve quality using AI. So, but this is a slow process, and I can tell you, India is not lagging behind our Western counterparts as far as availability and use is concerned at the present point of time and going forward.
When this industry will be given as an industrial status?
We've been struggling, sir, for many years. You put your weight behind us that the healthcare industry is given industry status.
Great. So great questions. Just to add about the accreditation part. So we completely agree there are mushrooming of labs everywhere, sir. But when we speak about NABL accreditation, I don't think many people would know that an NABL accreditation, just as your tagline in the lab, doesn't mean that all your labs are accredited. So some labs, what they actually do is that they'll have that NABL tagline in their advertising, but actually when you look at their test menu, it'll just be like a handful of tests or a small percentage of tests that are NABL accredited. Apart from this, on an ongoing measure, sir, we do external quality assurance, we do internal lab comparison, there are peer comparisons. So quality is more than a culture, is actually a culture and an ongoing process, just then accreditation. And apart from the second thing, like sir said, we don't get much subsidy from the government, but I think we get incentivized, and obviously we are blessed to have been given the opportunity to be here on this panel discussing this with all of you. A big round of applause for Businessworld and all my fellow panelists, and humbled and privileged. Thank you once again.
And also thank you so much, Arjun, for moderating that. Thank you. I please request Harvinder ji to join us on the stage and present a token to all our panelists and our moderator as well. And he is entering now, and he has. Yes, sir. Designation. Thank you so much. Thank you. Thank you. I think before we move ahead with the next session, let's just simply build some energy and momentum in the room. बहुत simple तरीका है for our friends at the back. I please request you to occupy the seats in the front. That's it. Please. For all our friends at the back, I would request you please, if you can occupy the seats in the front, that will simply just build manage in the room, nothing else. The simplest way to do so. And with that, let's move ahead with our first fireside chat for the day, which is on integrated medicine. And to fire up their experiences and their visions, etc., please join me in welcoming on stage Dr. Mukesh Batra, founder chairman, Dr. Batra's Healthcare. And joining him is Priyanka Singh, assistant editor, BW Businessworld. Can you please welcome them with more love, more energy? Thank you so much. Thank you.
Hello, sir. So I have some few questions regarding integrated medicine. So first of all, I would like to start that my mother is very fond of homeopathy. That whenever my family used to get sick, she would always give us, okay, take it. And there is a phrase very much, connected to homeopathy is that जड़ से चला जाएगा. Hope we all have heard that homeopathy खाने से जड़ से चला जाता है. So so there are so many homeopathy comes with lots of doubt, there are so many misconceptions because it is not widely accepted in the world yet. But still you manage to make it so big in India. So what were your challenges and what were your learnings?
So first of all, thank you very much for having me here. Also my family namesake, Anurag, I don't find him here, but thank you. And also to Mr. Narula and to Businessworld. It's really a pleasure to be here. I'm, happy to be part of this fireside chat and also remove some misconceptions. So let me first say that, homeopathy is actually the second largest system of medicine in the world, according to World Health Organization, and it's actually growing at 25% back to back. So it's actually pretty popular. It's legally followed in about 175 countries of the world. So it's not just in India, even though India is actually the largest base for homeopathy because there are more than 50 million followers in India and there are more than 2 lakh homeopathic doctors who practice homeopathy. So it has the largest base, but it's all over the world actually. So it's not just restricted to India any longer. And we are also not just in India, but my company is already in 6 countries of the world, in the UK, in Middle East, and many other countries as well. So I think to answer your question that it's actually pretty popular in any case, but we've added a small bit in whatever we could do. And yes, going into new terrains and new, new geographies, there are always many challenges. So the first challenge that we've had is actually of legislation. So I'm now talking about 1996 when I set up my first clinic in Mauritius. When I went over there, I requested the vice president to inaugurate my clinic. And he said, if I come there, I'm a bar at law, I'll put you behind bars. Because homeopathy is not legalized and I've put another Ayurvedic doctor like this. So, I had to go up and down almost 6 months to actually legalize homeopathy in Mauritius. And so ours was the first legalized clinic in 1996. So that's the first challenge in some parts. In the Gulf country, for example, because homeopathy is alcohol based in terms of dispensing it, so it was banned and it was not allowed. So that's really the first challenge is legislation. The second challenge is registration of doctors. So while doctors, while we have a 5.5-year course in India, but doctors are still to appear for another exam on a medical board either in UK, do another, kind of a course for 6 months, or in Middle East, they have to appear before a medical board and then answer questions and appear for exams. And only when they pass it do they get a registration. So that's the other challenge also there. The third challenge, of course, is infrastructure setting up. It's not easy at all to set up infrastructure in a new country. Very often the licensing procedure is very, for health and food is very regulated abroad. So the licensing procedure takes very long. Sometimes it can take even 1.5 years, 6 months to 1.5 years. So you actually have a lot of capital investment over there because you have to block all your money for another, 6 months to 1.5 years. You have to pay top salaries to your doctors and your consultants, and you can't practice. So there's a lot of, capital that goes in without any return. So you've got to be able to hold on that for some time in a foreign country. It's not easy at all. And then, of course, there's a cultural difference because, like, for example, in Middle East, people dress differently. They have different cultures. You can't actually shake the hand of your female employee. It's just not allowed. And so there are lots of other things like this as well. So it is a challenge. And of course, the challenges again of acceptance. Like, for example, in London, we're not allowed to advertise. There are lots of very strict rules where homeopathy is very popular there. But you can't advertise in newspapers about the goodness of homeopathy. There are lots of restrictions on the claims that you can make all over the world. So I think these are some of the 4-5 real challenges. But I think, where there's a will, there's a way. I'll end by just saying that little, poem that I remember. Kadam choom leti hai manzili aakar. Kadam choom leti hai manzili aakar agar rahi khud apni himmat na hare. So I think, it's just like it all Munna Bhai, as they said in Munna Bhai MBBS movie. Just have to keep at it and keep going, and you will get there. If you have the will, you will find a way how to get there.
Thank you, sir. That was very informative. And so how is homeopathy is going to play a very important role in integrated medicine in India, like with the holistic approach?
So, the largest number of deaths that take place today are not for communicable disorders, for which allopathy has done extremely well. It's actually for non-communicable disorders, NCDs as they are called. And there are more than 25 million people that die in India alone of NCDs every year, which is chronic disorders. And this is really where, because these are lifestyle problems, this is really where homeopathy and alternative and complementary Ayush treatments have actually an edge because they are holistic in nature. And so you can actually treat them successfully with very little cost. And also you can integrate them very easily into other systems of medicine. So this is like the gap. No system of medicine is complete by itself. And this is the gap that can be easily filled in through homeopathy and other systems of medicine, Ayush systems of medicine. Because chronic problems have, they are normally holistic. So they are, multiple reasons for it. So for example, when you have a disorder, which is, say, an infection, it's normally because of one virus or one bacteria, single. So it's easy to treat it by an antibiotic if it's a bacteria, and otherwise also, through a virus, you can manage it. But if it's multi-pronged, like how it is in a chronic disorder, because it's lifestyle related, there's no exercise, there's poor diet, there's stress, there you need holistic medicine. And which is where homeopathy comes in. So one thing is that it can be very well integrated in as part of holistic medicine in chronic disease. The second thing is that it can also form a very strong basis of preventive medicine. So even in preventive medicine, homeopathy is very, very good. And we saw that in Ayush as well during COVID. The government recommended arsenic alb as a preventive medicine. And in my company, we gave 2 crores free to all the police force of Maharashtra and their families. And there's a lot of examples like this, even earlier of epidemics, where homeopathy has been used very successfully. Even in Japanese encephalitis, Andhra Pradesh used it. They gave a dose of belladonna and nobody actually got that brain fever, as it was called, and children didn't die. So on the preventive aspect and on the, I would say the curative aspect of chronic diseases is where it can easily be integrated.
Okay, thank you so much, sir. So can you tell me about what are there is several misconceptions related to homeopathy. So what are the 3 you think it should be busted? 3 misconceptions you have to tell us.
Okay, there are so many that will be here for lunch and for dinner and probably for breakfast as well. So it's good to actually to remove
That's
them.
why I just
So
said
only
three.
three. So the first, of course, is that it is slow because people think that it's a slow system of medicine, takes very long. But this is actually not true because it's because people who come to homeopathy come because of chronic problems. They've suffered from migraine for 10 years and they have arthritis for 20 years and so on and so forth. So anything which is acute like a cold or a cough, it gets all right very quickly. But anything which is long term and chronic actually takes a lot of time. Because as you said, jad se mitata hai, it treats from the root, which is why it takes time. So like I said, that's the first myth. The second is, of course, that also that it is herbal medicine, which it is not, because homeopathic medicines are actually prepared from multiple sources. You can prepare it from sun, from silica, from mud, from even from certain animals, and even though a lot of it is plant medicine. So there's a misconception that it's just plant medicine. It's not. And the third, of course, a very controversial thing is also that it's a placebo effect.
Yeah.
That वो अगर you know if अगर उसमें आपका faith है तो फिर it works on faith. And you know, but it's very very good for in veterinary medicine. There's a lot of research that has been done, and you know, animals don't have any faith. You just give them whatever it is. I'm saying I've used it for all my pets very successfully. I've trained a lot of veterinary doctors as well. 50% of veterinary doctors in UK actually use homeopathic medicines on their patients, on their animals. So it's very good for animals, very good for babies who have no faith at all. But, and now of course, there's a lot of clinical evidence that has been also available to show how homeopathy helps. So that's also a myth.
Okay. That's good. Okay. So, like, what are the policy changes will you advocate for so that we can easily integrate medicine for better healthcare in India?
You know, that's really a very difficult question because sometimes, you know, the government has a very thick skin and no matter what changes you recommend, it doesn't get implemented. You know, I would say that, like, for example, you know, when you talk of business and you talk of, you know, retail health, and there are so many doctors and industrialists over here, the first thing that they say is that in retail health, there are three things that are required for a successful business. And the three things are location, location, and location. So the same thing I would say is that for integrating healthcare of all systems of medicine, what is really required is awareness, awareness, and more awareness. And therefore, this awareness needs to be created at different levels. The first is with the government. Like I said, now, you know, I'm the chair of CII on Ayush, and we present white papers to the government to kind of, you know, sensitize them on the need of Ayush and how it can be used. Recently, you know, that the CGI has announced that there'll be an Ayurvedic clinic for all the people of the bar, you know, in the Supreme Court, and they can benefit from there. So a lot of such things keep happening. There's a long way to go, but you know, we do kind of keep asking the government to make policy changes in favor of Ayush and in favor of homeopathy. It's a slow process, but we're getting there. So this is the first thing. The second thing, of course, is to also synthesize the medicine, the medical fraternity, because they also have certain ideas about homeopathy and other systems of medicine, and to actually show them through clinical provings that homeopathy actually works. And that's the second thing that we have to do, to go to the medical profession and to open their minds into other systems of medicine as well. And the third, of course, is again to go to the public, because we need more awareness. I mean, if after homeopathy is now 225 years old, I can still be asked a question that homeopathy is slow and does it work or not work, then there's a lot of ground level work still to be done in popularizing and removing the myths that are there against the system of medicine.
Okay, sir. Thank you so much. And so, what are your aspirations for how, like, where do you see homeopathy in coming years? Like, do you see more, like, because it comes with definitely lots of doubts. So how are you going to, you know, make a mechanism where people accept it the way allopathy and other Ayurveda things are doing? But how is homeopathy is going to do that?
So, you know, first of all, like I said already, that it's already being practiced in 175 countries. And so there's a lot, it's already being practiced almost everywhere. So any country that you can think of, homeopathy is legalized, it is being practiced. There's not much to be done there, except that you have to formalize it, you have to, you know, put it on a platform of make nice processes and systems, do clinical proving, and so on and so forth, and add to research. But otherwise, it's already recognized, and there's not much that one can do over there, because there are so many local homeopaths who are practicing in different countries, and it's being popular. Like I mentioned to you already, that it's not Ayurveda, it is homeopathy, which is the second largest system of medicine in the world. So that's again a misconception. And it's growing 25% back to back for the last 5 years, compared to pharma industry, which is growing at 10%. So it's catching up very fast. And also it's not the oldest system of medicine. People think of it because they associate with Ayurveda. It's actually the youngest system of medicine in the world. It's only 225 years old. So it is the youngest system of the medicine, and is the fastest growing, and is the most popular. So it's doing pretty well on its own, and I don't think much needs to be done. It already has a momentum, and this momentum will be accelerated. And I think just creating more awareness, creating more of a consumer pull, making more and more people aware that of the benefits of homeopathy and why they should try it out. I think that's what needs to be done. Like I said in the beginning of my talk, that it's awareness, awareness, awareness. That's it. By creating more awareness, we'll be creating a consumer pull, and that's how homeopathy and alternative systems of medicine will then get more popular.
Okay, sir. Thank you so much. So, in your experience, what are the ethical considerations unique to homeopathy within the context of integrated medicine? Like, how do you ensure ethical practice and informed decision making when offering homeopathic treatments along conventional therapies?
I mean, they would be the same as any other system of medicine, because medicine is medicine no matter what it is. And the ethical things would be said. But I would just point out two. Number one is transparency, particularly for homeopathy, because lots of homeopaths don't divulge the name of the medicines they're giving. And therefore, there's no transparency. And that can really become a hindrance if one is going to go for integrated medicine, because you need to have transparency with the treatment that you're taking. You need to have patient awareness in what they're, as part of the build up of a doctor-patient relationship trust that you build up over a period of time. So number one, I would say, is transparency. That's very important. And number two, I would say, is data security, because the information that you get in a homeopathic case taking is far more than what you get in just a clinical evaluation in allopathy. There are a lot of personal data. There's a lot of not just medical data, but there's a lot of personal data of social problems, family problems, mother-in-law problems, daughter-in-law problems, all which are told in confidence to the doctor, and that's not something that should leak out outside. So I think data protection and keeping those files very safe when you're sharing it with anybody else, I think that's going to be a challenge.
Definitely, sir. I have one more question. So, tell me one thing: are we coming up with more institutes which are going to teach homeopathy in that, like in education? I'm talking about. Do we need that more?
So I don't think we need that more. We already have 175 institutions in India. I think we have too many of them. What we need to improve is the quality of education. Very clearly, the quality of education is really not power. I would say that in my company, we have 400 doctors, and we actually choose doctors only from the top 10 or 15 universities in India. As you know, that homeopathy is a graduate course. It's a 5.5-year course. So 5.5 years is a long time for somebody to learn medicine, not long enough, of course. After that, you then have a 3-year MD course where they can super specialize in pediatrics or in any other such, or in psychiatry as well. I'm just giving examples, but there are many like this, and also in advanced homeopathy. And that's another 3 years. So then that's 8.5 years again. And then we have a Dr. Batra's Academy, which is actually the first public-private partnership with Mumbai University Health Sciences. And we conduct a course for MD doctors and for doctors who are more than 15 years on clinical dermatology and homeopathy. So they do another 1 year in that. So if you actually look at it, the education is almost 10 years before you really qualify to actually be a practicing doctor, which is a lot. Yes. But it's just that while there are 175 colleges, all of them are not standardized. So standardizing education and making sure that the facilities in all colleges are the same and good and on par, that's the need of the hour. So the need of the hour is to improve what we already have and not open more colleges. I mean, there are enough colleges. There are like 20,000 doctors who pass out every year from all these colleges. But are all of them equally good? No. A lot of them, we have to retrain them again before we actually put them into practice.
Yes, sir. Thank you so much, sir. And how is homeopathy is going to help people who are suffering from anxiety or mental, psychological issues? How is that? Do we have therapies there, or like how does that work?
So there are two thoughts in that. Number one is that today, a lot of problems today are psychosomatic.
Mm.
So for example, if you get a headache or a migraine, it could really be, of course, it's a neurological problem, but it could also be because of anxiety or pressure or stress at work or anywhere else. So today, a lot of problems are psychosomatic, and therefore going to a physical manifestation of a problem which you see, also with a mental manifestation which is hidden. So there's some psychological pressure which is actually causing it. So a lot of problems are psychosomatic. Because homeopathy is holistic, it actually helps in that. Similarly, also helps in a lot of mental issues and emotional issues. So things like OCDs, anxiety, depression. Actually, my next book on homeopathy is on homeopathy and mental disorders. And I'd rather wait for it to come out. It's already on pre-order on Amazon, but the first delivery will be on 18th of March. So you can read a lot about it because, I mean, I've written a whole book on it. So there's a lot to talk about. But it would suffice to say that, yes, homeopathy has very, very good treatment for so-called mental disorders and also emotional health problems.
Oh wow! Because in allopathy, it is generally said that people who have medicines, they they rely on that, they become addictive. So how is homeopathy is going to be different from this medicine?
So, every system of medicine has its advantages and it has its limitations.
Hmm.
That's why I never like to talk about any system as not being good or being bad.
Hmm.
It's always, there's a limitation, and it's for the consumer to actually pick up the best and understand what will work for him in that case. Similarly, different treatments of medicine work differently during or are recommended during different courses of the same disorder. So for example, in some cases of cancer, you want curative, you want to do surgery, you want to do chemotherapy, radiotherapy. In some cases, it's only palliative treatment. So palliative treatment is far better in homeopathy because it is safe, it has no side effects. So similarly, also in so many, like psychiatric disorders as well, whether it's depression, whether it's OCD, whether it's schizophrenia, whatever it is, you're already taking chemical medicine. And you can't stop it suddenly because then the patient will go, have that one moment of madness and commit suicide. I mean, can you imagine that almost 7 lakh people in India, young people commit suicide, and it's now getting more and more common. So you have to gradually withdraw it, and you then have to introduce homeopathy, which is non-addictive and has no side effects. So over a period of time, then you can actually be healthy and happy and not depend on chemical medicine. But you can't do without it suddenly. If you're already on it, you have to taper it down.
Yeah. So I would like to ask question about the business of homeopathy, sir. Like, how is it? Is it as big as the other?
Well, there's nowhere near pharma industry or the allopathic industry. There's nowhere near the hospital industry. These are all small players who kind of coalesce together. I would just say, we are just like the papad industry, and then Digit came together and put them together on a platform, and then gave a kind of a platform for people to earn money and to get to the consumer so that they could choose. And I think the industry is very small. Having said that, the larger industry is the homeopathic OTC industry. So if you look at it, it's divided into service industry, which I'm saying is very small, limited, because even though there are doctors, but abroad there are very few doctors who are qualified to practice and registered. Abroad, for example, in Europe, you have to be an MD doctor, and then only you can practice homeopathy. So it's quite different. It's not easy. But here, there are lots of service doctors, but there are not so many OTC products. So the entire industry abroad runs on OTC products. So you can go into a Boots pharmacy, for example, and you can pick up a homeopathic medicine for migraine or for backache. So it's off the shelf and off the counter. And that's where the industry is growing very large. It's, I think, to my knowledge, it's about a $3 billion industry already, and it's already growing fast. So homeopathic products in terms of OTC are growing very fast and are getting bigger, but not the service industry.
Okay, sir. So, we have heard a lot about you. We know, like, you have, like, great journey. तो, sir, कुछ ऐसी बात कह दीजिए जाते जाते या तो गाने में या कि, कि मतलब सबको मजा आ जाए. Please, sir. I know you paint, you know, you do lots of creative things and good things also. So, yeah, please sing.
My wish. Binder, I can see time's up, so.
The challenges, that he has faced personally, and then taking on the journey, which was very, very different at that point in time, to do something in homeopathy, and then taking the initiative to do something which gets the attention for the subject, and taking it beyond India. And so you're kuch aisa gana, something that you would want to, sing, which demonstrates the learnings of life beyond just homeopathy.
किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, जीना इसी का नाम है, जीना इसी का नाम है. That's it. I think if you reach out with love and care, the world will reach out back to you and you'll get where you want to be.
Awesome.
Thank you very much.
Awesome. Thank you so much, Dr. Batra. And I have one question. I mean, I'm taking this opportunity to ask this question specifically because we have so many CEOs of hospitals and people from AHPI here. So we are talking, I mean, the sense that I'm getting, I interview a lot of people. And one sense that I'm getting from the industry is that we are heading towards integrated health. We're talking about outcomes, focus on outcomes rather than whether it's going to be allopathy, homeopathy, Ayurveda. So what is it that we can do so that hospitals take attention and can include homeopathy as a treatment option in their hospitals? And they go beyond just thinking that, we are an allopathic hospital or we are an Ayurvedic hospital. Can it be, do you think we can be a hospital which is offering integrated services more focused on outcome and on the delivery of what is going to work for the human body?
Actually, that's a very difficult answer. It'll be another discussion. Let me try and just be very brief. So the first thing is, we're already doing this. I've introduced homeopathy as a super specialty in many hospitals. We've been part of the KIMS hospital in Bahrain, for example, for the last 16 years. And we have half a floor there, which is Dr. Batra's homeopathy over there. So we're actually part of this whole system. Similarly, I was part of an orthodontic clinic for over 5 years in Dubai, because we found that a lot of kids over there who were coming with, misalignment of teeth and needing treatment, that they actually were mouth breathers and they had adenoids. And so with homeopathy, we could raise their immunity and treat them with for the adenoid problem. Similarly, we were also part of one of the largest bariatric centers, because they found that people who were undergoing bariatric surgery needed a lot of counseling and they needed a lot of care, because they were very anxious with what they ate afterwards, very anxious that we'll be put on weight again. So for many years, we were with that group as well. Presently, we are also now with one of the largest IVF centers and infertility centers in Greece, in Athens, where when they get stuck with certain homeopathy in cases of infertility and sterility. So there are already examples like this all over the world. Now, having said that, there are many challenges. So the first challenge is one of nomenclature. So, for example, how do you classify the disease? And second thing is that how do you treat it, and how do you standardize methods of evaluation and medical outcomes. Now, we've done both at Dr. Batra's. Number one is internationally, we follow what is called ICDs. So the International Classification of Disease is what we follow everywhere. So not that somebody will call it an allergy and somebody will call it an allergic bronchitis, and then somebody else will say it is Vata and Pitta, and somebody else will say, no, it's just a immunity problem. Now, when you have different names for the same problem, you can't have a common ground. So the first thing to do is to create international nomenclature, which is accepted all verticals of different things. Second thing is then also to make sure that how do you measure the outcome? So homeopath will say there's a wellness. I'm feeling better, so I'm all right. Somebody else will say, Ayurvedic doctor will say there's no symptom. I'm all right. He's free. And a medical doctor will say, I want you to be clinically evaluated. So making sure that clinical evaluation is mandatory across all systems of medicine and standardized. For example, if you have an asthmatic patient or a CPOD patient, COPD patient, don't tell him that he's okay unless we do a pulmonary function test, which is electronic in all our clinics. So if you measure the breathing capacity before treatment, after treatment, and you see that it's become all right, that's how you, so I think we follow these kind of protocols, medical protocols across the world. And I think everybody needs to do it. So we are a far way off. I'm saying once we start getting the nomenclature right, and we start talking the same language, and then we start talking the same language in cases of medical outcome, I think that's when really integration will become, a possibility.
Thank you so much, sir. Aditya.
Thank you so much, sir. May I please request Dr. Sanjeev Singh, Medical Director, Amrita Institute of Medical Science and Research Center, Faridabad, and Chief Medical Superintendent of Amrita Institute of Medical Sciences, so please join us on stage and present a token of appreciation and love to Dr. Batra, please. Thank you, and thank you so much, Priyanka, for doing that. Thank you. Aye. And with that, it's time for our next panel discussion on building efficient hospitals. And while they're setting up the stage, I take this moment to introduce our panelist for the same. Dr. Sanjeev Singh, Medical Director, Amrita Institute of Medical Sciences and Research Center, Faridabad, and Chief Medical Superintendent of Amrita Institute of Medical Sciences. Joining him is Raj Gore, CEO of Healthcare Global Enterprises. Joining them is Gautam Khanna, CEO of Hinduja Hospitals. And this session will be moderated by Harbinder Narula, CEO of BW HealthcareWorld and also of BW Wellbeing World. Let's please welcome them collectively, ladies and gentlemen, to the stage. Thank you so much.
So first of all, thank you so much, all of you to be here with us today. We have Raj and Mr. Gautam Khanna who are traveling from Mumbai and Bangalore. So thank you so much for joining us. They've taken an early morning flight. Mr. Khanna was telling me that, he's left home at around 4. So it means a lot for, for us to have you here with us. And Mr. Sanjeev saying, he called up yesterday that मैं सुबह भी आऊँगा, शाम को भी आऊँगा. But then, one small request, and he said that, no, don't worry, Arvinder, I'm going to be here the whole day. So really appreciate your being here. It means a lot to us. The reason we had this panel was that when we are talking about healthcare, the front face of healthcare delivery is the hospital. But when we look at a hospital, the first thing that comes into our mind, a doctor, diagnostics, and the treatment. But we forget that to run a hospital, there is much more to it. You have to manage the sustainability of an hospital, ensuring there is a feasibility and viability of the services that are being provided. There's a procurement process. There's a lot of, expensive equipment being bought. Apart from doctors, there's a very large workforce, which is non-medicos that need to be managed. And we always think that, people management is only for corporates. We forget that institutions like hospitals also need to be run like a company, and we need to ensure human happiness, joyfulness while they are providing the services. So that's the real intent behind this particular conversation. Sanjeev Singh, I would like to begin this conversation with you. What I really want to understand, you are one of the newest hospitals in terms of infrastructure that got built when we're talking of large hospitals. And what were some of the common challenges that came into your mind when you were building up a new infrastructure? Keeping in mind the challenges that we are facing today, and when you're setting up a new infrastructure, you also have to keep in mind, as a smart business leader, what are the challenges we are expecting to face, within 2, 3, 4 years of the time that the hospital really comes up.
Yeah, thank you, Mr. Nurura, for inviting, and thanks to the esteemed panelists that you are always, it looks as if you're appearing for an exam because they're both brilliant and doing fantastically well. So very good question. It's a new setup. So when we were buying the land and planning this whole hospital, we had put what are the gaps in the healthcare delivery systems, and we put that on the drawing board. And we said that we would like to address all the gaps when we are building. So one is that why we don't have a Harvard and a Mayo in India. So can we build a university teaching hospital, since we are a university and we are a teaching hospital? So why we just restrict ourselves to a small hospital setup, and can we have almost everything? So you have a good both free, subsidized and corporate hospital. You have a medical school, and nursing school, and the allied health sciences school. Research happens in isolation. Can we have research within the same setup? There's a lot of doctors who are passing out. When we were graduating, post-graduating, there was only 250 colleges, 716 colleges now. So, but the skill sets and competency is not there. So can we build a big simulation academy? So these are some of the gaps which existed, and we thought that we'll put that in. The other thing is that we all say about patient-centric design, but where is the patient centricity? Because that's a good catchy word. So we have looked at various models, and we found that Mayo Clinic model is fantastic, where the patient comes in, and we have almost 81 super specialty departments. So when they come in, they get into a particular, if they park well, they get into, through the lift core, a particular department, which could be gastromedicine. The registrations happen there. The nursing assessment happens there. The consultation happens there. If he is advised any advanced, if he is coming fasting thing, the cafeteria is there. His all phlebotomy happens at the same location. If there is any advanced diagnostics, whether it is manometry, ERCP, EUS, endoscopy, colonoscopy, it happens there. And when he comes back, his pharmacy also is collected there. So the patient is centered, and he will not. So all our 81 departments, both corporate and on the economy side, are all designed like this. Now, the other problem generally for an efficiency is that when the doctor is, when the patient has an appointment, the doctor is busy doing rounds in block A, block B, block C, and he's not available, and he doesn't respect the appointment time. So we said that for a particular department, can the OP and IP be together? So when he's going to round in the same area in IP. So he'll be immediately be available for an outpatient setting. When the doctors goes on round, the postgraduates, the JRs and SRs are not available. They are there throughout the hospital. So can we have the postgraduate lounge within, which has a cafeteria, which has a Wi-Fi and a lounge for them, so that they're there available along with the duty rooms. So there are many such deficiencies. Communication is a big deficiency, and that increases. So we have provided an advanced counseling center, all implants, all prostheses. Because if I tell to the patient that TKR, ceramic and ceramic, I just don't understand. Robotic surgery, I don't understand. So it's all displayed, explained, medical social worker, manning in the respective department. So you actually know what prosthetic valves will get in. So intent was that whatever are the gaps, we had tried to fulfill those gaps and looked at 20 years, 30 years from now. And we would like to have all of you visit and give us the feedback.
Thank you, Dr. Sanjeev. Mr. Khanna, let me come to you. I mean, we were talking about patient centricity. Now, how good a hospital is is, apart from all the metrics that we use as an industry, is a lot about the customer feedback, which is a patient feedback. And the reason I'm using the word customer is not just the patient, but the caregivers at home, the family, which is also giving a feedback on the hospital. And if we are talking about patient centricity, then the feedback of the patients need to be taken care of. Now, Hinduja as a hospital has been expanding, quite fast. How do you incorporate the patient feedback and the suggestions that are coming in while you're expanding the institution to ensure that you're not just efficient, but you're also perceived as efficient in the eyes of your customer?
Thank you. It's a little tough question. So, based on what you just said, so the patient, so we have to remember that the patient is coming in in times of distress. So they need to be comforted. Sorry. So they need to be comforted, and their relatives need to be also be comfortable. So first you take care of the immediate problem from the clinical perspective. That means the right doctor, the right resident, the nurses, all that has to be taken care of. And for that, there is a standard process and standard timing and so on. But what happens is what you mentioned. Now the patients are not, so they are actually experiencing the consumerism which is outside the hospital. I mean, they think the Zomato and the Swiggy and the Blinkits, etc., etc. So they also want everything now. So they are very upset if you don't get the lab test reports on email. If you can't fix something on WhatsApp. So people are concerned about that. So what we have done, we've categorized the patient experience into multiple things. So one is clinical, where the doctors, then patient care with the nurses. So you have processes for that and monitoring and so that I don't have to talk about. All of you are experts in that. Then we have taken aspects of making sure that the processes are streamlined and seamless for them. For example, if somebody wants to come to an OPD consultation, I mean, why is it that if you want to go to a movie, PVR, you book it on the phone and then you go straight to the movie theater on your seat? Why is it that in a hospital you have to stand in a queue? Not necessary. So using this philosophy, we implemented that. Of course, there is a lot of challenge in that and back-end work and all that, but now it is pretty seamless. At least 1/3 of our patients are very comfortable. They just land up straight at the doctor's clinic. So, you avoid the crowd, you avoid the waiting, etc., etc. So other thing, and of course, you get the reports online, etc. The other thing we found, and it's a non-related, non-hospital related, but just a perspective. The relatives are really harassed. The attendants are really harassed in the hospital scenario. So one day we were thinking, we said, what can we do about them? So of course, we organized in the lobby and direct transmission to each patient room in the TV, live music recital, music concert, what you would have seen in an auditorium. We organized a nice sitar and tabla, etc., for 2 hours. People loved it. We've had examples where, simple things like that. We have long stay patients. Now, if the long stay patients, they have their birthdays, they have their anniversaries, things like that, we do that. The other thing in our other hospital where lots of children are born, for after the child is born, the second day, we make sure that the mother and the father, we organize a special candlelight dinner for them. It's something special where the child is not there. These are very, very small things, but this enhances the level of experience. I mean, this new year, we had a singer who went to each patient's room and said, which is your favorite song? I'm going to sing it for you. So these are very small things, non-clinical thing, but it enhances the experience. In addition to this, what we should not forget, and you mentioned it earlier, is that in our hospital, so I have around 4,000 people working. Out of that, only 400 are doctors. 400, 500 are doctors. Nurses, maybe 1,000. Who are the rest? Who are the others are people who take care of the food, the housekeeping, the security, the attendant, person who transfers from pharmacy to the OT, the medicines. How do you make sure of that? And what we have done is to make sure that they are trained properly, because when the patient and the relative comes, they don't see me, they don't see him, they don't see him. They see that attendant, the security fellow, how rude or how nice he is. So you have to ensure that that fellow at the last mile is delivering the best patient care. So, you do your standard programs, etc., etc. And I'm going to close in a minute if you want. So one of the things we faced a challenge, and I'm going to share a personal story. I think I've shared it with some of you. Like large corporate organizations and all CEOs, we all have standard, doesn't matter which industry, which hospital, everybody has a standard protocol. What are the top 3 priorities you will do? And I can name it. You can pick any industry. First one will be customer focus. Then you can do customer/patient/something focus. Second will be productivity or efficiency or so on something. Third will be, organization, teamwork, etc. And now you can give various names depending on the industry. So I was talking to my workers in one of the town halls. I was talking, I was new CEO in the hospital, giving 3 priorities. One of the worker, he stood up, and I was speaking in Hindi, of course. He said, "Sir, ye to theek hai, karna kya hai?" That struck me. We are thinking from here, but that fellow who is dealing with the patient, he wants to know what is to do. All these are names. Productivity, efficiency, all that. What do you mean by all that? So then I explained to them. I said, patient को ऐसे ही देखना है जैसे आप अपने माँ बाप भाई बहन husband wife बच्चे. Treat them like your family member. Immediately they understood what you would do, what you would not do. Second, productivity. He said, मेरे को sir, productivity, efficiency, 6 sigma, quality, 6x, 5s, कुछ समझ में नहीं आता. Simple thing. जो कर रहे हो थोड़ा सस्ता करो और जल्दी करो. They understood. So, so things like that you have to do. And in a hospital environment, we kind of ignore these things. We focus only that, patient should come, get healed and go. But what happens is when the patient leaves, they give a feedback, and we collect feedback through, through tablets, through SMS, through email, and we have a dedicated line in the room for that. Once you collect feedback, we have a escalation matrix. We track it every month. The senior management team reviews it, and we take action on it. So we monitor. But to close this, I think this is the most important thing. And as the world is changing, this is becoming more and more important. And I'm very glad what Sanjeev said, that patient is at the center and every service is around him. I wish we could do that, but I'm glad that you're doing it. Thank you.
So, Raj, let me come to you. You run a super specialty hospital. Yours is a cancer hospital, and running a super specialty hospital is very different ball game compared to a multi-specialty hospital, because your core focus is that one particular condition or a disease. But yet, especially in the case of cancer, you require multidisciplinary support system in the hospital, because the cancer patient could have a heart attack, they could be having multi-organ failures, etc. Now, these are not, I hate to use the word, but they're not the revenue centers, but they are important for you to have there. As a business leader, as the CEO of the organization, you have an objective which has, that has to balance between the stakeholder value, the patient centricity, the outcomes. How do you balance between the two to ensure that what you are offering is the most optimized solution for that hospital?
First of all, thank you, Businessworld, for having me here. Thank you to all of you for being here on a Saturday afternoon. For those of you who know Harbinder, it's very difficult to resist his warmth and charm. And getting an opportunity to meet my colleagues, is always a good incentive to be here. So first of all, I think I don't think it is that complicated. So one is what makes people come together, communicate with each other, work with each other, collaborate with each other to achieve anything in any field. At the core of it is a shared purpose. So for us at HCG, there are three basic tenets of what brings us together. One is we don't treat cancer, we treat a patient with cancer. And cancer patients' journey starts before they come to HCG, in between treatments, and then it continues post the treatment when they are at home. Second, we believe that the only way to treat a patient with cancer is the right complete treatment the first time. And when you talk about the treatment, it involves physical, psychological, functional, social elements to the treatment. Third is that the way cancer is rapidly evolving, every patient has a unique genetic makeup and a tumor has a unique genetic makeup. So you have to tailor the treatment precisely, specifically for that particular patient. Now, if your purpose is to treat a patient with cancer, then it's humanly impossible for any one doctor to achieve it, irrespective of whether it's Superman or God, right? And therefore, you will see that you will never hear us talking about any particular star doctor. We always talk about a team of 400 plus oncology specialists, and caregivers. Now, with that purpose, for us, it's become very, simple why we do what we do. And there is no, if doing the right thing for a patient with cancer gets us more patients, and that's what grows the business and builds a brand, then all other economic considerations are very simple. There is just, in healthcare, you have to do what's right for patient, and you have to always keep an eye on the long term and not just on short term. As long as you follow those two compass, you are okay. But I think the difficult part in this is not the business or economic consideration, it's making people work together. Now, if you look at, we emphasize this, that a patient with a cancer should be treated by a team and not a particular doctor at every opportunity in our day-to-day interactions. Right from at the recruitment stage to clarify expectations, as well as attract like-minded professional, to performance evaluation to have the right incentivization to build the right culture. Now, then our ways of working, our SOPs, our documentations, our different forums to audit tumor boards, multidisciplinary consultations, disease management groups. At every opportunity, we have embedded this ethos so that it becomes an integral part of what we do on the ground every day. But most importantly, we have some of the stalwart senior clinicians who are institutes by themselves. They role model when they allow even a resident, D&B resident fellow to ask a question, to express a differing opinion, to have a constructive discussion on any topic. It builds a culture, when they role model it. And once it becomes a part of culture, then this team approach becomes a fabric of the organization. So, like anything, if you stick to basics, it will, follow what you want, where you want it to lead.
It's so beautiful because, when you listen to these people sitting out here, they make it they make it sound so simple. Like you said, that it's not a big problem. But it's not a big problem because you guys have treated it that way. And, seeing how Gautam was talking about, thinking about things which is out of the box, and also, Sanjeev ji talking about, how you're treating the hospital. At the end of the day, I think, what is coming out is that I think we should not use the word patient centricity. I think it should be human centricity. That should be there. Sanjeev ji, let me come to you, because at the end of the day, when we look at the medical practitioners, the doctors, the surgeons, they're working in an environment where they are treating patients, they're focusing on prognosis, but they're also human beings, and they wish to do things differently, or they may be the ones who are at that point in time figure out that these things could be done differently, and that is where they could make a difference. But most environments, the work environments, do not allow for research and development where they could, दिमाग में कुछ आया तो इसके लिए कुछ करते हैं. You have addressed that issue in your hospital. Can you share with us how did you think about it, and what is it that you're doing so that the doctors are able to focus on making a difference beyond just the treatment, which is going to impact the future of the treatments?
Right, very good question. So when we were interviewing doctors for our new facility, we must have done it from 2018 onwards and seen close to 5,000 doctors from country. One thing was very clear is that we wanted a very comprehensive doctor, and that's how the doctors are. One, they need to be clinically excellent. Second, they need to teach. So they need to be academically excellent plus mentor. Third, they need to be having an interest in research. So all clinicians are not researchers, but they're at least having an interest in research. But fourth is a very important component is doing public health. So unfortunately, public health gets done by community medicine people. No clue. So it has to be done by clinician, because a cardiologist needs to go out and find the prevalence of hypertension and intervene. So academics was one of our very, very key criteria to select people. One is that you need to actually, unfortunately now the clinical practice is very transactional. मैंने उसको देखा, उसको correct करा, उसने मेरे को 2,000 रुपए दिए, and that's it. And 70 आपके हो गए, 30 मेरे हो गए, and this is how most of it is. We have to think slightly beyond, and unfortunately the role models are also shrinking. So when we used to see our people, they used to come on time, they used to teach, they used to handhold, and so mentoring has almost vanished. So right now we want an environment where you look for new opportunities, you look for new areas, and do high quality publications, not just publication, because everybody is now publishing. Post-COVID, there are preprint articles, there are post-print articles, and you have no clue. But then there are these, but high quality journal publications plus mentoring. एक फितूर होता है, because when the clinician, like a neuro-oncologist, has done a surgery, and then he doesn't know on the table whether he has resected all the mass. So he needs to know whether this patient will come back with a residual mass 6 weeks, 6 months after I finish my surgery. Now this question is there with him, and if he doesn't get an answer for this question, next day he again has 4 cases, and next day again he has many OPDs too. So what we have done is we have created a skywalk arrangement till the research block. If he has a question, he should just straight away get to the scientist and ask questions so that he gets an answer. And similarly, we have a nano biodegradable cytotoxic bio wafers, which we have designed. So post neuro-oncology, they just put a biodegradable wafer and that kills the remaining cells, if there are remaining cells, because naked eye you cannot. So there are many, many such things, like now artificial intelligence. We have made it mandatory for all our faculty. We have appointed a professor of artificial intelligence in healthcare, made it mandatory for all doctors to attend AI and chatbot. And we are seeing, and because we are a not-for-profit hospital, how do we pay this professor who is costly? So 28 departments have written a proposal, 2 of them have got funded, and that each one is 4.5 CR, and that's how we recover. So academics and research is a very, very essential component just to differentiate and create that interest in every healthcare professional who is working with us. Because like our founder Amma says that a clinician would see a patient and a researcher would treat sort of 10 million patients. A very easy example is, and then it has to be cost effective. Like there is a multinational company who has a insulin pump, which is 3 lakh, 3.5 lakhs. So here as an integrated, other than integrated of Ayush, we are integrating in another way, integrating human medicine with engineering, with humanities, with nanomedicine, with biotechnology. And they all came together and prepared an insulin pump, which is just 25,000 rupees. So can research happen and devices, new processes be made so that it is acceptable and it is frugal for community to adopt? So there are many such work which is happening, but it is important that if there is a question in clinician's mind, that needs to be addressed, and there has to be a adequate facilitation provided to him, because that can create wonders in the field of medicine.
Awesome. Mr. Khanna, we spoke about that Hinduja Hospital has been expanding. We are all living in an environment which is very dynamic, and business is a dynamic environment, and hospitals are no different from any other institution. And we've also understood that it is beyond just the treatment, doctor and a patient relationship. There are many, many more things in the hospital. Now, whenever we set up a hospital, we not just plan for today, we also plan for 4 years, 5 years, 10 years down the line. But the life of an institution is far beyond that. And when we are expanding, all the SOPs, procedures, quality standards that we have created need to be changing. How do you, as a business leader, ensure that you are offering the same level of efficiency, if not better, in that changing environment where you need to change all the procedures, etc., from time to time? I mean, including the SAPs, etc., that we are using.
So let me break this up into multiple components. So all of us are not knowledgeable enough to plan for future. So one of the things which we have in the hospital is called medical staff advisory committees, where my senior clinicians and HODs, etc., it is their meeting. I am sitting on the side as an invitee. They talk and they tell what is to be done from the clinical point of view. Now, we may or may not accept what they say, but at least we hear and we get some idea. So that's one part from listening to the clinicians. We also listen to the ex-patients. We have a focus group of ex-patients. We hear from them what they would like us to change. Then, of course, we see the trends, etc. But, the important thing is, one is the physical infrastructure change, which, you have, as with time, you keep changing and you design differently. The other thing is the processes. So we started, we had our journey with Six Sigma, 5S, all the quality initiatives, etc., etc. But the most effective thing which we have found is we borrowed from the automobile industry. In automobile industry, there is the concept of quality circles, where some of you may know, where each small unit has their own quality team, which is not led by any manager. It is led by the worker of that area. So we have created 21 such quality circles in the hospital. So there is a quality circle of in admission and billing. There is somebody in security, somebody in nursing, so on and on. And these people will figure out the problem and fix it at that end. And since they are in touch with the direct patient, it's very easy to fix. So this process is on. In addition to this, and leading from what Sanjeev mentioned, there is a lot of focus in our hospital on research. And I agree with him on two things, that when you focus on research and academics, a clinician who teaches learns more. So that is, I think he becomes a better clinician. And a clinician who is helping or doing research also becomes a better clinician because they know more. So we have, we have a big research department, and we are published globally, etc., etc. I mean, we have a tie-up with NIH. We work with them. NIH in the US. We work with them. We do a lot of these ICMR projects. We do international projects. I mean, we are one of the sites for fungal infection research, TB, etc. We also have a rural area outside Bombay, 100 kilometers outside, 180, which is completely tribal, where we adopt 300 villages. So what all this does, and when you hear, and we have one more thing, we have something called community living drive, where we hear from the community what they want. So it is the synthesis of all this. When you hear, you think about, okay, what the future is going to be. Now, who knows what the future is going to be, but at least you try your best. See, right now you mentioned about the HIS and the SAP and ERP. Most of the hospitals in the country don't have good digital IT systems, and it's not their fault. It's just that it doesn't exist in the country. But like, we are now taking an effort, and we have decided over the next 3 to 5 years, we will transform the hospital. It takes time, it takes effort, it takes money, but the key thing is to get the commitment of the senior clinicians, senior management team members, and all the stakeholders like the board members, etc. Then this thing happens. So I don't know whether I've answered your question, but I think it's a holistic way, and I believe in one thing. The reason why I tell people who are not in healthcare, why you should join healthcare. Because in healthcare, tomorrow will always be better than today. And it is our belief and optimism that we should always try to make tomorrow better. So I think with that, things happen.
Absolutely. When we're talking about making things better, as business leaders, we are expected to take decisions. And if there is something that slows the process, is the slow decision making. And then you are working in an environment where decision is not purely yours, because you have the chairman of the specific department who has the responsibility of creating that outcome, and he has a say in the equipment to be bought, the environment to be created, the teams that they would want to see in the hospital. But today we are living in an environment where we have data available to us. So it is more scientific than just focusing on a subjective approach or a perception or perspective of someone. How do you, Raj, in your hospital, leverage data and analytics to not just take business decisions, but to also ensure that you are optimizing the treatment pathways, and you are reducing the treatment variability that is being offered, ensuring a higher level of predictability of the outcomes, both from the medical perspective as well as from the business perspective?
So, like Gautam said, I think as a sector, we've done a fantastic job in transforming healthcare in last 2-3 decades. Today, any technology, any treatment that is available across the world will come at a similar time frame in India. And doctors are not leaving India because we didn't have hospitals or good equipment. And it's not just big cities, but even smaller cities, you have that access. I think in a place where both on demand and supply, resource is a crunch, okay, we have to prioritize. So we prioritize availability, accessibility, right? Now we are at a next phase where how do we use data technology to deliver better outcomes? So it's a journey. In HCG, we have now today, we have all cloud-based data capturing systems in place, whether it's HIS, ERP, EMR, PACS, lab information system, etc. But that's just the beginning, right? The holy grail in cancer and in general healthcare is to be able to trace a patient's longitudinal journey between treatments and after treatment, to be able to quantify, measure parameters, analyze, compare, contrast with other patients so that you can measure outcomes and improve outcomes. That's where the challenge is. And it's not just India challenge, it's world challenge, right? So the interface between these systems becomes a challenging part. But we are making progress. Once we have the data capturing systems, now we are integrating how we create that longitudinal visibility on a patient's journey. And there is some amazing things that we've realized about our own practices. What happens is cancer is probably the most rapidly evolving specialty. And we sent a man 6 decades ago to the moon, but we are still declaring moonshot on cancer, all the time. We've not cracked that. Now, if it's such a rapidly evolving research-based specialty, okay, then it's impossible for any oncologist to stay abreast with whatever latest is happening in this field. So there is variability in how every oncologist practices his art or science. The data helps you identify variability between different oncologists' practice and will show which is a necessary variability and which is an unnecessary variability. It's as simple as that. Identifying and eliminating unnecessary variability through standardization of evidence-based guidelines, protocols is the first step to improve outcomes. So we've seen in cervical cancer patients, an oncologist who did a upfront PET CT was able to have a better visibility and was able to understand the micromets and oligomets to upstage the cancer and therefore improve the effectiveness and had a longer 5-year disease-free survival and a longer overall survival. Radiation oncologists who use better imaging between the fractions are able to reduce the local recurrence over a 5-year. Right? Now that we are measuring this, these are the insights that are coming. And that's such a powerful tool. And I think that is what is going to help us to reduce this feared disease to like a chronic disease like diabetes, which people can live with longer, healthy, functional life.
Fantastic. Sanjeevji, one other issue that we face as business leaders in the healthcare is building teams, hiring. You said you had spoken to 5,000 medical professionals when you were hiring. Now, one of the challenges that all hospitals in India are facing, and I hope you will agree with it, that one of the challenge is hiring of nurses. We know that about 100,000 nurses from NHS are going to be retiring in the next 18 to 24 months. And India seems to be one of the places where they're going to be sourcing. But we are already facing shortage of trained nurses in our country. Now, when you are building up a new institution where you have an opportunity to build your infrastructure in a way that you can optimize this scarce resource, what are the things that we should keep in mind? Anything that you have studied? Because I know that you have studied about 8 or 9 problems and gone across the globe to identify what are other hospitals doing about it. So would you want to share some insights into what you have observed?
So I think that's a very critical point, at least for our country, and the people are not going to be available. Who are available are not adequately trained because they go ahead with a 3-month course and a 6-month course. Lots of nursing, there are 5,573 nursing schools. Many of them, they don't have a attached hospital. So we don't know about the quality of training. So it is a huge problem. And the way to solve this problem is you'll have to have your own schools so that at least you run your hospital well, and there are shock absorbers when they at least go for it, either abroad or a government job. So one was we have close to 574 critical care beds. As a plan and design, we have provided a satellite nursing stations. And that's a glass cubicle, and the nurse can view both the patients. And we are saying that there is a demand of 1:1 as a ventilator. If you are able to monitor the patient, and if you have an e-nursing, and if your inpatient is also electronically connected, and you're writing all the document directly, you need not have 1:2, 1:1. You could, so a single nurse could actually monitor, because she's there at that point of time. She's not going for phlebotomy to anywhere else. She's not going to get paper from the other sections. She's not going to indent from the other section because she can all do it from her system. The second is that when the doctors also come for rounds, they all have a tab which also has a dictaphone. So now it once it is written, but I don't know whether it is appropriately written. There could be a potassium of 7.5, which could be dangerous, but then my junior resident doesn't know. But then now this, what is written electronically, is available for every faculty. So the head of department can be there at home or in his office and keep monitoring the junior residents and the senior residents' work on time, on critical alert, and not depend on next day rounds. So the attrition is a problem. We need to have a very smarter way of looking at it, and this is where we also seek help from government and including NABH. Like emergency medical technicians should be so well trained that they could handle ambulance and maybe emergency, and that privileging should definitely be given to them. Similarly, if the nursing is not going to be available, can there be an OT Tech good BSc course, and then they can become the scrub nurses? Why we have to always depend on this group of people who are not going to be available? So there could be many ways where there could a plan and design could help. Like Raj was mentioning, in each of outpatient and an inpatient setting, we have a team medicine and a briefing room. So each ward, each private ward, each OPD has a team. So can all of them sort of come together and address an issue rather than just sort of lingering on the issue? So in our IP area, other than the board which has number of who's the patient, who's the doctor, there is a key performing indicator board also. And then the last portion of that board is please suggest a solution. And I think what he mentioned about the quality circle is a fantastic idea, and I'm going to take this whole concept back to our hospital. They need to just, right now they are all working at a spinal level. They just work. So they are not thinkers. And if we can make them hungry to think and be part of improving the care, it would be important. So last part of the key performing indicator board, and rounds happens on key performing indicators. It cannot be post-mortem after a month. So have you suggested the solution? What is the problem? What is the suggestion? And can we look at a timeline to address it? So I think there are many ways which we need to address, and what Raj mentioned about team and what was mentioned about quality circles are fantastic points which I'm going to take to improve clinical care.
Thank you so much, Sanjeev. In fact, it's blaring that time is up, and usually my team is the one that comes and gives me the ishara ki, bas karo. But I think the kitchen staff is us, the noise that they're making. But I'd like to ask one question to all of you, and if you can just restrict to 30 seconds. When we are talking about building efficiencies in the hospital, all of us are CEOs which are reporting to the trust management, etc. And some of us are running hospitals which are with a very charitable mindset background. Some of us are responsible to reporting to the investors, So how do you manage the stakeholders to create a mindset shift to start thinking of efficiency in delivery of healthcare when you're explaining why you need to invest in building efficiency? So whoever wants to go first. But let's just restrict it to 30 seconds each.
So the only way to manage stakeholders in this thing is for them to understand that efficiency is going to result in better patient care, and it will be a better value for the organization. So the stakeholders, the board, the management, the trustees, investors, everybody is looking at higher value. Somebody is looking at higher financial value. Somebody is looking at higher reputation. But as long as we are able to link all our actions to the higher purpose of creating a better value institution, it works. So
whether you are a charitable hospital or a for-profit listed company, I don't think that's the compelling reason for doing what we are doing. We need to do it because more than availability and accessibility, it's the disparity or inequity in India is a major issue, and we need to find ways to deliver better value for lesser money again and again. And it's very easy. I mean, that's such a noble mission that it's very easy to galvanize people around it. But the way you align your internal stakeholders is to first, if your CEO and leadership is not looking at it, no one will care about it. So it needs to be part of conversation all the time. And second, when you start the journey, you don't start the journey top down, but bottom up, to go and sit in the housekeeping and say, what are your most common complaints from patients? Tell me how you can improve, and make it their endeavor to get better today than yesterday and get better in this hospital or other hospital. And as long as you do both things, you know, this journey will be continuous improvement journey in future.
So हमें पैसे की भाषा बहुत अच्छी तरह समझ में आती है. So you have to cost it. So if I say I'm saving lives, I don't understand. So medication error, I have costed, and it is 23,000 rupees in my hospital. I can say that to improve processes. If I say if my patient waits, and that is 18,000 rupees for me, one patient who's waited for 10 minutes, this message goes on. If DVT prophylaxis is not done properly, the pulmonary embolism is 2,10,000 rupees. That message, that immediately strikes. If I don't wash my hands and my surgical site infection in my hospital is additional 65,000 rupees, that creates a more, because if I keep saying that, please wash your hands, there will be no infection. I don't see microbes and I still don't wash my hands. So anything what we do, if we cost it and then translate that into this as an action, it would, I believe, would have a larger impact.
I think that's a very good last message that, you know, metric create kar do, jo logon ko samajh aaye ki, you know, it is costing us as an institution for your inefficiency. You know, I think that's a very big message. Thank you so much, panelists, for, okay, we have, can I take one question? Yeah.
Good afternoon, everyone. And why I was so excited to ask this question, because I don't know when I get this opportunity again. So since all the great personalities are sitting here and we are talking about cancer and how you are making, you know, hospital more friendly for the patients, for their families, so that they don't get scared of, you know, name of the cancer or a hospital. Being myself a cancer survivor from advanced stage, I know how scary is this for the family and friend, and it's for the patient also. But this question is something else. You all are doing a lot to make your system better and more comfortable and more, how would I say, like sir, like Gautam sir said, when someone delivers, so you organize a dinner and do lots of other activities. Are you people also taking seriously your nursing and cleaning staff, who are the backbone of any hospital? Like, you know, as a survivor, I can say, when I go post my treatment and meet my doctors, I remember my doctor. No matter oncologist, radiation, or the medicine doctor or the surgeon. But how many of go and say thanks and give some nice note to the nursing staff? So my question is this: how many of you taking care of their mental well-being, and what you are doing to improve so in system, so that they can also feel the same happiness and they can give you the more productivity, and they handle the patients around them same nicely and happy way ke andar. Sorry, it's a irrelevant question maybe, but yeah.
So firstly, our wish is that you continue to be disease free. So from all of us. So you mentioned nurses are very important. So what I can tell you what we've done. So nurses, we know, are taking care of the patients 23 hours and 56 minutes in a day. So we have to take care of them. And so what we have done, we have created multiple things for engagement of the nurses. One is, of course, their regular training and skill improvement, and etc. Then we do their soft skill training. We also do some engagement program where we do some leadership training, so giving some management development, then take them out, off-site meetings. Then we have a quarterly Nurse Connect program where we internally we evaluate the best nurse, best ward nurse, best ICU nurse, best HOD, so on and on. So what it does, it keeps them engaged, and of course you reward them handsomely for that. But it elevates the level of nurse in the eyes of the hospital because they're getting an award, because everyone knows that nurses are getting, so everybody starts respecting them. That's one. Similarly, for housekeeping, etc., we have some kind of one program called Sarthi, and another is Sahayak program, where we do the training, etc., etc., etc. One more thing which we do for all this category, we started this in COVID, called Sampark program. So it's basically engagement program. So where we take care of their physical, mental, emotional, and spiritual health. So physical, of course, you ensure you do the activities and physical activities, etc. Mental, quiz, emotional, engage them in fun program. Spiritual, get them to do some meditation, etc. And, listen to some nice talks. So what happens is people, their engagement with the hospital elevates. And two things which we do in our hospital, which I think you should hear. One, we do not allow anyone to take tips from anyone. So what happens is, as a patient, I want to give a tip because I'm so happy with the nurse. But problem is, if I give a tip to somebody, this fellow is expecting tip from third person. So suddenly discrimination starts. So we don't allow that. So, and we do a unit-based recognition for them. And we tell them, people, and we share with nurses, with the workers, we share the feedback which we have heard from doctors, and I read it out say this is what it is. We go to each ward, give them awards, recognize, we write on the board. So we do lots of these things. The second thing which we do is that we do not have discrimination of different doctor or different nurses for different category of patients. So they're all common. So what happens in this is that everybody knows that we are a team, and everybody knows that today I am doing for general class, tomorrow I may be doing for suite class. So they all give that behavior, and I've seen patients love the nurses. You are saying you don't know the names. I can tell you, my patients, they tell me names of the nurses and the residents and the workers, which I also don't know. So I don't know whether it answers the question.
Fantastic. Thank you so much, panelists. Thank you so much. And thank you, Achal, for asking this question. Sir, the panelists are going to be here for lunch. We can take it offline because
I am very sorry for this. So you'll have to request, you'll have to take it offline. I'm so sorry. My budget allows this much time only. Just to put it that way, I'm so sorry. May I please request Siddharth Srinivasan ji, CEO of Lupin Digital Health, to please join us on stage and present a token to all our panelists. And we'll take a question after this, personally, I promise you. And thank you so much, Harbinder ji, for moderating that. Thank you. A picture, please. Yes, sir. Thank you so much. Thank you. My agenda here says that there's some very interesting entertainment and stretching session for the audience, but that's after lunch. And I always say this from food for thought. He's telling me cut the lunch time or he'll cut my payment. And no, sir, don't worry. I'll take care of that.
No, no, you know what? We have a very interesting gentleman who's going to be joining us immediately after lunch. Shoaib, who's a Guinness Book of World Record holder for dancing for 50 hours continuously. So we have a very interesting session after that. So please join us back on time. I know we are running a little late, but it is our responsibility so that we can catch up with the speed. Thank you.
And we'll dance for 51 hours today. Yes. 2:30, I request you to please be back because 2:30 then Shoaib takes it on from there. Thank you so much. Thank you. For all our audience members, lunch is served right at the back of this hall, and for all our speakers, is served right outside the hall. Thank you. Hello. Welcome back, everybody. For all the ones having their lunch, we still have 2 minutes to go. So please enjoy the last 2 minutes as of now. You also have dinner, nothing to worry. Any of the BW Businessworld team members, if you are there, please, we're requested to call everybody else inside as well. So we can start. KK? KK? Can we ask people to come back in? Also, console. Iska volume, one notch. He's gone. Now he's back. 2 more minutes and then we shall start. Also request, please try and occupy, I mean not try, please occupy the seats in the front so that we definitely know you aren't sleeping. Including me. Including me. For our other bit, we have Shoaib. Thank you. Hello. 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 बंद कर दिया. Hello. More. Little more. It's okay. Okay. First questions first. Everybody had lunch? Okay. Everybody had lunch? Everybody at the back had lunch? Oh, wow. So it's okay. It's not going to be tough for me. It's going to be tough for the person who's coming now. तो अपना sorted है. Well, I will also join you in the back seat. Okay. This doesn't usually happen, but it's happening now. We have an entertainment and stretching session for all of you, so that we make sure that even if you love the lunch and your stomach's wanting you to go off to sleep, it shouldn't happen. And to do that, please join me in welcoming Shoaib from Dance Fit with, oh wait, that's Dance Fit with Shoaib. That's the session here. ये झंडा कल एक दिन पहले भेजा करूंगा अरविंदर सर, मैं पहली बार पढ़ता हूँ. Okay, everybody, yes, please welcome Shoaib on the stage. And if I'm not wrong, Shoaib has a world record for dancing for 50 hours. And आज वो हमारे साथ 51 घंटे करेंगे. Yeah. Over to you. Sir, आपने इतना खाया, हमने बहुत सारा खाया है. But over to you.
Hello everyone. सबने खाना खा लिया? दिख रहा है फेस पे, नींद नहीं आनी चाहिए. Okay. Thank you, BW, for inviting me here, and thank you everyone to come here and giving your valuable time. So my name is Shoaib Ali Khan, and I'm a dance and fitness choreographer and trainer as well. So I'm here to talk about dance and music. So dance is a word here already gives you this consciousness आ जाती है, conscious हो जाता है आदमी कि यार ये तो मैं नहीं कर सकता, I cannot do it until unless. Yeah.
You know what? I think I'm going to invite Aanchal to come and introduce Shoaib, because Shoaib is far too humble to tell about himself. So I don't think he's going to do a good job about telling about himself. So Aanchal, will you take the honors to?
Yes, sir. इसका मतलब ये नहीं है कि मैं बहुत ज्यादा बोलती हूँ. Yes, बिल्कुल सही कहा. So Shoaib is a choreographer. He made a Guinness World Record for 50 hours non-stop dancing and longest dance party with the MTV till now. And also he is conducting lots of workshops for the corporates, for the medical system, for the BSF, for Delhi Police. And recently we came across with so many situations like BSF में आप सबको पता है जो border पे force होती है उसको मतलब किस तरीके के stress से वो निकलती है. तो फोर्स जो वहां पे होती है वो खड़ी है, बस गन लेके खड़ी है, उनको कुछ नहीं पता क्या होने वाला है क्या नहीं होने वाला. वी गॉट टू नो बिकॉज ऑफ दिस काफी सारे ऐसे ऑफिसर्स थे वहां पे जिन्होंने सुसाइड कमिट कर लिया, एंड दे डोंट हैव एनीथिंग ऑन द नेम ऑफ एंटरटेनमेंट, एंजॉयमेंट और लाइफ में खुशी क्या होती है. So we conduct, Shoaib conducted a workshop for 8 battalions in Northeast last COVID से just पहले. उसके बाद दिल्ली पुलिस अप्रोचेस, अभी उनकी 800 फीमेल्स की कॉल सेंटर की टीम है विच रिसीव्स 50,000 कॉल्स एवरी डे. हम लोगों से कोई एक कॉल पे अगर तेज आवाज में बात कर ले तो हमारा दिमाग और टेम्पर दोनों खराब हो जाता है. इमेजिन दीज ब्रिलियंट दिल्ली पुलिस वुमेन हु आर हैंडलिंग 50,000 calls every day, and we are very happy when they approach us that we want to do something for our females who are throughout the day just sitting and entertaining call. कोई मर्डर के लिए कॉल कर रहा है, कोई किसी के लिए कॉल कर रहा है, किसी के घर में रॉबरी हो गई है, किसी के साथ कुछ हो गया है. सो वी आर वेरी प्रिविलेज विद शोहेब के शोहेब के इस डेडिकेशन से ही इज एडवोकेटिंग डांस, नॉट जस्ट कि डांस है बट हाउ डांस इज हेल्पिंग पीपल. There are lots of corporate जहाँ पे शोहेब डांस वर्कशॉप कराते हैं and you see their productivity after that, because हमें ऐसा लगता है कि जिस तरीके का environment अभी चल रहा है, जिस तरीके के स्ट्रेस से हर एक कोई गुजर रहा है, हर एक किसी के लिए entertainment जो है वो बहुत जरूरी है, and why not dance? So we come up with this program Dance Fit with Shoaib, and here he is, all yours, and let him show some move now.
Best part is this is not a dance, it's you can call it aerobics. तो अगर मैं ये टर्म यूज करता हूँ, if I use this term dance, तो of course आप लोग थोड़ा सा shy feel करेंगे और you'll feel कि अभी नहीं कर सकता, ये नहीं हो सकता. So this is actually more of aerobics. Like you just need to move. I mean, it's a footwork. That's all. Nothing. It's quite simple, very easy. जब सनी देओल कर सकता है तो कुछ भी कर सकता है. So actually सनी देओल के साथ ये story है. He's a very shy dancer. लेकिन कोरियोग्राफर को जब पता चला कि सनी देओल है तो उसने सारे घोड़े खोल दिए कि क्या करा जाए. तो उसने एक स्टेप इन्वेंट किया. You know it. It's quite similar to धर्मेंद्र जी. So ये मैं almost I've been dancing all my life. It's quite a journey for me. तो मैं वैसे भी वही लोग ढूंढता हूँ जो उन्होंने कभी नहीं किया हो. तो 5 मिनट मिलेगा आप लोगों का? Will you? It's quite simple. Just stand. ये खाना हजम हो जाएगा 5 मिनट में. But कोई shy feel नहीं करेगा. Just do it. एक और सेशन हो सकता है खाने का इसके बाद. I'm telling you, right? So I'm just playing this music. You just have to move. Just footwork. And मेरे पास कोई म्यूजिक भी है, शायद आपको पसंद आएगा. And Delhiites are more about Punjabi, right? So it's a Punjabi music we have and one English Punjabi one. It's quite fast. Thank you, everyone. English, can you just stop it? The other one, English one, right? Yeah, we have two actually. First, a warm up. Second, see the stage पे. Achal, please come. We need someone. And anybody who wants to come, ये बहुत बड़ा है. You can come. Anyone? Okay, let's go. Yes. Oh, thank you so much. Shall we? Let's go. Wow. Just a quick walk, step. Right. So this is quite easy. You can't say कि मैं move नहीं कर सकता. Right, now you hit back. Girls are always a good dancer, I can see that. Okay. I'm back. Let's go simple one. And let's go. That's 80s one. Right. Yo. Awesome. Let's go footwork again. Arvinderji, awesome. To the right. Hey, good to the left again. Right. Okay, now everyone clap. Louder. Two, three, okay. And go. Right. Yeah, perfect. Awesome. Stay. We have got one more. No, this was a warm up. Okay. Girls, you're really doing very good. Okay. Smile, हाँ? कौन? सब तो कर रहे हैं, लेकिन थोड़े डरे हुए भी हैं. किसी की जैसे प्रॉपर्टी नाम हो जाएगी. Now it's good. This was warm up. Let's do one more. Shall we? The Punjabi one. Anybody wants to join, please come. Yes, you can show your talent. Can you put a little bit of volume? Right. Please come. Out. Okay, stop. There you go. Let's go. Do just in aerobics. Hold it. Just a shift. Shift. Throw your hands up. Go. Hello. That is simple. More. All right. 5, 6, 7. That's really good. And
Awesome. See, I told you how easy is this. You all are dancers, I'm telling you. Like a 2 more minutes. Cheers. 5, 3, hands up, go. Go. 5, man. Now see. Now go to the right. Louder. Okay, last. The last 2 minutes. I swear, बहुत भूख लगने वाली है. To the right. There you go. 5, 6, 7. Here you go. That's it. 8 more. Go on. One last. Awesome.
बहुत थैंक यू सो मच। आई होप 25% का तो फर्क पड़ा है, किसी को कोई गिल्ट नहीं होगा घर जाके कि ज्यादा खाया था आज।
So, how was it? I told you, just a trailer. So you just do it for 40, 45 minutes, enough. You just keep on eating. So had fun? Oh, that's really good. Thank you so much. And you can go for another session if you want. So I'm just saying, like, I'm doing it all the corporate, health sector, other sector as well. And it is really good that people are taking initiative and they're thinking about their own employees and their people, their loved ones, everyone. So it's really important and really powerful if you do it not every day, but twice in a week at least. It's really good to respect your own body. You understand your body, you understand things, what's going on inside. Right, thank you so much and see you all. Thank you.
Thank you, Shoaib. You mind showing us those 8-pack of yours? Shoaib, दिखा दो ना. But 3 things. First, I saw console is having their own enjoyment. Light flicker कर रहे हैं. वो light वाले कहाँ भाई साहब? आपको अलग मजा आ रहा था लाइटों में खेलने में. Second, I realized you can even work out in your bandgalas. I figured out today. So no more complaints of मेरे gym outfits का है. And third, Arvinder sir, where is lunch? Anybody wants to have lunch now? Apart from you, of course. You're always hungry, I know. But before we move ahead, I think to present a token of love and appreciation and lots of smiles to Shoaib, let's please welcome him on the stage. Aye. Also, Arvinder sir, if you could please do the honors. So do we clap or do we dance and clap for you now? No. Once for him, please. Thank you so much, Shoaib. Thank you. Arvinder sir, but you dance well, huh? Hidden talent. Okay, and now let's get back to business. Of course, this is also business, very much important and likewise. Now we have 2 healthcare startups sort of presenting their bits, and They really need your support, your views, your guidance, and of course, more than that, your love, so that they should feel confident enough that yes, people are accepting what they have to present. And to introduce them, let's please welcome on stage Bilkis Naqvi, AGM, BW Healthcare World, and also of BW Wellbeing World. Everybody wants for her, please.
Food is all settled and everybody wide awake. Moving on to the next part of our agenda, we now put our focus on one of the most pertinent and visible change makers in the healthcare sector, the healthcare startups. The Indian healthcare sector is expected to reach $372 billion by 2025. This exponential growth is not just a testament to the country's evolving medical infrastructure, but also to the innovative startups that are redefining the care landscape. Keeping the BW commitment of promoting and supporting healthcare startups, we present to you two promising startups in healthcare, HealthPresso and Janitri Innovations. HealthPresso is an AI automated integrated content creation and media distribution platform for doctors. More than just a platform, HealthPresso enhances health communication and outcomes. I invite Mr. Dalip Singh Manhas, co-founder and CEO of HealthPresso, to please come and present. Sir, I request you to kindly stick to the times. We have 7 to 8 minutes for you, and then we can take 2 questions from the audience. And if there are any further questions, then they can take one-to-one.
Sure.
Thank you so much.
Yeah, thanks a lot. Thanks a lot for that. And good afternoon once again. My name is Dalip Singh Manhas. I am the CEO of HealthPresso. I'm joined by my colleague. He's at the console because we'll be presenting our platform as well. And I'm still breathless after that session. So if I'm huffing and puffing, please excuse me. This is like the most exercise I have got after like 3-4 years now, because I'm a startup co-founder. So, you know. Okay, so this is what we are trying to do. I'll try to keep it short. You have given me 7 minutes. I know that. I've already lost 1.5 minutes. This is the future of health providers that we are talking about. I was expecting that our session will be immediately after lunch, and I was not expecting this exercise, so I kept it completely full of entertainment. I created it like a comic book strip. And I know there are many health leaders over here, so please excuse me if you find it frivolous, because I don't want to do that. You are going to be my potential customers, so I don't want to do that. Yep, so look at this doctor. His name is Sriram Lakshman, which is completely not decided by me in the given context of where we are. And he's standing in his clinic and he's surrounded by a lot of medical books, and he's thinking, I want to share my knowledge with more people, but how? And then he's saying there are tools that I'm using today, like CMEs are there. There are other tools that I can use to reach out to patients, to my consumers. We call them health consumers, but they are not very effective. I can't reach a huge audience with these kind of tools. So how do I do that, right? And he looks a bit worried and he says, there must be a way out of this. And that's when his colleague enters and he suddenly says, hey Ram, have you heard of HealthPresso? It's a game changer for doctors like us. Yeah. With HealthPresso's deep tech engine, which we are calling Humeta, which is you don't have to really guess a lot. Meta humans is the new term that people are talking about. So we just bought it from there. You can create press releases, distribute them to media outlets, and amplify your messages on social media with just a click of a button at one place. And then the doctor looks at it and says, wow, this is very user friendly. And he gets down to the work. He opens HealthPresso platform and he starts typing in his press release on our platform. And he says, this could be the solution I've been looking forward to. And immediately it goes out of his screen and goes to a lot of media outlets, which pick them up. And that's when he sees that his press release is being seen by a lot of people outside. There could be patients, there could be caregivers. These people are seeing his press release, they're reading, they're liking it. And then suddenly a health presso executive appears next to him and says, hey, let me help you amplify your message. You have just done a press release. Let me help you out with social media messaging as well. So doctor, let us amplify your message. That's what he says. It's adapted or amplified using social media channels like LinkedIn, Facebook and all. It's adapted into a WhatsApp post. It's adapted into a blog. So those are the kind of things that happen. And then you see that doctor is surrounded by a lot of patients, some real, some imaginary, but they are listening to him, listening to his story. So this is what exactly Health Presso does. It makes doctors expert health connectors. That's what we are talking about. It's creating health connectors. Today, we feel that doctors are not able to take their stories to more number of patients, more number of consumers. That connection is missing. I have a story to tell. I don't know how to reach out to my consumers. So that's what Health Presso is doing. I will very briefly give you some gyan because my erstwhile boss wanted me to have some more serious slides also. So this is what we are doing. We are creating a content ecosystem which seamlessly connects health providers and health consumers. Now, health consumer could be a patient, could be a caregiver, could be anyone who is seeking health information today. This is our vision by 2028. In next 5 years, we would want to reach out to 1 million users of our platform, reaching out to more than 100 million health consumers. I will skip this part. I don't think you will be interested in knowing how are we going to do it. You just give us the money, we'll do it. This is very simple. Health provider comes to our platform, enters a very brief about what story he wants to communicate, and then let it to give it to our AI system. We do everything. We are developing first healthcare specific AI system, which knows how a health story is written, what kind of references are needed for those health stories, how do you want to get going on that. So that's what we are trying to do. These are some of the USPs, not very important for you all. This is the team. Swadeep, I'm not too sure how many of you know him, has been a legend in the field of PR. So he is the founder and MD of Health Presso. I am the co-founder and CEO. I have with me Siddhant, who is sitting there. He'll be explaining our platform. Manoj is our CTO. He sits out of Canada. We have a team of technologists sitting out of Canada and India for doing this. We have some very senior people from the media world. I'm sure some of you guys must have seen them on TV as well. Kishore Malviya was with Z News for a very long time. Same is with Mr. Rajiv Tikko, who was senior editor of Outlook. So that's right now the team is quite big, but these are main 8 people. That's all from my side. Just give me a moment. Can I show demo of our platform, or you want to ask question? I'm okay with anyway. You are going to fund me. Tell me what I need to do. Siddhant, can you just very quickly show? So this is how the platform is. We have skipped some of the steps. Sorry. Yeah. We have skipped some of the steps. This is where you just enter 30 to 100 word brief of what story you want to tell to the world. Can you do that? Because I want. Sorry. Yeah. Oh, thank you. Yeah, so you can attach an image. This could be a doctor's image. This could be a image of a person or anything related to the surgery that you have done. AI creates automatic article headings. You can choose one of the heading. If you want another heading to be given, you can enter yours, submit it for vetting. At the back end, our content team and the AI engine creates the article in flat 5 minutes, which is with all the data, with all the references that you need. I'll just give you one very simple example. So this was the demo. Very simple example. When this Poonam Pandey controversy happened, we entered that text over here. So, and we wanted our point of view on cancer. The AI system was able to create article with references from WHO, from American College of Cancer ASCO and all those sources. So if you want very Indian kind of resources to be done, so all the prompt engineering has been done in such a manner that we'll be able to get story that is picked up by health media. Yeah, you had a question, sorry. Yeah, sure. I can hear you and I can repeat it.
First of all, thank you to Nirula sir for inviting me here. And my question are in two parts. First question, which if you want to answer, if any of the dignitaries want to answer, is that no doubt healthcare sector is a booming and a noble sector, but how close are we from the thought to execution part, and all the things in which we can eliminate the shortcomings of it in the areas we lack? For example, thought to execution, the cancer vaccine, which is under development, which Russia has also announced. And my second other question is your model and everything. So it looks like the content aspect of PR will be totally taken over by your product and your technology, and the content industry itself is gonna undergo a huge change. So what are your thoughts, and what would you like to say about both the things, sir?
Okay, I'm so sorry. First one is not definitely my area of expertise. I will
Sure.
not want to take that
Sure.
question. I am an advertising person who has moved into, I would say,
Yeah.
more. And I've been in healthcare for the last 23 years. So I understand healthcare, but I don't think I am right now educated enough to answer on the behalf of such an august group. I'll answer the next part of it. Many people have asked this question. I was presenting at one of the places where there were a lot of journalists. So they asked me, is my job in danger? Am I going to become jobless because of something like this? And I keep giving same answer that you will not lose your job to AI. You will lose your job to someone who understands AI better than you. So that, I think, answers that question. I don't think humans will go out of existence just because AI has started doing something. In this one also, if you see, the first level of checking is always done by a team that we have at the backend. Now, if I was doing this 10 years back, I would have required 100 content writers. Today, I require only 7. So I have a team of 7 people who are doing this at the backend because they are becoming more productive because of AI. So still, human intervention is required because the human part of content, it knows what to write, how to write it, and what exactly will make a difference. You know what controversy happened today morning.
Yes.
Yeah. So I'm not going to get into that, but that's what is going to happen if someone is not really looking at the content and just sending it out. So we have ensured, and because in healthcare, the impact of it can be huge. If you're sending wrong information, we had people from cancer hospitals. So you know the kind of impact any wrong news, as we call it, infodemic can have, which happened during COVID when India became infodemic capital of India. So we don't want to get into that, and we know what are the limitations of AI and what are the strong points of human being. So we are trying to merge both. It's not going to impact, as per me, that much.
So thank you so much. And the first part which I wanted to ask, so if anybody would like to answer the thought to execution part, obviously our healthcare sector is great in every aspect. And the only thing which my question is, like, for example, the cancer vaccine, which is under development, there are many aspects which are under thoughts. How close are we to bridging the gap between thought to execution?
Anyone? Sorry.
Okay, sure. Thank you.
Thanks. I think I've run, my time is over. Yeah.
I have a bit of experience in AdTech myself. Goes back when I was working with Yahoo in the Valley and making their systems. So I have 2 questions. As I understand, this platform is not self-serve but managed. So a team of account management and campaign management will be sitting. They will be trafficking, scheduling, and managing the campaigns. So the first question is that, will they be able to set these campaigns on goals like CPM, CPI, CPA to calculate the ROAS, or it will be CPM predominantly because this is content marketing, quote unquote? The second is, the biggest challenge that I've seen in the distribution of AdTech products, whether it is self-serve or managed, is the attribution. So DC Storm, Adometry, Peer 39, Google Analytics, they all have different models of attribution, predominantly last click, last view. So how would you be able to tell if the content is giving value as per the attribution analytics, whether it is made by you or you're using any third-party connectors for that?
Thanks. It's a very nice question. If this question was asked around 3 years back, I would have given a different answer because at that point of time, I was a co-founder for another company that was into ad tech. This is not an ad tech platform, so to say. Right now, the issue we have identified, and it's very specific to saying doctors are not able to connect with their audience at a very basic level. If you go to a large hospital today, or if you go to any doctor who is practicing individually, you'll find that they're not able to take their stories out. People don't know the kind of work that I'm doing. You can't do advertising in India as a doctor. Hospitals can say that if we have a team, we have 7 doctors, we have 10 doctors, those kind of advertising you must have seen, but doctors can't advertise. They can only give out information that educates their patients. So in this platform right now, we are not applying CPM, CPC, CPA kind of a metrics. This is very simply to say, you want to take your story out, we are helping you with that. Our AI engine will ensure that the information is SEO optimized. We are doing that. That's how prompt training has been done at the backend. So it will ensure that your story is visible to more number of people. Right now in India, very frankly, through news distribution agencies, it's very, very difficult to find out how many people saw that, how many people clicked on it. But be with me for next 2 years. We are cracking that, and we'll be back once again, where the whole matrix, starting from when he's entering the content to when it is showing some kind of action, which in a doctor's case will be increased practice, we'll be tracking the whole continuum of that. But it will take some time.
Just to get a sense of perspective, how big is this industry? For example, I know gaming advertising around the world is close to $780 billion and near about, I don't know, $32 billion in India in the next 5 years at a CAGR of 42%. Since there are so many problems to be solved in healthcare ecosystem, I definitely don't see this as a main problem to be solved, which is advertising and marketing for doctors. But I still want to understand an Indian doctor who wants to propagate a message around atopic dermatitis. They have a lot of platforms currently to do that. But if they want to do this SEO stroke SEM for their own voice to reach to the customers, then, or users or people who are coming on platform, then how big is this industry? What is the typical marketing spend that you are seeing? Not the average order value, like the top line.
It will be around $300 million in India right now. That's how much is being spent on doctor marketing.
Wow.
Yeah. Globally, the industry is quite big. I'm so sorry. You can ask me questions later, I think.
Sorry for that.
I'll be killed. Yeah, thanks.
Thank you so much, Dilip. Sorry, we are short of time. So I just thought I'll come and just remind you. The next presentation is by Janitri Innovations. Janitri Innovations aims to reduce maternal and infant mortality through advanced smart fetal maternal Dopplers and software solutions. Ms. Priyanka Singh, AVP Clinical Research and Public Health for Janitri Innovations is here. I welcome you. Again, your time is 7 to 8 minutes and we'll take 2 questions.
Thank you, Bilkis. All right, so my introduction is given. We can start with the video directly. So, journey of life. Pregnancy is a beautiful journey filled with hopes and dreams, but not all journeys are as smooth as they seem. It's a stillborn. Complication arises, some get detected, some are not, and these lead to maternal mortality and morbidity. But every dark side has a ray of hope.
हमारा विजन है कि कोई भी माँ और बेबी प्रेगनेंसी के टाइम, डिलीवरी के टाइम या पोस्ट डिलीवरी के टाइम ना तो उसकी डेथ हो, ना ही इसको कोई लाइफ लॉन्ग कॉम्प्लिकेशन हो.
A vision to save lives. So we have variety of monitoring solutions for maternal and fetal care. So we are present in hospitals, homes. We are working globally from India with a vision to see a world where no mother dies during pregnancy, labor, or post-delivery. We have monitored more than 60 plus women, saved 5,000 plus lives, and served 600 plus hospitals. So I hope the video did give you a brief idea. So now let's go a little bit more into the market side of the business. So this is the market side. It's a 10 billion market that is there. And in coming 5 years, we can make 100 million out of it. The segment would be the antenatal, intrapartum, postpartum, vital monitoring. So in India market, it is a 100 million market, which includes a pregnancy in hospital and home monitoring and in the newborn monitoring. So these are our business models. So we are working B2B, B2C, so directly with the hospitals, we are working with the distributors, we are working with the government. We are also directly selling it to the mothers. So where these devices are being used currently? So these are being placed in the hospitals. They are directly given to the mothers. They are also used during the ambulance because during the transits, there is no facility of the monitoring and what is happening in the ambulance cannot be seen at this point. Whatever is happening in the ambulance, they will get to know once they reach the hospital. But our devices are placed in the hospital and they are doing the remote monitoring. So all the information is already present at the hospital when the woman is visiting there. Then we are also working with the community, the A&M and the ASHAs. Then we are also developing the newborn and the infant care products. So we are covering a 1,000 days journey. So from the time of conception till the baby is 2 years. So we have different variety of products. So if we talk about the first one, that is, we start from the second trimester, we have the Care Echo, which monitors the fetal heart rate. Then moving forward to the third trimester and the labor period, we have devices which monitor the fetal heart rate, maternal heart rate, uterine contraction, fetal movements, and along with the software. So we are moving towards digitalization where we are trying to make digital labor rooms. So everything will be digital. And when we talk about labor rooms, you would have visited and you have seen a lot of paperwork is there. All that paperwork cannot be used just because it is not digital. When they want to know at this point how many women are there in the labor room, the policymakers, they are not aware. But with the live monitoring and the dashboard, they can know at this point what is happening, what is the current situation. So if anything comes urgently, they can directly take a decision, they can make the policy, and they can help the healthcare. Then moving forward, after the delivery is happening, we have a device which can predict the postpartum hemorrhage. And postpartum hemorrhage is one of the leading cause of the mortality after the birth. Then in coming years, we are coming with the neonatal ranges as well. So what we have achieved, so it's 6 years of R&D. We have monitored more than 65,000 women, and we have received the certification that are required, and we have 5 patents and 19 are filed. So we are almost present in all the states of the India. Globally, we are present in more than 10 plus countries. So what's next? So in this coming year, we are launching 5 more products, which are going to be focused on the maternal and child care, focusing especially on the newborn care. So what is going to happen in this current year? With the new launch, we are going to raise our revenue to 30 crore. So in this year, it is projected as 8 crore. So meet our team. So it's a mix of biomedical engineer, public health, designers, medical regulatory department. We have a medical advisory board as well. Then we have business advisors, our clinical partners, supporters, which includes UNICEF, BMGF. Yeah, thank you. That's all. Any questions? Yes.
How is SAM 1/10 of the target addressable market?
So I think that is something the market research has been done, and that's what we have found out from them. Yes.
It's not question, it's just a suggestion. You've shown 23.6 mortality per thousand, in the beginning.
223, it's a global rate.
That's a 10,000. So if you see Japan is very low. They are probably 1/6 of that on a standard basis.
Correct.
So you should study a little bit of Japan model.
Yes,
Because
yes,
that's
definitely.
something so encouraging
Correct.
that we should really copy what best practices they do, because babies are born there also.
Correct, sir. Yeah, thank you. Thank you.
Thank you so much, Priyanka. And over to you, Aditya. Aditya, where are you? Stage is yours.
Thank you. Thank you so much. I think both the startups, they deserve a big round of applause. That's a confidence from your end. And also for the first one asking for investment, I believe. Was it you, sir? The first startup? मिला कोई फंडर यहाँ पे? मिलेंगे. शोएब का एक सेशन करवा दो आप. उसके बाद बहुत मिलेंगे. But yes, thank you for doing that. Up next, time for our next keynote, which is on medical tourism in India. The opportunities, and to talk on that, please join me in welcoming Dr. Abhay Sinha, Director General, Services Export Promotion Council. Let's please welcome, sir, everybody.
Thank you, Aditya. In fact, I think I'm rushing for this keynote address. I don't know, how to start, how to begin after lunch. And you had those steps also. Here, some thought I would like to share. But before I go ahead, many of you may not be aware of the organization which I represent. It's Services Export Promotion Council, a setup under Ministry of Commerce, Government of India. Established way back in 2006, the mandate was given to promote export of all the services, including medical value tourism. Now, initially it may have been sometimes approach towards promotion may be very much disintegrated. But later on, we realized that when we talk about tourism, it has actually 2-3 more components: film tourism, medical value tourism. And medical value tourism itself cannot be seen in isolation. It's not about hospitals. It's not about the facilitators who might be bringing a lot of patients to India, but it's about the entire value chain, where you need to analyze the value chain, the journey of a patient from a given country to India. How do they come, and what kind of services they require? Not only the treatment, but that entire journey needs to be mapped. So all those things started coming up for discussion, and of course, like a lot of challenges, issues, the expectation. I'll try to be very brief in my address, and some food for thought and some new ideas. And I saw the Health Presso presentation, and something clicked. So I'm going to discuss that also. But anyway, let's begin with some data. And if I can ask the slides to, is here? Yeah. Just try to map in a very simple way, the MVT ecosystem, where you have hotels. That's very integral. In fact, DG Tourism and IRCTC, they were thinking to have a portal where they would have all the hospitals and hotels aligned with each other. A lot of work is required to be done. And, in ministry, things don't move that way because so many other issues and challenges needs to be taken into account. We also understand about the expenditure and the institutions who are providing a lot of support for the medical value travelers. And insurance is one of the key concerns these days. Overseas patients coming to India, whether they are insured or not. So those things we are trying to handle. And then the information, not only information about the hospitals, but also the credibility which can be built on the information. A lot of hospitals are doing their bit in getting the patients to India, but how many are having that credibility in the global market? At the same time, there are intermediates, mediators. They are also talking a lot. They are creating awareness. They are doing great job. But at the same time, how do you differentiate between somebody who is genuinely creating a value for India's healthcare system, and at the same time, there could be many who might not be adding value, and a lot of negative perceptions might be building up. A few data, in fact, for me, it's very difficult to read from here, but I believe for everyone else, this is just a snapshot on where we are and what is the global potential. So at the center, you'll find India is ranked 10th out of 46 countries in medical value tourism by Medical Tourism Index. Unfortunately, the data is also one of the issues which dampens, or which actually doesn't give the very much just in time kind of assessment. And that's where we have a long way to go. We are struggling with that. India has over 1,600 hospitals, and those are all NABH accredited. At the same time, like we do have 52 JSI hospitals. We have seen certain increase in the number, but now when we analyze it with the competition what we are having, it's a matter of serious concern. This is the aim of what we expect to reach 13 billion by 2026. A long way. Right now, the data, like, you want me? Okay. Not much here. So 2 million patients visit India every year, and from 78 countries. So far, like when I discuss this with hospitals, they have been doing their bit. This data is collated from their feedback, but there is no strategy to look at the emerging area. There is no strategy. Individually, hospitals are doing, even doctors are a kind of, goodwill ambassadors. They're also doing their bit. But if we have to have a national strategy on medical value tourism, we need to have convergence of the data. We need to have the convergence of the thoughts of the Ministry of Tourism, Ministry of Commerce. I'm representing Ministry of Commerce. So we're trying to build that, but here the participation of hospitals is very much required. I feel like that's the sector which needs to understand the value which we create. I'll give example of pharma, and that's very important example. I've handled pharma for over 13 years in Pharmexcel, another export promotion council, and we tried to create that brand, pharmacy of the world. And during COVID time, you would have heard our Prime Minister talking about India as pharmacy of the world everywhere when we were, initiating our own exercise on vaccines, the delivery model, as well as the manufacturing model. That brand was built, initiated way back in 2009 or 10. It took 4 or 5 years, but there was a kind of, the entire industry galvanized together. That's what is required in healthcare, this segment of healthcare, where we are trying to attract a lot of overseas patients to India. How do we create that value? Healthcare has always been a very political subject, globally also, and more so when it is skill related. It's not manufacturing. A lot of intangibility is there, but at the same time, you have those tangible elements of a good hospital, good infrastructure, and definitely good word of mouth. How do we create that publicity? We also talked a lot about cost advantage. It may not remain the same. And we are seeing that we are losing our patients. Those who used to come to India are going to other places for very, very specialized treatment. They are moving out. And Thailand recently has emerged as a very strong competitor. Turkey. And in fact, UAE also has emerged as a very strong competitor. So we need to have a strategy, which area, like when we talk about pharma, we do know that for cancer patients, for liver patients, and for many other therapeutic areas, India has the answer to the world by providing very, very affordable medicine. And of course, up the value chain, we are moving. What we are trying to do here in healthcare, that is one thought I'm leaving you all with. I just mentioned about it. Certain areas mapped, the countries, and you see Thailand up there. India is, of course, they're providing a lot of services, a lot of therapeutic areas being covered. But we need to move up the value chain, and we need to have more hospitals, more, what do you say? When we analyze, like in India also, when we try to analyze number of hospitals and the patients, and here we have to cater to the overseas patients as well. How do we create that value and give them the sense of not only the cost effectiveness, but at the same time, the good care? Another area which has been added now and is very much in the focus is Ayush related therapeutic. And we sometimes call it alternative medicine system, wellness. So that's another area which is there we need to focus. Well, this is something which I have, like in my course of points I have mentioned, but I would like to say a lot of issues like visa, a lot of issues have been raised. Industry has been demanding schemes like ACIS. But you see, the government is ready to provide all the support for 2-3 things: market access, global branding, and infrastructural development. And at the same time, very, very important, the new emerging technology. And that's where, like, to Mr. Manhas, like, why I was very curious. You talked about, creating value for the doctors. How do they communicate about certain cases? This is what we need to take, the India story, globally. You see, we are talking about branding. Then globally, we are creating a lot of value. We are going to various markets. We are talking about it. But, how do hospitals see value? So not only doctors, but how do hospitals get integrated into it? How every component, it's not only hospitals, it's, the people who are facilitating, how do they communicate? Because there has been good stories about liver transplant, and like knee transplant, like that. I visited sometime last year. I was in Sri Lanka. A lot of hospitals from southern part of India, Kerala, were there in Sri Lanka, and they were talking about IVF. And that story is not known in this part, and globally also. Many countries are not aware that there are extremely good hospitals in southern part, and they are providing those healthcare solutions which needs to be known to the world. So this is how we need to create value, I mean to say, by discussion and coming up with some recommendations, some thought process. And that's where, like, ACPC unfortunately was not too much forthcoming, but in the last 2 years we have tried, and we are trying to address this sector not in isolation. In fact, we have just engaged KPMG to look into every constituent elements of medical value tourism and find out some kind of solution and recommendation. On our part, like, just for those who are not aware, we have also initiated, earlier we did initiate called one market related program called India Heals. and Fiki also had been doing Advantage Healthcare. So there was a convergence last year. We changed the name, and we thought to give a kind of, uh, holistic view, and we call it Sanjeevani. And the first edition of Sanjeevani is going to happen in Chennai next month. I do have one small video clip if organizers can just run it. That will be an opportunity for all of you to come over there and meet a lot of facilitators coming from overseas, like close to 200. And we do have a lot of hospitals participating. Doctors are invited there. Can we run it? Yeah. Yeah, it's a video. I've sent the Google Drive link. Okay. Do I have that much time? Yeah, I just want to show. Okay, I think it's hardly 1.5 minutes, I believe. So you can see whatever I had to say, I've mentioned. But I would really will be willing to take questions because, this area and the council's work has not been known too much. And we do play a very, very important role in promoting MVT. And we are looking forward to a lot of ideas. We are looking forward to connect with every hospital. We are looking forward to connect with, technology service providers. We do have a portal. And in fact, Ministry of Health and Family Welfare also was preparing a portal. In fact, I can give that example. Uh, uh, During COVID time, there was a portal to be created. Of course, they didn't launch it because of certain other reason. But way back in 2015, our Honorable Prime Minister inaugurated one portal, Health Tourism, which was being taken care by ACPC. Somehow, another duplicate work was being done, and we are trying to revamp it. That's why I don't want to show that right away. But a lot of, it talks about the entire value chain of a patient, the journey, the hospitals. Hospitals can provide their details on that. All the NABH hospitals are listed there with the contact details. A lot of ideas are there. A lot of inputs can come from all of you if you visit. Maybe like after some time, I'll be through at some other platform or through the contact details, which I'd request the organizers to share with me. I'll share those details with you. Thank you so much for listening, and believe it adds a value to all your efforts together. Thank you.
Thank you so much, sir. Please request Harbinder sir to join us on stage and present the token to sir. Can we have someone from the team called Harbinder sir from outside? Kiki, can we? Also, once the video is downloaded, we'll show it to everybody, sir, once it's done. Yes? Please. Okay, we'll do this also later then. Thank you so much. Everybody once for Dr. Sinha, please, for taking us through that this domain also exists and why does it exist and how can it benefit all of us. Thank you so much, sir, for doing that. And up next, time for our next panel discussion. Harbinder, sir, thoda late ho gaya. But we can do it again. Dr. Sinha, please request you to join us on stage, sir. We'll have to present a token of appreciation to you as well, please. Also request Mr. Sanjeev Vashish to please join us on stage and help us in doing the honors, please. You know, we can clap. We should clap, in fact. Otherwise, Shoaib is waiting right outside. Thank you so much, gentlemen. Thank you so much. Thank you, Arvind sir. Up next, our next panel discussion on building efficient practices for doctors, reducing loss of follow-ups, including continual care. And to talk on the same, please join me in welcoming to the stage Siddharth Srinivasan, CEO of Lupin Digital Health, Dr. T.S. Clare, Chairman, Cardiology, BLK Max Hospital. Dr. Saab is on his way. You just join us. Dr. Reema N, co-founder and COO of Kites Senior Care. Vivek Srivastava, founder and CEO of HCAH. And this session will be moderated by Harbinder Narula, CEO of BW HealthcareWorld and also of BW Wellbeing World. Let's please welcome them collectively. Everybody to the stage. What happened to your energy? They're doctors, you can identify that the first. Thank you. And team, if we can have that video of Dr. Sinha after this session, yes? Thank you.
So we have Dr. Clare, who's just on his way, should be here in another 5 minutes or so. But thank you so much for being there on time. You know, apologies that we are running a little late, so you had to wait a little bit. You know what, Siddharth and I we caught up for a conversation a couple of months ago, and you know, we started, the conversation somehow moved to a point that patient aata hai from tier 2, they come to the city, they come to a metropolitan city, they go to a hospital, they get treated, they get operated, and then they go back to their hometown, and they ultimately need some local practitioner who they get under the care of. Now, there are two questions that really come out of this is, one, whose patient is it? The person who treated or the person who's taking care of the patient right now? And it is not about the finances. It is not about who's going to be benefiting or the lifetime value of that customer, of that patient, but it's about how does he or she get proper care. The continuity of care, that is a very, very important aspect that gets compromised unless this is addressed. And today, we have technology that is coming in, which is not only bridging the gap between these major cities as well as the tier 2, tier 3, but I think it is trying to build a network of doctors who can connect with each other and provide proper care to the patient. So that's the context of the conversation today. My first question would have been to Dr. Clare, but we'll reserve that question until he arrives. Siddharth, when we were discussing, we came upon this term called the loss of follow-ups. What does this term mean? Can you explain to us?
Okay, so essentially, loss to follow-up is very simply the number of percentage of patients who come back to the institute or the doctor where they initially sought care, right? So the denominator is the total number of patients and the numerator is the number of patients who come back. Let's take something like a therapy like cardiology. So if someone's had an angioplasty, loss to follow-up at the end of 14 days is typically about 10%, right? So there are 10%, 10 to 14% of patients who don't even come back for the first follow-up. But at the 3-month and at the 6-month stage, this number becomes fairly acute. So at the 6-month stage, in fact, it crosses 50%. So 1 in 2 patients does not come back for follow-up.
the implications of this can be pretty severe. A lot of patients tend to be comorbid. If you take again an example of cardiology, you have a cardiologist choosing to operate on one of the coronary arteries which is blocked, which is completely blocked. But there could be other arteries which have a partial blockage, which needed to be medically managed. Otherwise, that would have also led, to somewhat more severe consequences. And the fact that the patient doesn't follow up because he's lulled into a false sense of complacency means that there could be risks in the future. So I think that's the term, loss to follow up. And there are multiple reasons for this. Some of it comes down to sort of convenience or inertia, which is the patient feeling everything feels fine. Why do I need to go back? There is obviously economics. More than 50% of patients, their procedures are now paid for by some scheme or some insurance. But OPD consults tend to be out of pocket. And therefore, a patient is perhaps looking to skimp on that. Or it could be exactly what you said, which is the turf battle between the referring doctor and the specialist. So I think there are multiple reasons, but as a healthcare community, our objective should not be an either or, but how do we ensure the patient remains under the care of a specialist while having that care being highly accessible, highly affordable. So the entire purpose of perhaps this discussion should be to try and find that happy medium, which can perhaps combine both and not make it a binary choice.
Yeah. So Vivek, let me come to you. You are providing healthcare at home, and that's what your company is named after. When we look at care that we provide at home, it requires a lot of trust between the treating doctor versus what care is being provided at home, and requires a lot of collaboration between the caregiver, care receiver, the hospital, the general physician, etc. How do you, as an institution, collaborate with these other institutions which are involved in providing continual care, just so that the patient not only gets the right care, but also the comfort and the confidence that he's in the right hands?
So thank you for inviting me here. I think first of all, what we have also done is we have expanded our portfolio in the out of hospital space, right? So it's not only home, but we have post the hospital, there could be a continuum of care, and hence loss to follow up may happen even before that, right? So so what we have done is we now have physical format centers as well, and then we service patients at home so that we ensure that the patient is taken care of throughout the journey till the time he or she reaches the level of recovery, which is the potential maximum potential recovery, right? Now during this process, our fundamental thought process is that the first question which you asked, whose patient? So I think the way we manage is that the super specialist who handled the patient or the procedure he would have done or she would have done, that's the person who's under whose quote unquote supervision is what we are acting upon, right? So the continuum, while we will act on the patient and we'll continue to deliver back reportings and take feedback from the treating doctor, so that he continuously remains in quote unquote control of the therapy, right? And the systems and processes which we use, which could be technology enabled, or in some cases physically taking back the patient to the hospital and the doctor, is the way we manage the relationship. And while because we continue to take the feedback and act on with the doctor, the relationship continuously remains, and we don't have any super specialist available in our system which will lead to conflict, right? So all the people who we would have are people who would be looking upon, to the super specialist, and hence there is no conflict, there is no, fear ki mera patient chala jayega, and so on and so forth. That's something which we've been, making sure it happens for the last 12 years, and we established ourselves in doing that.
Vivek, how dependent is your business on the remote monitoring devices today?
Well, we have remote monitoring devices which can help, but see, devices alone don't help, right? They can't, solve all the problems. First of all, healthcare has health and care both, right? The care component has humans involved. Machines can't care. Care is more emotional in nature, and hence humans have to come into picture. Health, to scale it up, if you can have monitoring devices, it probably addresses the affordability question, the access question, ki jahan pe koi nahi pahunch sakta hai. Wahan pe the machine could possibly give you the inputs, but acting on the inputs is not the machine's job. Let's say the machine, the remote monitoring thing, gives a beep that something wrong has happened. You will need humans to intervene, and hence it's not, it's part of the story, but a larger part of the healthcare story continues to involve humans, especially on the care side of things.
Let me ask you a question. You are into senior care. Sir, I'll come to you in a minute. You're into senior care. One of the things that have gone missing from our healthcare system, and at least that's my observation and understanding, is that we have suddenly lost this segment called the family physician or a general physician. अभी आपको chest में दर्द होता है तो आप assume कर लेते हो आपको heart attack हो रहा है, ठीक है, and then you might go to the hospital and know that it was a acidity problem, and it's a good thing. I'm not saying it's not a good thing. It's a good thing that people are cautious about it. But the fact is, people, without understanding why the symptom is there, based on the symptom that they have, they choose on their own which specialist to go to, right? You are dealing with senior care. What is it that you do that overcomes this problem? Do you have situations where the patients tell you कि मेरे को ये हो रहा है, मेरे को यहाँ पे ले जाओ? Or do you use some kind of a system, process, prognosis, some technology to understand what your response should be for a particular problem?
Sure. First of all, thank you so much for having me over here, and very honored to be with this awesome panel here. So just to take a step back to tell what actually KITES does. KITES is not a retirement community. We are not an old age home. We are not an hospice. So what KITES does is we specialize in giving three kinds of care, which is post-hospitalization rehabilitation care, palliative care, and dementia Alzheimer's care at the specialized facilities that we have created and at the homes of the seniors. So that's what we do. So we are out of hospital care continuum partners for the seniors and their families. 50% of the elders who come to us do not have primary physicians, as you rightly said, and that's what we also recognized. And that is one of the things that we try to inculcate in the people who reach out to us. Very, very important that we create awareness for the primary physicians, geriatricians, etc. Quite a lot of dearth in our country, but nevertheless, we have now seen in the last 1 year the geriatricians increasing in numbers right now in India. Though we have 61 MD seats in India, they go unfilled, unfortunately. But I think the younger doctors are also realizing it and taking up these courses, and it's very important that primary physicians takes up this role. Whenever people reach out to us, definitely we give them the right kind of direction. We are not only providers of the care, but also counsel them when they reach out. This is happening and we hear it out. In fact, the first phone call that lands in to our company is to a team of doctors who are trained to understand the need of what they want. Because when people call us, they will say ki ye chahiye. They will always talk the solution. But we hear them out and tell them what the right kind of solution is and accordingly guide them. And, so as you rightly said, primary physicians and the guidance that is involved, a gatekeeper to the health of the seniors is extremely important, which will enhance. If you know that 70% of the deaths that happen in the US, we don't have data in India, but US hospitals that happen is because of the side effects of the medications. This is where we will be able to, work on seeing that how we can reduce these unnecessary medications, over medications, under medications, interactions, etc., where people are able to play as a gatekeeper to the health of the person and manage the comorbidities, which is in the back end, whether it is neurologists, cardiologists, nephrologists. The seniors will come with 20, 25 tablets. How do we manage all this? So compliance of the medications, how do they go about it? So yes, primary physicians and like geriatricians in the elder age group plays a very, very vital role.
Dr. Claire, first of all, thank you so much for joining us. I know you had a very, very busy schedule. And Dr. Claire, what we were discussing, this panel is about the loss of follow-ups. There's a patient who comes from a tier 2. They come to a large hospital in a metropolitan. They get their treatment, but they head back home, and then they need the care of a local physician there. What are the complications that you think can arise out of it? And whose patient is this?
First of all, no patient is anybody's patient. No doctor can own a patient. It's a fundamentally wrong concept. People will fight, he's a patient for the last 20, he's my patient, there's nothing called my. Patients have right to go to any doctor at any time. So we should be very clear doctors in our mind. And on this premise, I realized almost 20 years back that it is totally nonsense to fight with your colleagues. Mera patient, tera patient, mera patient, tera patient. So this is our colleagues are more important to us than those patients. Usually doctors fight, mera patient legi, mera patient legi. So please, I will request everybody, all the doctors at least, that patient will come to you or any doctor on his own criteria. You should be confident of your capability, your own confidence in you. That मैं अच्छा doctor हूँ. If I think I'm a good doctor, I'm better than the doctor where the patient has gone. I think it is his bad luck. I can't help him. This is my concept. Say no, sir, patient फलानी जगह चलेगा. मैंने कहा मैं क्या करूँ? उसकी bad luck है. Is unfortunate. I don't care. So that's number one. Number two, three things. When question answered, I just overheard when I just entered. The remote controlling devices was the question. And Dr. Vivek was answering those, I think, answers. I think in the future, there will be more and more role of these remote control devices in the practice of medicine in the world. And this will be even more important in a country like India, which is huge, far-flung areas. So we'll have to shift to these devices, more and more devices. Actually, one of the segments which is having maximum kind of impetus now, particularly after COVID, as this so-called digital medicine, virtual medicine, far-flung areas medicine. And if you have to make a contact, remain in contact, you have treated the patient. Like I got a lot of patients from Iraq, from all over the world, Dar es Salaam. So I have treated him, but there's nothing called treatment there's nothing one-time treatment of the patient. It is not that it is appendicitis, I have taken it off and he's no more a patient of appendicitis. Cardiovascular medicine, I'm a cardiologist. Cardiovascular medicine is almost always a continued care till he dies or you die. So that's a problem. So the remote digital medicine can help us. So I tell these Iraqi patients that, okay, you want to take a consultation, virtual consultation after 1 year, take me. Because I know the patient, I don't have to re-examine him. I can give him right advice. Then another question was that the patient, has come from Muzaffarpur, let's say, and I have treated the patient and he was treating by some other doctor. Our philosophy, my philosophy is always that until and unless I think that the treating doctor is not up to the mark or he's really bad. Then I tell the patient that, okay, you need, I know so and so doctor in that area, you might consult him. I don't say change your doctor, diplomatically, that you might talk to the other doctor. Or I tell the patient, okay, let's have, for example, there's a patient, doctor in Karnal, Dr. Gupta, let's say, because I know his capability. So if a patient is, he say, okay, if your doctor, treating doctor, you are not having problem, you can contact him and he will always talk to me if he's in problem. There are doctors in my practice, Chandigarh, anywhere. If they feel that there is a problem with the patient, they will call me. So that's a continued care. And I have students. Now one of them is even chief of interventional cardiology in a peripheral medical cardiology unit. He still once in 6 months or once in 4 months he'll call me during the procedure. Sir, ऐसा हो रहा है, अब मैं क्या करूं? Because he has a confidence in me, I am available to him. Patient care improves. So it's a very important thing actually, that the patient is not being treated by one doctor. That concept is gone. We are not hakims. कि पल्स देखी, सब कुछ इलाज कर दिया, निगाह भी ठीक कर दी, कान भी ठीक कर दिए, पेट भी ठीक कर दिया. It's not possible. We are talking about allopathic medicine. In allopathic medicine, multiple doctors have to see the same patient. The patient comes to me this is a negative point of modern medicine. A patient comes to me, he doesn't have only heart, he has kidneys, he has liver, and he has his brain, he has got emotions. So we have to have a system, a comprehensive coordination between these doctors. If I refer my patient to nephrologist, I call him कि भाई इसकी क्या प्रॉब्लम है, एज ए कार्डियोलॉजिस्ट मेरे को क्या करना चाहिए, एंजियोग्राफी करनी चाहिए, रुकना चाहिए. So you have to talk to each other. There's another problem, by the way, how patients are mismanaged. Patient or big hospital, I'm talking because I always worked in tertiary care hospital, Scots or Max or Fortis. These are so-called big hospitals, multiple specialties, multiple doctors. A patient is admitted, okay, he has some kidney problem, nephrology consultation. Now this guy comes, and he is so focused on kidney, he doesn't see the patient. He doesn't see what is the cardiac problem the patient has come. He will write all the investigation. Like for example, in urea creatinine is rising. A patient I have admitted has heart failure. A patient with heart failure will give diuretic so that his urine increases and his water is out of the body, he feels better. So he will say, it's not my problem, it's a cardiology problem, give him more fluids. And that is how the patients are, in a very bad language, how they are fucked up in a modern system. It's a bad language, I know that, but that's the reality. So what my dictum is, that the doctor who admits the patient, he is the primary doctor. No advice of any other doctor should be followed without consulting that doctor. For example, my patient, I have a very clear instruction to my junior doctors, whosoever comes, let him see the patient, let him write whatever he writes. I have to see what he has written. Whatever I tell, do it, otherwise don't do it. So those are the kind of problems we are facing. But nothing for a patient, there's nothing better than coordination between the all treating doctors. Now, one thing more which I want to answer, because you were talking about primary physician to this Rima lady. Rima, am I right? It's a pity that we, as a country, we have one of the most modern medical doctors, most modern hospital. We have one of the most third-class doctors, third-class opportunities. If you go to just 100 kilometers off Delhi, the primary health center, if you use, you will start, I would like to commit suicide if I see those. I have seen those. I went to Jaisalmer for a trip, and I went to see the civil hospital. Believe me, I won't even take my dog there for the treatment. So, in India, there is no structured development of healthcare. There is no policy. For example, even educated man in Delhi, who's IAS officer, he gets a pain in the upper part tummy, he doesn't know what to do. He calls Dr. Claire, or he has a pain in the back, or he has a sciatica. He calls Dr. Claire. Dr. Claire may be in US that time. Sir, मेरे को टांग में pain हो रही है. Why? Because we have not created a system primary physician. In fact, I tell you, this is absolutely indicated. We have to come to a system where there should be primary physician for a particular number of people in that area. There are in Delhi, the doctor-patient ratio is much better than the WHO recommendations. If you go to Odisha or Bihar, the ratio is dismal. Why? Because there is a collection of these. There are so many physicians in Delhi. There are, I don't know how many physicians are there in Delhi. So I think if it should be ruled that this physician is the primary physician, he goes to the patient, goes to him, he can handle 90% of the problem, 90 at least. For 10%, he knows where this patient is to be referred. For example, Alney Institute and PGH Chandigarh, I am from PGH Chandigarh, is a mess. Why? Anybody can go there. Patient, only referred patients should be gone to these places. So these are so many issues which we need to handle.
I think you've brought this up very well, sir. So, let me come to you, Siddharth. One of the things that is emerging out of the conversation that Dr. Claire was, what he brought it up, is that, when we are looking at a human body, it is not just one organ that we are, looking at. And when we are creating technology, especially remote monitoring, and which is based on just data, are we not taking into account the need for a holistic feedback on what is happening inside the body, which requires a physical checkup? One is that. Second is, how do you, I know you have a product called Life. How do you address this problem of creating a primary physician as well as the consulting physician who's going to be there?
Sure. I think I'll take both of those. So just a very quick summary about what we do. My company's name is Lupin Digital Health. It's a subsidiary of Lupin Pharma, which many of us may know. Lupin Digital Health is a digital therapeutic startup. We work primarily in remote cardiac rehab. So patients who've undergone angioplasties or who undergone a heart failure index admission, we take care of them post-discharge, and we drive their healthcare outcomes. We use a combination of remote monitoring. We drive compliance to protocol, and we have several healthcare providers like nutritionists and cardiotherapists, paramedics, etc., who sort of drive overall care. Like Dr. Claire rightly mentioned, I think there is no pure cardiac patient, right? Almost 45% of our patients, we have more than 5,000 patients now on the platform over the last 6 months. More than 40% of them also have type 2 diabetes. Almost 15% of them have some form of renal issue, right? So it's actually a cardiometabolic renal continuum on which you have most patients. And this is not even to mention many of the edge cases where patients may also have psychosomatic issues, etc. But for us, a renal issue, a metabolic issue is extremely common. I think there are 3 ways for us to deal with it. Like Dr. Claire rightly mentioned, you start with the treatment protocol that has been recommended by the treating doctor, whether it's the cardio, whether it's the nephro, or whether it's the endocrinologist. Your job should be to drive compliance to that protocol and not question why something has been prescribed, right? If we have a doubt, we may reach out to the doctor in question, but chances are he would have evaluated the patient, right? So I think when you are looking at outcomes post-discharge, like Vivek also mentioned, the idea is to drive compliance to the protocol that's been set and not second guess. So I think that's point number 1. The second point is the advantage of a system like ours is that unlike a cardiologist or a super specialist who's very busy, we spend a lot of time with patients. So on average, we have specialists speaking to the patient for at least 3 hours a month. And therefore, a lot of these smaller issues come up, right? So we have an ML algorithm that runs both structured and unstructured data. Conversations are unstructured data. and we try and surface some of these issues. And if these are symptoms that the patient is sort of talking about, right? When I lie down, I start becoming coughing or I get breathless. Those are actually telltale signs of heart failure, which he may not, be aware of. So we then are able to record that as a symptom and provide him a report which he can take next time to the doctor. Right? So then the doctor is made aware that these symptoms are actually happening. But in the normal course of conversation, in that 10 minutes in front of Dr. Claire, he may not have mentioned. But in the 1 month that we've been speaking to him, he's been repeatedly giving us indications that he's suffering through heart failure. Again, it's not my job to tell him that you have heart failure, but it's my job to recommend to him that you should see your cardiologist about this particular challenge. So I think that is the second fundamental issue. I think the third point that Vivek also rightly mentioned is that you have to connect both the healthcare aspect as well as the people aspect. So you have to have a multidisciplinary team. They have to be experts in what they do. So I would never have someone of Dr. Claire's expertise in my team, but my cardiotherapist knows his job really well. He knows how to do segmental breathing. He knows how to improve the VO2 max of the patient. He knows how to make sure that the patient is able to cover more distance in a 6-minute walk test. Right? My nutritionist really understands what kind of food a Punjabi person eats. And if I have to make small changes, how can I drive portion control? How can I drive better outcomes without making a 180-degree change? So I think supporting the specialty units with these sort of decentralized multidisciplinary teams, I think would perhaps help. The reason we do it remotely is because we want to make it more accessible and more affordable. If I were to do the same thing in person, every session would cost as much as what we are charging for an entire year.
Sorry. I think I just want to add what Siddharth said. When we talk about compliance, it's a very, very important issue in medicine. People in India are kind of very funny. I don't know why. They can decide to increase the dose, decrease or stop the medicine themselves. So I tell you, I don't have to go far off. My dad had a hypertension. He was used to live in Punjab, so he came to Delhi. So I started medication. So call him after 2 months that how are you doing? He said, I'm fine. So are you taking medicine? Then I band karti. Why? He said, I thought it may become habit for him. This is it, father of a cardiologist. You can think about other people. So we have very funny, because I tell you why. In India, they think any medicine is bad, fundamentally. They may be right in a way, but a medicine which is required is required. So I tell people, you take food 3 times a day. Why you take food? Because you want to live and you have a quality of life. You take protein, you take vitamins, because you want to live first of all, then you have a good quality of life. If a drug is giving you longevity and quality of life, what's the problem in that? But when I say this, the only way to increase, there are 2-3 methods to increase compliance. First of all, doctor has to give time to the patient. Fundamentally, he has to explain. 98% of the doctor don't tell a patient of hypertension, bhaiya, this is a lifelong disease. You have to be on medicine for the life of your life, or you need at least monitoring for the whole life. अगर आपका BP ठीक भी हो गया, 6 महीने भी ठीक है, then monitoring cannot be stopped, because after 6 months BP will start rising again. The doctors don't talk. Now, when we come about doctors are busy, I agree they are busy, but then that is not an excuse not to explain to the patient. That's my point. Second thing, we need to have specialty trained nurses in every specialty. And we need to have physician assistants, like I'm very busy in my own, I have to do so many things. But then I see the patient, then that nurse should sit with the patient, explain everything. What Siddharth was talking about, that when you lie down, you start coughing, you have to, if you get up and get relief, that means it's a left ventricular failure. It's a serious symptom. For an ordinary patient, it's थोड़ी खांसी होती है. The patient will come, sir, मेरे को कोई ज़्यादा problem नहीं है, पर मैं जब रात को लेटता हूँ, मेरे बीच-बीच में खांसी शुरू हो जाती है, मैं बैठ जाता हूँ, मैं ठीक हो जाता हूँ. And I said, no, bhaiya, this is not a khas problem. Nahi hai. It's a very, very serious problem. You go, did your, do the echo of that man 20% ejection fraction and his BNP is 13,000 because they don't understand these things. So we need to have a trained nurses, trained assistant physicians so that we can relegate that training part, how much salt he should take, what activity he should do. Now there is a clear data available that the hospitals in the whole world who have specialized heart failure clinics, their patients do better. Their readmission rates are less. Their quality of life is better. Their longevity is also better. Why? A nurse will call the patient every 1 week or so. Mr. So and so, how you are doing? खांसी तो नहीं है, पैरों पे सूजन तो नहीं है, आपका वेट तो नहीं बढ़ गया. You know, it's a reinforcement. So this is the only way to improve compliance, to improve the outcomes of the patients.
If it's okay, I'll add one more to the point that you were talking about. Definitely, it's reiterating again that how primary physicians are extremely important in managing long-term chronic health. And as Sir rightly said, that it is 90% of the people who require tertiary hospital help. And I think it coincides with the data and the research that we have also done that 20% requires to go to the hospital. The rest can be managed outside. One more thing, and Siddharth is also here. Digital health is the way forward, and especially when it is also coupled with the primary physicians. It has to become a weapon in the hands of the primary physicians to manage the care long term, because chronic means long term, and we have to keep them out of the hospital as long as possible and give the time and the bandwidth to the super specialists to deal with serious cases, which are 10%, and the 90% to be outside the hospital managed with technology. So at Kite Senior Care, we manage this thing in 4 different stages. One, post-discharge, definitely they can opt to come to our centers for rehabilitation 2 to 8 weeks. Then when they go back home, they go back home with a home care help. So again, the follow-ups are there. We have also launched a technology platform where there is online consultation with our physicians, counselors, dietitians, physiotherapists, etc. What kind of help do you want remotely? And in geriatrics, especially when they are older, it's very difficult for us to pull them out of their homes and their comfort zones. So it is basically required to reach them rather than they reaching us. So at different facets, we have tried to see that wherever they want this kind of help, in whichever form we are there, and we get their data so that we are able to respond in that particular way and able to take care of them long term with quality care.
You know, more in the healthcare, I think in future you will see more and more role of artificial intelligence. Now there are, for example, in radiology, there's already a lot of established data. See, you can't have expert radiologist available in small towns. So you have to just feed that X-ray to that, AI equipment or the application. It will give you diagnosis, and these AI-based diagnoses are only generated after almost like millions of X-rays being scanned. It's not one thing. I mean, there will be applications in the future that you take a picture of the patient, and that picture, the AI can interrogate and tell that whether he has got heart failure or not. So, a lot is coming in the future. I think the most important thing where the medicine will improve, the practice will improve, is it's the digitization, it's the technology which is going to help the patient again and again. Now coming back to, I'll take just 1 minute more, the holistic medicine. I don't know what is holistic medicine. I have not understood so far this word being used left and right from everybody. What I understand why holistic medicine is, I would rather like to use a doctor, nurse, technician dealing with the patient should be passionate. He should have sympathy. He should be empathy with the patient. So if we don't have the empathy, if we don't have that sympathy with the patient who's a suffering human person, I really don't think what is holistic medicine. Everything else is useless. So that component should always remain. Technology, somebody pointed out that ultimately it's the patient wants to see my face. Even if technology tells that, okay, increase your LASIK, to 10 milligram, but he still wants to see my patient. Doctor, aap kya kehte ho? So ultimately, that human content, human exposure with the interaction with the patient, with the empathy is going to change the medicine.
Sir, I'll take this conversation further from the word that you're using, empathy. The problem in India, when you compare the doctors in India versus what we see in the West, is that doctors in India are overworked. They have no time. I mean, we have seen your schedule as well. But when the technology is bringing all this data to the doctor and also, taking to the point where red flags are there, does the doctor have time to respond to this?
Like we have implantable intracardiac devices like pacemaker and ICD, the defibrillator. Now there are many complex heart failure devices, CRT devices, and almost all the companies have a remote data you can have. So in that also there are publications that the remote controlling algorithms in devices, they improve the quality and quantity of life of these patients. There are data available, you know that. But in India, that's a big challenge. One is that the center, or let's say, if I have to see all those patients, I don't have time to see that. So unless we have sufficient number of trained people to look at that data, again, it is a challenge. Second thing in India particularly is that patients don't want to pay for this. They will send WhatsApp message, for example. Very treatment care. I mean, we all do free service. Still, we get gali from the public here. I think, to my mind, Indian doctors are one of the best, most easily available, cheapest doctors in the whole world. But still, हमें लोग गाली निकालते हैं कि जी डॉक्टर सुनते नहीं, खा जाते हैं, लूटते हैं, मारते हैं. I mean, if you go to those parties anywhere in South Delhi, the connect between public and medicine is gone in the wrong way, some or the other in India. And believe me, I have worked in India, I worked in the Middle East, I worked in UK, I worked in United States. Indian doctors are the best in the world. Believe me, there is a publication from Harvard. They followed patients, 50,000 patients over a 10-year period in that area. And they were trying to correlate that whether the outcome of patients depends upon the physician or it's just the so-called evidence-based medicine. Evidence-based medicine means that it's recommended. There are guidelines to do things. Everybody will do the same guideline, then same outcome should be there. And the result of that trial was that the patient treated by foreign medical graduates had better quality and quantity of life. And out of those foreign medical graduates, 79.8% were Indians. So we should be proud of that thing. But in India, you don't have value.
Yeah. Vivek, let me come to you. You want to say something?
Yeah, so I think your question on, see, the doctors here are busy because of the sheer volume we have in the country, right? So whatever we do, the number of super specialists in any specialty, if you pick up, is 5,000 at best. Isko kitna bhi badha lenge, the volume which we have will not be able to reach that level. And that's probably the reason people like us exist in the out of hospital space, to lower the load of the doctors for rudimentary things, right? So even if there are, these devices which come up with, certain alarms or etc., there may be standard protocols which the doctors would have recommended ki ye aayega to ye kar sakte hain, and we execute that and then go to the doctors when there is ambiguity, when there is when there are different conditions which are not there in the standard protocol. And that's where multidisciplinary teams which happen in the out of hospital space, whether in center, whether at home, and managing the patient, would be able to solve this problem. Otherwise, this problem cannot be solved by increasing the number of doctors, right? Because that's a very long process to get a DM. Aaj se 15 saal, right? Just the starting point itself. So for solving the problems, a lot of care has to come out of the hospitals, so that the hospitals and the super specialists treat precisely those points where they are the experts in treating, baki sab bahar.
My last question, because I mean, I have loads of questions which I had noted down, but the screen is blaring at me saying time's up. What I really want to know is that specifically, there's a huge connect between out of hospital care and hospitals. I mean, at the end of the day, we want the patient to remain well, right? What are the challenges that we face as doctors when we are transitioning a patient from a hospital to out of hospital care? And how do you think technology is solving or can solve this dilemma of the doctor, whether the patient is going to follow up on the treatment? Like you said, log apne aap hi medicine band kar dete hain, and the follow up that is required from time to time. So anyone who wants to share their perspective.
I think the most important thing, maybe slightly cliched, but the most important thing is that the patient should take charge of his own health. I think very often we see patients where the mindset is that I have outsourced my care to the doctor, so it is your headache to make sure that I am well, right? And especially as the burden of the system moves towards non-communicable, towards metabolic and vascular diseases, it is every day counts, right? The decisions you make every single day in terms of what you eat, how much you exercise, how much yoga you do, what kind of stress, how much you sleep, that adds up over time. And once you get the illness, unfortunately, it is progressive and it is lifelong. So I think the most important thing is for patients to take charge. And if they've had an illness now, or if they've had an event and it's been a wake-up call, they have to start complying with the protocol, not just medicines, but also lifestyle modification, which is extremely important.
I think you asked this question from a doctor's point of view. I think the most important thing the doctor wants is trust, right? That मैंने तो अपना काम कर दिया, but अगर आगे लोगों ने अपना काम ठीक से नहीं किया, there's a very high chance that the patient will come back, for rehospitalization. The case may become even worse in such cases. So the most important thing is if we can provide those trust to the doctors, right? That yes, we'll take care by showing outcomes, by publishing outcomes, by data, and by these devices which will help, collect and, connect the information and showcase that this is the right data information, this is the outcomes which we have created and so on. That will give the trust on the doctors, which will again reflect back on us, because the doctor will say कि हाँ हाँ यहाँ पे मैंने 100 patients किए हुए हैं, and let's say यहाँ पे rehospitalization नहीं होता है, या they managed well, the recovery is much better, and that becomes a circular story. And once the patient also trusts कि हाँ doctor साहब ने बोला है, then they also hear on whatever advices which we'll give, which will lead.
It's very important in our experience also. What we have seen is one of the very important factor is making them part of the decision making journey. That yes, this has happened to me, and that can only happen when the medical professionals are able to explain it to them that this is what you have to do, and this is why you have to do, and this is how you have to do it. Unfortunately, they go back to super specialists who are dearth of time. Again, makes it more important for people like us to be outside who are into chronic care to explain it to them why, what, and how, so that they take their own decisions along with their family, and then take the ownership of the decisions and do it by themselves. It's very, very important, and we have seen it being successful because they have taken the decision, though we have prompted them from the back end. It's not a front door entry, but a back door entry, but it seemed to have worked.
I think the crux is that it's a two-way street. So when you look at the doctors, we want them to get a feeling of serving the society. And at the same time, I think what is emerging is that the patients need to take ownership of understanding that they're seeking help, rather than saying कि मैं पैसे दे रहा हूं तो मुझे आप ये outcome दो. It's not a transactional thing. At least the business of healthcare should not be treated as transactional. But I think that technology is playing a very, very big game in terms of at least having the information flow happening, so that both parties, the patient as well as the doctor, knows what is going on, and if there is a corrective action that can be taken well in time, I think we'll be having a population that would lead a healthier and longer life. With that, I would like, sorry.
Just one, one ad only. I think it has been a very fascinating session, to be honest. Uh, I think in India, the problem is like uh, fundamentally, Indians don't want to spend on their health. It is something in their mind. I mean, they don't mind buying jewelry, making big houses, going throwing parties. But when it comes to health, itna महंगा itna महंगा, it is in mind. It's a mindset. So I think we need to teach our public, sensitize our public that, in fact, I have started telling wherever I go, I give them talk that health is most important thing in life. So you must invest in health. You must invest in health, and this investment is of two types. One is that you should learn basic health principles. That means we need to give health education to people. Second thing, I say, the day you start earning money, 10% इधर रख दो health के लिए. Keep 10% on this side for my health. Insurance कराओ, जैसे कुछ भी कराओ. So it's not free. Like these guys, they are doing a good job because doctors are busy, so they are taking the onus of, like heart failure patients, some other patients like rehabilitation. But patients, they don't want to pay them. They have a problem. मैं तो जी पहले वहां खर्च के आ गया मैक्स में, अब आप फिर मांग रहे हो. So there's nothing free in this world. These people, they have their everybody who wants to create a like Lupin, for example. This is a very good initiative by these guys, but patients have to understand they have to pay. It's nothing free. That's a problem. We have to train our minds in India that health means you have to spend money.
Thank you so much, Dr. Claire. With this, we're closing the session. Aditya, over to you.
Hello. Thank you so much, all of everybody. Once for them, please, for such a detailed session. Become a louder. A picture, please. And to present a token of appreciation to all of them, may I please request Dr. Abhay Salah to join us on the stage, please, sir. Kartike. Video. A picture, please. Thank you so much. Thank you. And Dr. Sinha, because you're here, we also have that video of yours we played. Because sir's here. Thank you for your phone, sir. I shall accept it and then get back to you also. Can we have the video that was supposed to be played during Dr. Sinha's session? Quickly, can we do that?
India has been healing the world for centuries with its traditional medicines. With the advent of modern medicine, India healthcare services have been at the forefront of providing the best healthcare services to the world, especially the global south. The best of infrastructure, connectivity, healthcare professionals, caregivers, and technology make India the global choice to deliver healthcare and wellness to the world and heal everyone with speed and scale. Now at Sanjeevani 2024, the best from India's healthcare industry will be there to offer their services to the world and heal the world. India Heals is now Sanjeevani. If you are a part of healthcare wellness industry in India as we invite you to be part of Sanjeevani. It's time for India's healthcare ecosystem to engage with the world and offer its services to heal the world. It's time for India to make the world healthy again. Come showcase your services, initiatives, ideas, and projects to the world. It's time for the Indian healthcare industry to be present at Sanjeevani 2024.
And if you wish to get any more details and insights into the expo, which is Sanjeevani, Dr. Sinha is here. You can get in touch with him for the same. Thank you so much, sir. Very quickly, moving ahead with a fireside chat, which is next. And the topic being the Made in India story needs to be redefined, how India is unique. And to talk in the same, to share their views, please join me in welcoming our panelist, Sunil Khurana, MD of BPL Medical Devices, Sanjeev Vashishta, CEO, Pathkind Diagnostics, Atantra Das Gupta, Senior Director, Southwest Asia, Head, Health and Medical Equipment, Samsung. And this one will be moderated by Rima Baduri, Editorial Lead, BW Businessworld. Please. Let's show some more excitement, no? Some more love to them, please. Like, yes. Also, my friends at the back, if you can occupy the seats in the front, nothing could be better. And this is the toughest job, asking someone to come in the front. But if you wish to, please, you can.
Hello, everyone. Thank you, Aditya. So our panel discussion now, actually, before we start, I would actually like if everyone could give a warm welcome to our panelists. Like, you know, it's a good exercise for the hands as well. So in the discussion, our topic is Made in India, how it needs to be redefined, how India is unique. Made in India is no rocket science, I would say. And, you know, especially during COVID, we saw how healthcare took a, you know, high end, how it developed into co-vaccine, Covishield, and everything was within ourselves. That aspiration of Atmanirbhar, as told by our Prime Minister Narendra Modi, we have actually adapted to it, and healthcare and doctors are superheroes to us in today's date. So before we start on with the questions, I would request my dear panelists to, you know, give a little brief about what they are into, and also what does Made in India defines for you in today's date in your industry. So I feel.
So thanks, Rima, for setting the context. So I'm Sanjeev Vishisht. I am Managing Director and CEO of Pathkind Diagnostics. As the name suggests, we are into pathology arena, and we started the company about 6.5 years back. I co-founded this company along with the Mankind Pharma promoters. So we are across now 27 states with 102 labs and about 2,500 collection centers, which are exclusive to us. And idea is to be available in the hinterland, make the services accessible to the masses. This was the basic premise with which we entered into pathology in Pathkind. Now, while I understand that since we're talking about made in India or make in India, it's something to do with something more tangible in terms of equipment, technology, gadgetry, etc. We're into service delivery. So, but I think I got a very different take on Make in India. We are in a country where not even 20% of the people have ever given their blood for testing. So making these services accessible to the masses is something which we thought will add tremendous value, because we know for a certain that in our country, the cost of diagnosis is only a cost, it's a fraction of cost of treatment. A stitch in time saves 9. If we are able to ensure that the patients, they don't fall very sick, by virtue of which they become a huge burden on the exchequer, I think we would have won the battle. So idea is to reach out to the areas, to the towns, kasbas, hamlets, where the services were not hitherto available, and by virtue of which you'll be able to contribute significantly in the development of the nation and making the nation healthy, so to say.
Mr. Vashisht, your take on it? Sorry, Mr. Quran.
So thank you so much, Businessworld, to have me here. I'm from BPL Medical. I'm CEO and MD. We started this company nearly 10 years back, and journey has been pretty interesting. We started with first year about 65 crore of turnover. This year we will be north of 500 crore. A lot of products we have, starting from X-ray machines to ECGs to patient monitorings to defibrillator to ventilator and many more products. So something like 65% of medical devices needed in any hospital is what we make here, or some we source. But that is what we are today doing. Very optimistic on Make in India, because that's a subject. And we have got 2 PLI applications sanctioned by Government of India. And we have built a new factory, and as we speak, we will talk. But I'll be definitely talking in terms of challenges, but I just want to tell in the very open way that the direction of PLI was phenomenal. And if you all remember, in 15th August 2013, soon after our Honorable Prime Minister took over the charge, that time also in first statement he said, I want more to be made in India. Come make in India. That was his slogan at that time. So it was more a slogan, but it is becoming a great reality. A lot of transformation, a lot of government engagement, different bodies are getting engaged to see to it that things really move in the right direction. It was not seen earlier, but really very encouraging things are happening now.
Thank you, Mr. Khurana. Mr. Das Gupta, your narrative on Made in India
in
the industry.
So I take care of Samsung health and medical equipment business for entire Southeast Asia. And as you have said the context, my take. So Samsung has started Make in India long before the Prime Minister has given a clarion call. We started developing softwares in India for the world, for ultrasound. Samsung in medical equipment arena deals with ultrasound and digital X-ray, which are one of the 2 equipments which are mostly used for the primary care. And we have already started making in India the detector, the flat panel detector for the X-rays, and we will soon start making India specific ultrasound within a couple of months. We already have got a manufacturing license, and we are into the fray. Thank you.
Thank you. So, Mr. Vashisht, when I come to you with Pathkind, when we talk about it, it is a brand in itself, first. Secondly, when there are so many, outlets, there's so many stores for your clinics for Pathkind, how do you leverage technology in this sector in order to, address such a mass population? Because naturally, when it's man-made, it becomes a more strainful. But when we have this technology that's coming in today, how do you leverage technology for addressing those things?
So first thing first, we have to realize that as a country, we've got dearth of everything. You know, the resources are scarce, and obviously it's a emerging economy, emerging country. Most of the people, they don't have access to healthcare, quality healthcare even today. So first thing first, the question we should be asking is why technology? Is it something which is a fad? Is something which sounds good, looks sexy, or is it something which is the need of the hour? So if you have to make something accessible where you have to touch the lives of millions of people, technology is a must. If you have to make the things affordable at the hands of the end consumer, technology can play a huge role. And when it comes to bringing accuracy, I think technology again is a must. So I'm talking about 3 A's essentially: accessibility, affordability, and accuracy. So technology certainly can augment the work. Well, nowadays, I think again, it's become a fad, become fashionable to talk about disruption. I somehow, I detest this word. So for some strange reason, disruption is a negative word. So I feel augmentation is a better word. So I think technology can really augment the work. When it comes to our own labs, we're doing multiple work. So one of the departments, as you would be aware, and for those who don't have much of insight around what pathology is, pathology, take it as a whole set in which you've got multiple subsets. It's like in a hospital, you've got neurosciences, cardiac sciences, urology, nephrology, so on and so forth. Similarly, in pathology, you've got multiple subsegmentation. You've got hematology, biochemistry, the mundane serology, immunology, all the way up to molecular biology, cytogenetics, and so on and so forth. So technology can be used in a big way. Just to give you one example, between so many labs and collection centers we have, we are using technology on 3 accounts. Pre-analytical stage, where you are trying to reach out to the masses, to the customers, to the patients, and urging them to go to the right lab. From there, the sample is picked. We are using technology in a big way. So the phlebotomist or the rider who goes to pick the sample, we can now, through GPS, we can monitor the movement of the, of the rider. We can ensure that the sample's integrity is not lost en route, for which we have got temperature loggers. So you can see that at what time, what was the temperature of that sample, because as you are aware, ours being a remote country, if a sample is, let's say, getting picked from a remote place called Silchar and brought all the way to Guwahati, or let's say from Tiruchirappalli to Chennai, I think it might take 3, 4, 5 hours depending on, and in the sweltering heat of 50 degrees, 45 degrees, inside the box, it's important to maintain the integrity of the sample. So we are using technological on the pre-analytical stage. Then when we talk about analytical stage, which is when the sample reaches the lab, when it is put onto the machines, what kind of technology are we using? Conventional technology obviously has been there for some time because of the low paying proclivity of the people in our country. Those conventional machines are high throughput machines which bring down the unit economics. So that's the reason why that technology is used. But nowadays, I think people are working on point of care technology because of the dearth of qualified people. So just to tell you that in our country, we have got about 200,000 labs, but only about little under 13,000 qualified MD pathologists, biochemists, and microbiologists who ought to be signing the report. So not even 10% of the labs have qualified doctors. The country has 17% of world's population, 19% disease burden. And that 2% is very crucial because we've got 16 crores more people with ailments, and only 2% of world's lab technicians who are qualified and skilled. So in order to ensure that, we are able to give the quality thing, we are using technology in a big way. A couple of areas where it is far more accentuated is one is histopathology, for instance. So we get the slides made in the remote areas. Those slides are projected using the electric medium or digitized through the digital medium, and the reporting is done centrally. So this is what we call as we are getting the things done centrifugally. Also centripetally, also we do it sometimes when we feel that some of the doctors, they are spread across India, and the slides, if are made in a centralized location, these guys can report on that. And similarly, on the post-analytical side. Now, post-analytical is when you are
giving the reports out. So once the reports are out from the machine, the doctors have seen it, technicians have seen it, they have signed the report. When we are sending the report, we are using those smart reports where not just it's a simple reporting. If somebody, let's say Rima, you have been to our labs number of times, we can give you last 5 times when you've been to our labs, how your disease has progressed. If it's a chronic condition, what were the values? If the values were deranged, we'll give you a graphical representation, all that stuff. So technology we are using in a big way. And as Dr. Claire was mentioning and the other panelists were mentioning, I think it's about time we should be making good use of technology in every space, every sphere.
So I believe education is the key right now. With more education, instead of disrupting, we'll get into the augmentation with in the healthcare industry. Got it. So, Mr. Khurana, when we talk about BPL medical devices, how do you look at these medical? Because medical devices is something which starts from a very basic thing from labs, as we were talking, to at high-end places. Can you please brief a little about how does that work and how does that you maintain those standards, or how do you in the global standards how should we come together when it comes to medical devices?
So good. Thanks, Rima. Your question is very valid. Medical device is a very wide spectrum. Even a normal glove or even a basic suture also is a medical device. And when you go toward the cyclotron or MRI is also medical devices. But unfortunately, everything is seen as a medical device and only with one lens. So that's a challenge. I will talk more about the electronics medical devices because challenges of electronics medical devices is very different than what it is for the consumable. So I'll not be a right person to really comment on consumable side, but more on the electronic side, I'll say. Now, if you look at electronics, we don't have electronics industry. We don't make so much of electronics component in India. So you still source from outside. Whereas if you look at your neighboring countries and some developing economy, they have worked on electronics components beautifully. For the last 15, 20 years, they have set up their ESG labs and all that. Now, if you get products from those countries, the cost of those products are really very low, very, very low. So to make in India products, when you source from the global countries, those high-end electronics component becomes very difficult. So this is the one challenge we face, but at the same time, there is opportunity. We know that there's a lot of investment happening now in the electronics industry itself. So down the line, 3-4 years or maybe 5 years, when you start getting a lot of electronics components within the country, can change the game. Now, touching on innovation, innovation is a very broad word, like a technology. We can, but in my thinking, that 99% of products which are today available globally, we need to make them here. We are today only about $3 billion local manufactured products in India, and you import about 10 million. So out of 13 billion, nearly 3 billion is only Indian from India, and out of 3 billion also, majority is consumable. Electronics products are very, very low. And that is where, we have to really see that how we improve that. So I'm very positive about the Indian demographics because the capital, the strength what we have today in our youth or population on the technology side is phenomenal. So we can leverage that beautifully. And industry and academia need to work also in very strict manner. There has to be a proper bonding because we acquired a company by name Penlon in UK. It was a 100% subsidiary of BPL for many years. And that company was an offshoot of Oxford University. So it is actually institutes like these, IITs of the world, they need to actually be attached with us. And it should be hard binding, that it's not a choice, but there has to be attachment. And you can see a lot of, change happening in the industry. This is how, I look at this industry. Coming back on some of the policies which may matter a lot. If you look at policy, we have to simplify the policies. Today on the regulatory framework, there are some 24 regulatory frameworks you have to clear. Whether it's a ARB, PCP NDT, factory licenses, some half a dozen factory licenses, CDSCO. Now CDSCO was retrofitted. They progressed beautifully, but this was more a template of a pharma which was brought, for the devices. Now they have learned over a period of time, but that is delayed. And I think that's a great move by Government of India, that CDSCO will ensure that you will not get spurious product in the market. The details what they are asking is much more stringent than the CE or FDS, I can tell you that. But are they ready? Are they ready with the enough staff to process those licenses quickly? So those are the challenges we are facing. Yeah.
Got it, got it. Mr. Dasgupta, so, healthcare and Samsung, a brand, when we bring these two together, it gives a very kind of like, okay, how is Samsung related to healthcare? So first that if you can throw some light on how Samsung and healthcare connect the dots, that is A. And second, how do you approach the innovation and product development in your area or in your industry in order to cater to the wide audiences?
Thank you, Rima. So, you have made a very pertinent question, how healthcare and Samsung. Again, I can tell you that technology is a democratic. Democratization should happen. And what Samsung has done, the technology migration from mobile, from consumer electronics, they have migrated to healthcare. I will give you a simple example because when there is a network problem, the image quality suffers. So that technology we have migrated to healthcare because when there is a problem, when there is a rib shadow, then we are not able to see the organs very clearly. Then that technology has been migrated to our ultrasound and it has worked beautifully. So there are a lot of examples I can give which has enriched the healthcare equipments because as I have told in the opening statement that we are dealing with ultrasound and digital X-ray, and there we have utilized our expertise in mobile technology and the consumer electronics technology and brought into the healthcare. And I will just use the word augment, which you have used. So what you have done, Samsung has augmented healthcare from their own facility in South Korea, because we have got two biggest hospitals, Samsung Medical Center. And you have started our AI journey as early as 2009, when very few people used to talk about AI. And this AI we have utilized in both in DIR, that is the digital radiography, as well as in ultrasound to provide solution to the patient, because it is giving back to the patient, not only used it for a commercial purpose only. So in ultrasound, we have developed real-time AI. So while we're scanning, the doctors can pick up the pathology and give an instant result. So that's a boon. And even we augmented our radiology part, where it's not only just a single plane X-ray, but a lot of AI technologies has been incorporated, which also gives a near total diagnosis to the patient, and the patient should not go to CT scan. Like we have got a bone suppression imaging. And for India, we have developed automated lung nodule detection software, because India has got one of the largest population of tuberculosis. So in order to see which nodules are reactive, which are non-reactive, we have developed that software mainly for the Indian population. So it is like not only for the customer, of the customer, by the customer, but also with the customers. We are working closely with the medical fraternity to develop softwares, India-specific software. We have got one of the largest research institute in India, that is SRIB Bangalore, and we are also developing our own manufacturing unit. So they will work closely for the Indian population. So when I talk about India-specific ultrasound, means it is made for India and it will cater to the Indian population. Why Indian population I'm mentioning? Because India has got a diversified population, which is a very unique characteristics of India, unlike other countries. So we have to have a diversified solution for the patients. Hence, we are working on the data, and data is the new oil. So India can be the capital of AI. We are already capital in software, we are doing a lot, but we can also leverage that part, because when the experts try to develop something, they have to travel different countries to get a variety of data. But here in India, sitting in one country, you have got that access. So what we are doing, we are blending our technology powers with a software, with an AI, and developing new machines. And that's not only for the world, but also for India. Thank you.
Mr. Dasgupta, I have a follow-up question to it. So I was reading a report recently, I think it was the Ipsos report, where it mentioned that in India, mobile phones are used much higher than in comparison to the global markets. And when we talk about mobile phones particularly, there's a radiation. There are different wires that gets connected. People sleep with their phones right at beside them. How do you plan to leverage again AI, as you mentioned, to these consequences so that I think 4 hours, 35 minutes is an average Indian user, a normal who doesn't use phone a lot, is what an Indian uses. When in comparison to the global market where it's approximately, I think 3 hours, 25 minutes. How do you challenge those things? How do you, upgrade, and with the healthcare industry, how do you see the betterment of it when it comes to mobile phones?
You see, it's all about radiation. We have to understand what type of radiation. The mobile is a radio frequency RF, which is used in one of our medical equipment, that is MRI. But this radiation, there is a lot of debates going on because one of the famous experts has mentioned that there is no effect, but others have countered it. But with the help of AI, what you can do, you can control this RF radiation. Because I can tell with a conviction, because we have done similar thing with the help of AI to control the X-ray radiation, which is much more harmful. So our DRs are being certified by FDA as a low dose equipment, and which can be used for the pediatric purpose also. So these can be done, these can be translated into the mobile for radiation, though the RF is not that harmful as an X-ray radiation.
Got it, got it. Thank you so much. I was very intrigued. While you were talking, I was very intrigued. I was like, okay, wait, let me understand this in a better context. Coming to you, Mr. Kurana. So when we, again, coming to medical devices, when we talk about it, when we talk about global standards, when we talk about, made in India concept, how do you envision the future, if I must say that? Because again, while we were talking earlier, that, first we need to get those quality standards at our par, at the par, to meet the global standards. How do you see, how can we overcome those challenges in order and see an opportunity? Because naturally India is one country with the largest population. Our brain, the brain that India holds is much more than the outside world, outside countries. How do you see this as an opportunity to upgrade our devices and
So
overcome it?
thank you, thanks. First of all, we have to keep one thing in mind, that what we are going to make or what we are making in India is not for India only. It has to be for the world. And if you think of a product which has to be developed for the world, you are not going to compromise. Because if we invest a lot today and build a product and think that we will only sell in India, it's not viable. So you have to make a product to a level which gets accepted everywhere. So that's one challenge, one point. Second point is that Indian companies, I mean, think of, there's a lot many people sitting here. Think of a situation that how much R&D investment is there from India. How many people from us want our kids to become a scientist to do a R&D? It is very small. That change is happening in last 5, 7 years, 8 years. That we see a lot of, those incubation centers and innovation centers and all that. That is where advantage of multinational is clearly there, that they are doing this for ages now. And India is now building, like we have built now nearly 70 R&D dedicated people. But I have to also balance it out. Probably I need to go for a 200 R&D guys, but can I afford it? Now, what government of India has done, they have launched a new policy by name PRIP. PRIP is something where they want to cross-subsidize and incentivize the efforts of R&D. So this is there. What government of India also can do, there are very strong allies they have. Let's take from Japan. Now, Japanese companies may not be very keen to come to India because of many other reasons, because they are very conservative. They want to just stay in there. Now, if government India wants to improve this, what they can do, they can help tie up of those technology companies from Indian companies who can really produce those products quickly, cut short the R&D time. Now, any product you build will take about 2 to 3 years. Then you take to the market and get the certifications that this is now good on patients. That cycle is 4 to 5 years. If government of India intervenes here now and get into that technology transfer mode, that can really be the fastest way. Your speed will be very high. You can bring things very, very, quickly. So this is how I look at in terms of Make in India. But what we should also understand that from a total about $600 billion business of medical devices, 600 is a lot of money. We are today about 12, 13 billion. I mean, pick a number because these are all debated. Some conferences it is said as a 12, somewhere 13. It is just 2%. If you look at, and our population is large. If you look at China, China is about 100 billion. So China is doing justice to their percentage, which is equal to us. And I have no doubt in my mind that in about 20 years' time, we will hit that number of magic number of 100. The growth is happening in that direction. India has a potential to become market for the global arena. I mean, we can become an OEM of the lot of countries. That's how I look at. I don't want to say China plus one because that's not a very right approach to say. But India, on its own stand, can do phenomenally good. Now, I'll just say one more thing. Government has to understand something more realistic on the policies. They did a great job when it came to auto industry. Auto industry policies were framed in such a manner that today a lot of ancillaries came, a lot of ecosystem came beautifully, and that size is also big. Such policies which promote local products is very key. And say that we need to create some kind of entry barrier for products which are being made here. If let's take a high quality X-ray machine is made, or patient monitoring is made, or ECG is made, why should we allow that product to come and raise the entry barrier so that you can protect your industry and bring it to, so 3 to 5 years this kind of raising the entry barrier can help, and this is very important. You can't bring a imported car from outside, you pay hefty taxes. So some such policies in a very open mind should be thought, practiced, and applicable.
Lovely. Thank you so much. So Mr. Vashisht, I am having a great time, to be honest. There are 3 different sectors sitting with me. I have so much insights to gather today. Coming back to Mr. Vashisht, so when we talk about, again, PathKind, it's a diagnostic sector. When we look at collaborations, when we look at the partnerships in today's business, because since it's a business event altogether, when we look at the business aspect of it, do we see any more, partnerships or collaborations taking place with government agencies or per se any private sector as well, in order to overcome the challenge of reaching out to more people and making a augmented change in the healthcare industry?
I think we can do much better. And if you have to take a leaf from what happened in telecom about 30 years back, I'm talking about the year 1993, 94, when optical fiber had just come in, everybody started laying their own optical fiber. There were 3-4 companies that point in time, Escotel, then probably SR was one. They realized that laying the optical fiber in those days used to take about 1 crore rupee a kilometer. And they realized that it's a wild goose chase. Everybody's, digging their own well, trying to just have some water. And the capacity of the optical fiber was huge. If my memory goes right, they used to say that one single strand, which is less than a hair's, your hair strand, optical fiber, 36 pair cable can carry capacity of running voice and data channels for 100 years. So then everybody realized that why can't we just collaborate? So if, let's say, Mr. Khurana is having Punjab circle, I'm having Bombay circle or Maharashtra circle, if my call lands on his, circle or his network, he should be paying me cross-connect charges. Now, I've been clamoring from the rooftop. In our industry also, we need not really put in so much of money creating infrastructure, investing so much of money into, creating the basics, doing the basics. But somehow, I think there's so much of trust deficit when it comes to building partnerships is concerned, be it with the government, be it private, be it, whatever format you look at. Now, Dr. Clare, just before this, was rather candid in his views that, if you go to the primary sector, primary healthcare center, or wherever you go, you find that the doctor's not there, or he used the word that, they do a crappy work or whatever. If you look at structurally, and I have studied in my earlier life, and I used to run a bunch of hospitals, I can tell you that, I have studied and I was invited by various countries to look at their healthcare system. Our healthcare system, structurally is wonderful. You've got sub-centers, you've got PHCs, you've got community health centers, you've got district hospital, state level hospital, national level hospital, all that jazz is there. But I think the problem is in execution. So if the people, if the hospital is there, probably it is lacking maintenance, or it doesn't have equipment. If the hospital is there, it is maintained, equipment may be failing. If all three are right, probably people may not be coming. So the thing is that today the way forward is public-private partnership. But this trust has to go. And I think I have handled multiple PPP. I've signed the first deal in diagnostics, which happened about 10 years back from my earlier company with Himachal government. It worked wonderfully. So now the time has come. If you have to really make some significant change on the positive side, you want to bring about that change in healthcare delivery, I think, or diagnostics delivery for that matter, it is very important to collaborate with the government and at that level where you can actually reach out to the masses. Second is the government comes up with various or even the multilateral agencies, be it these NGOs like Bill Gates Foundation, Clinton Health Foundation. They aid various governments, various projects. So those projects are handled by companies like ours. TB, we mentioned about TB. TB is a big menace. I think India is the TB capital of the world, and the government has decided to eliminate or eradicate TB from the face of India. It's an onerous task. It's going to take some a few years, though we wanted to do that work. Had it not been for COVID, we would have done a much better work. So these projects keep coming. We have to reach out to the masses. And it's a full continuum. You have to just ensure that people, they get diagnosed in time, they get treated in time. Sickle cell anemia is another thing, which is what you call as the hemoglobinopathies. And you also find in our kids, across the nation, length and breadth of the country, they lack the micronutrients. So I think the idea is to do the work at the grassroots, and that's the area where you need to collaborate. It could be, as I said, B2B or B2G, business to government kind of a equation that we can.
So trust, I think, is a very crucial aspect that needs to be followed in today's day. Got it. So, okay, post-COVID, I would say during our pandemic, we saw healthcare at peak level. Like, I think we gained much more insights when we saw that how the healthcare industry altogether came to make us survive at the very least. We are alive because of the healthcare industry today. So my last thoughts on you, because when we talk about Made in India, at that time it was all Made in India. Your last thoughts on how this model of Made in India looks in the future. If I start with you, Mr. Vashisht.
See, the whole thing is that the idea of Make in India is absolutely, I think it's just a wonderful idea. And obviously the idea is, the problem is in the execution. The government is walking the extra mile. Now the time has come that we talk about quality. As Mr. Khurana just mentioned that, it's not just about making something necessarily only for India to be used only by the Indians. I think it's also about having the quality which can attract the buyers from outside of India. Right? So I think we have to be focusing on quality. That is one area we need to really work very hard. Talking of COVID, I remember that, when the pandemic happened, we were most ill-equipped. Really, nobody knew the relevance of diagnosis. For the longest time, you would know that we didn't have any treatment. The vaccines came much later. All we had was diagnosis. So when I think it was in the month of January that it touched our shows, COVID, the pandemic touched our shows. By the month of March, we had the diagnosis. We had the kits to run the COVID tests. So before that, and you'll be surprised to know, not many people knew that a pathologist is a qualified MD doctor. Phlebotomist was more like a tongue twister. People would not even know what phlebotomist mean. So the whole thing is now people at least have that discernment that yes, there's some animal called diagnosis. Diagnosis is a very, very important thing because 70% of the clinical decisions are taken, basis the diagnosis or investigations which are done. So my sense is that whichever way you look at it, whether it is devices, whether it is equipment, whether it is even dispensing the healthcare or diagnosis, Make in India as a concept is very good. We have to believe in ourselves. We have lots of wonderful minds in the country, wonderful scientists. They need to be given the wings. We have to invest. Unfortunately, on the R&D side, historically we haven't done much because we are in the habit of digging the well when we need the water. So I think R&D requires huge numbers or huge time of incubation where you have to see the result, and your balance sheets have to be strong. So a lot of support from the government is also required.
A lot of trust is something we see the potential.
Yes, so I think the potential is there, and sure in the times to come, the government is now serious about it. I'm sure the business sector or the private sector is also going to work hand in hand with the government, and things ideally should work out. Next 10 years, 20 years are going to be very, very crucial for us.
Understood. Mr. Khurana, your concluding thoughts on how Made in India looks, you envision India
See,
with the model?
we should be prepared to give some time. You cannot have overnight these things. So I see what we are today, what we were 3-4 years back when the pandemic shook us and our readiness was very badly exposed. I think down the line 5 years, we'll be at a totally different standards. That time, probably there was no company or maybe one or two who were trying to do a ventilators. Ventilator was a big issue, or oxygen concentrator. Like we gave our technology. We were the only company having the oxygen concentrator. Now, at that time, Government of India approached us to say that, why don't you give this technology to large government enterprise who can multiply and make large products? They can make thousands of machines per day. So we gave our technology to BEL, Bharat Electronics Limited. So they manufacture under license of BPL. So I personally feel that the way things are now changing, you will see lots and lots of positive things in 5-year time, but we should give time. Down the line 10 years will be not less than any developed market in the medical devices side. I may be optimistic, but that's how I look at it, because your paying propensity is increasing. Our per capita income is rising, and you want to go for early diagnosis. So all that put together looks very positive to me.
Lovely, lovely. Thank you. Mr. Dasgupta, your concluding thoughts?
Yeah, so we have heard about the example of auto industry and also the telecom. But my take will be the Indian government should follow what they have done in the case of defense. Today, defense export is 14,000 crore. So same thing can be done for the medical industry. And because there is a central purchasing department now, GEM is there. So same policy needs to be followed, and also the GDP allocation needs to be increased. So these two will work positively for Make in India. Thank you.
Thank you. Thank you so much, dear panelists. I got a lot of insightful, I had a great discussion, rather, I would say. Different segments, different sectors. I got to know a lot about healthcare. I hope our audience also did. So thank you so much for your time. And I would request all of you to give a warm welcome to our panelists for getting the time. And again, it's good for, the health as well.
Thank you so much, Reema. And the panelists, I please request Dr. Harvinder ji to please, not Dr. but Harvinder ji, of course, so used to saying doctor now, to please join us on the stage and present your token, sir. I just made you a doctor. Aye. Sir. You should clap him. I only have one of you. So if you're doing something, do it in its entirely. Thank you, ma'am. And you stopped right then. Thank you so much. Thank you to all of you. Very quickly moving ahead with the next panel discussion, because you have to sort of try and keep up with the time. The topic of which is, do corporate hospitals dilute the ethics in healthcare? Just to ask, how many of you agree with this? That yes, corporate hospitals dilute the ethics in healthcare? A show of hands. Anybody who feels yes? One anonymous vote. That's okay. Anybody else? How many feel no, they don't? Rest are all beach mein. May or may not. You'll decide after this probably. Yeah, we should also ask this question right after this discussion as well. Okay, let's welcome the panelists for the same. Sunil Thakur, partner, Cordia Capital. Dr. Sanjeev Singh, Medical Director, Amrita Institute of Medical Sciences and Research Center. Faridabad and Chief Medical Superintendent, Amrita Institute of Medical Sciences. And this one will be moderated by Hoshi Ghaswala, CEO and Chief Innovation Officer, BW Businessworld. Everybody, let's please welcome them. Dr. Singh is there. Sir.
Good evening. I think we can switch up the mic and discuss amongst ourselves. Guys, we are not ghosts. At least tell us we are alive. Yeah. Good evening. Thank you. Please be a kind audience to us. I know it's been a long day. I've got a very interesting panel discussion. And when Harbinder asked me to take it, I was kind of excited because we keep discussing this on and off about ethics, money in the healthcare space. Before I start, just a couple of things that everyone must be knowing about. People would be, if not my age, a little younger. When I was growing up, there were three, I don't know how to call them. They're now like businesses, which were treated as institutions which became businesses. One of them was healthcare. Okay. Second was media. And the third was education. One never thought of profits. By the way, I'm also one of those industries. We are in the media. That thing has changed. And, even I was just thinking of where we might be diluting, our ethics in the industry. When I mean, it's a business world. Fortunately, we don't run the 9 o'clock TV programs screaming and shouting and all of that. So touchwood, I think we are fairly safe, but I'd like to see if we are crossing the line anywhere. The second piece of information that, I'm sure a lot of you know, is that 82 crore people in India, which is 55% of our population, gets free ration, and there's a commitment to give it to them for the next 5 years. Now, food is a necessity, healthcare is a necessity. So we're coming from very tight space, okay, where people can't afford food. We are talking of healthcare. I'll jump into the discussion now. I'm not the expert, would love to hear from you. Sunil, if I may start with you, okay. You all are investors in the healthcare space. How do you assess a company's a potential target, healthcare targets, investment targets, ethical practices, when you are investing? And how do you ensure that, the ethical practices and patient welfare align with, your vision, your objectives when you'll invest?
Thank you, and pleased to be part of this gathering. And just to give a context of what we do, we are a healthcare-focused private equity fund. We only invest in healthcare, and we invest across all segments of healthcare, from hospitals, diagnostic, pharma, life sciences, medical devices. And we invest in South and Southeast Asia. The reason being, we are more around, we are more focused around creating impact through our investments in healthcare. And these are the two large regions where the need for healthcare is substantially higher than the supply of healthcare. So that sort of also sets the context of, how we look at opportunities. So first and foremost, we are a private capital, and therefore returns for us is important. And it's not only for us that the returns are important, it's also for sustainability of any business or any institution. It's important that the institution makes some profit so that they can grow, they can hire more people, they can basically deliver those social goods, be it healthcare or be it education. So profitability is a very, very important element. Now, how we sort of try and differentiate and try and bring the ethics element into it is that while growth is important for us, it's also important to see that it's done in a very ethical way, which serves the cause, of the society, the needs of the society. And the way we handle or tackle it is that for us, ESG is a very, very important component, which is environment, social, and governance. And quite a bit of what we talk about in ethics fits between the three of these things, which is environment. Again, a large part of ethics. We are not supposed to spoil the environment. Social, what we are doing for community, social, including employment, gender equality and stuff, and governance. If you have the right governance, the first two will. There's a high probability the first two will follow. So that is one big part that is an important thesis of our investment. The second important part of our thesis is impact. which is what is the kind of impact. And ESG and impact are two bit different things. While quite a few people try and interchange the definition. What is the impact that we are creating, both in terms of number of patients that we are servicing, in terms of employment that we are generating, and there are quite a few parameters. And at what price point are we delivering those services and goods? And it's very, very objective. We have our own proprietary matrix that we use to score the companies that we invest in at the time of our investment, to have an objective target that if I am rating this company on a scale of 5, it's a scale of 5, 2.5, then what is my objective in terms of growing the impact by the time we exit, which is take this 2.5 to say 3.5. It's set right at the time when we invest. And we report this objectively to our investors, because our investors do want to see that we are delivering healthcare through our investment in a very ethical, ESG compliant and impactful way. So I can talk about our investment strategy, that we try and deal with this concept of ethics to very objective ways of doing it.
Thank you. Before I ask you a question, I'd just like to request, whoever's speaking behind to speak a little softly or speak outside the room, because I can get the sound here. I'm sure the speaker is also getting affected. Dr. Singh, you come from a hospital which is known for ethical healthcare. How do y'all ensure? Let me put the question. Do you have specific initiatives or policies implemented to ensure ethical healthcare, right from diagnosis to treatment to follow up? How do y'all manage?
So thank you so much, and it's a pleasure to be with the esteemed panelist. He has invested so much, and I feel very scared if he looks at our institution. It's a charitable. He'll start owning it up. So what we have as a process in place is something called as utilization review. And we don't want all major initiatives to be run by a clinical team. So here is a nurse who has a very decent experience, who is a nurse practitioner, has a decent experience both in critical care as well as procedures. She runs this utilization review and she has a team. So they look at appropriate stay of the patients. They look at appropriate prescriptions, they look at appropriate diagnostics and appropriate procedures being done. So there's a random check of files, which and both active and discharge, where if there has been a stay which is not valid, they are empowered to question even the cardiovascular thoracic surgeons or a solid organ transplant surgeon. If the prescriptions, if there are polypharmacy which is not recommended, which is not evidence-based, they can give recommendations and question. We have done this for almost 15 years and it has worked. Initially, when we started, it was very, very difficult. But then management support and empowerment is 100% defined. And we have now a team of 10 nurse practitioners who just runs a utilization review other than their other multitasking activity. So appropriateness of lab investigations are dealt with almost on a daily basis, and appropriateness of radiological investigations, because there are evidences you cannot just have a headache or a backache and then MRI can be prescribed. The recommendations from the spine or associations AO spine is that you will have to wait for 21 days and then only the MRIs are. So the evidences are all defined. It's agreed. It's an expert committee group, and that is how it is sort of taken forward. Other than that, every clinical team have to do 2 clinical audits per year. That's mandated. So they need to introspect their own work and they need to transparently present this in front of all. It's like a big team meeting where they do present that they goofed up, or there is a large sections of mismanagement, or maybe they didn't adhere to some of the guidelines, and that is perfectly fine. So those 2 segments are done. One of the other things is, other than the institutional ethics committee, which largely looks at the research, there is a bioethics committee where anybody within the team, the patient, medical social worker, nurse, clinical team, anybody can raise a request to constitute or call for a particular patient a bioethics committee. So many a times you must have heard that the patient says, हमें पता नहीं वो मर गया था, फिर भी ventilator पे था. And this creates a distrust. So here is where we talk to the patient and the team before they are put in onto a mechanical ventilation. And if it is futile, if the bioethics committee feels that it is futile, the care is futile, we do withdraw or withhold ventilation, because we think it's unethical from our part, because they had to, for continuing of the critical care treatment, they might have to sell property, they have to sell jewelries, they have to sell their land, they have to, and they become a pauper, and then the patient unfortunately after a couple of days or weeks expire. So we assist and facilitate them to take decisions, and we do withdraw and and withhold ventilation, but then there is adequate communication happens with all the family members. So there are many such steps which we take internally to sort of self-regulate ourselves.
Thank you. Sunil, I'll come to you. Corporate hospitals are often criticized for prioritizing financial gain over patients' welfare, and you see a lot of this in media. And several of these hospitals are now listed. Okay. As an investor, what is your advice, to these corporates to have fair practices, managing the financial gains, have fair practices for patient welfare, ethical standards, all of it? What can, how can you influence them? But, what is your advice to them?
So from our perspective, and given those two metrics that we follow, it is very clear that we need to have a patient-centric approach. That is the number one thing. And within patient-centric approach, you have a lot of elements, be it proper care, proper diagnosis, care as per diagnosis, proper pricing. So all of it falls, as an element to the whole patient-centric approach. I think the reason why, the so-called corporate hospitals get a bad name relative to the other hospitals is because of what gets reported. And what gets reported is just tip of the iceberg. Actually, if you see larger portion of this question around ethics comes from the non-corporate hospitals, the ones that are not reported. In fact, corporate hospitals and the ones which are the bellwethers, the larger, they follow maximum or have maximum elements that you could call as ethics, and I can give those elements. Their protocols are digitized, and I'm not saying that it's black and white. There are grays, but probability. I'm talking about probability. As far as quality is concerned, they are much ahead compared to the so-called non-corporate hospitals. As far as the entire trail of prognosis, diagnosis, and care is concerned, they are much ahead because they digitize everything. So there is a proper trail. There are proper committees which are set up to sort of review and do it. Most may not follow the way Dr. Sanjeev mentioned. Obviously, this is an institution that most see as a benchmark. But by and large, they strive to get closer to this and are more transparent than the non-corporate hospitals. I think to establish a trail in a non-corporate hospital is going to be much more challenging. And then, it's the point around pricing. Now, the point around pricing is very controversial. The reason why it's controversial is for the first statement, because of the reason that I made the first statement, that a good a center of excellence which follows all the elements of ethics they will have no option but to provide it at a particular cost. If there is a hospital which is in central Delhi or in central Mumbai, there's a cost to real estate, there's a cost to quite a few things. The cost of manpower will be at a different level compared to any other hospital. So now if you have to bring the best quality of care, it comes at a particular price. And the question around it, the ethics mainly revolves around price, some around diagnosis and prognosis, and obviously what is the prescription. But it's between these two that the biggest question comes. So this is a conundrum that everybody is trying to solve for. But the reality is that if a high quality hospital has to sustain commercially to be able to deliver that quality of service, it will come at a particular price. I haven't come across any hospital today, and especially the ones that are listed, which are delivering ROCs of upwards of 25-30%, which means that their returns are around 20-25%. Maximum hospitals today, and we have some of the industry leaders here, are delivering returns of 15-17%. So whatever one is investing, they are getting about 15-17%. Nobody is making a 60-70% return. Their EBITDA could be 25-30%, but EBITDA is not return. It is about what you are investing and what you are getting back. So the data is out there in the open to see what kind of returns the hospitals are making.
Yeah, so which means it's not the killer instinct on the financial part. So, Dr. Singh, often there could be, and there actually is a conflict of interest when it comes to maintaining good medical practices, especially when financial incentives come in play. And I'm not a healthcare professional, but I do hear that there are incentives that doctors get on billing. How do they maintain, how in your opinion should they maintain fair medical and business practices and balance them, in such a situation?
Very difficult question. I think while we are building this institution, we would have interviewed close to 5,000 doctors across the globe and across the country. Selection of these people are extremely important, and doing a background recce is very, very critical, because that is where, when we were building this hospital, we took two major decisions. One is, we will not take star doctors. We are ready to wait and ready to just do good quality practice. Star doctors, so-called star doctors, I'm not saying whatever the star term which exists, they bring in their own ego. Unfortunately, every clinical person has their own clinical ego, but then they don't fit into the culture. So there is an isolation practice and they don't practice team. The second decision which we took is, we will not bring teams. So there is this group of people, 150 people come along with them, 300 people, and then they will go also. And we were so surprised when we were meeting a lot of good clinical teams. We realized that the institution has invested close to 50 to 70 CR on them, and they are ready to meet us to join our institution. So selection of these team is extremely critical. So it would be just not the faculty, but the staff. When we started, we started with a salary, but then ours is generally a group practice. So you don't create a competition within 12 senior cardiologists who are there in the team. Everybody contributes to the pool, and from the pool, according to the performance-based practice, there is a division. Now that is a slightly difficult, because unfortunately, healthcare is hierarchical in nature. So a head of department and a professor is a professor, and he wants to take the bigger chunk for whatever reason. But then there are appraisal mechanisms. So if he has published a good quality paper, if he has got good grants, if he is bringing in patents, he does get there, but not because he's the professor and the head. So we have taken some hard decisions of bringing in 38, 39-year-old and making them head of departments, which is not liked by many, but so be it. So it's a group practice, and then there is a performance-based incentive which has been given. And for the last 25 years, we have never given targets to our clinical team. We just do good work, and we have been seeing decent results. The other portion which I just wanted to add, if I may, that patient is part of our patient advisory council. There was this gentleman who was there, who was reversing his truck, and he ran over, unfortunately, on his son, and he crushed the pelvic area, the rectal, the urethral. And he was there with us for almost 110 days. And he knew in and out of the hospital, because having spent 110 days, you know in and out. He's part of our advisory council, and he advises what good, what bad practices being done. So he watches the housekeeping, he watches the nursing, he watches the clinical team. And so there are lots of these patients who are part of the team. So there is a lot of this input which comes in a very, very transparent manner. And there are few volunteers and monks, so it's not always a corporate management board kind of a meeting. It's a very ashram-based meeting, so they're allowed to throw in the ideas.
Thank you. I feel compelled to share a story. This is true. I have a plumber. His name is Harilal. Roughly my age, works very hard, very pleasant. I always say I trust my children with Harilal, so he can come into the house. I have 2 daughters, 2 stuff. I've got 2 dogs. He's kind of good with them. They're good with him. So I was chatting with him maybe about 3 months ago, 6 months ago, and saying, "Kitna kaam karte rahoge?" So he said, "Sir, abhi aur kaam karna padega." So I said, "What happened?" So he says, "I spent a couple of lakhs on my son's education." So I said, "What is he doing?" So he said he wants to be a doctor. So I said, "Wah, doctor banega, aapki seva karega, and you will retire." So he said, "Nahi sir, aur chakkar hai," but he says, "I don't mind, sir." He says that my child saw a lot of people suffering and dying in the village. So he wants to become a doctor, and he says, "वो सेवा करना चाहता है, उसको पैसे नहीं चाहिए." So I asked him, "तो फिर आपकी सेवा कौन करेगा?" He says, "कोई नहीं, वो दुनिया की सेवा करेगा. I will work until I can." Now, those are the kind of, he says he doesn't want to make money. He wants to, it's come from within to be a doctor. So crazy stuff. Sunil, I'll come to you. I have to read this question. What role should regulatory bodies and industry associations play in holding corporate hospitals accountable for ethical lapses? And how can investors collaborate with the stakeholders to promote ethical healthcare practices across the industry?
It's a difficult one, because I'm sure.
I gave him one difficult one, has to come to you. And
I thought you'd already given me 2 difficult ones.
Okay, sir.
No, it's very, very, very difficult to sort of come out with specifics. But yes, we do need regulators, and we do need all the stakeholders to participate. There are examples of other industries. There are examples of other countries. For some reason, it hasn't taken off in India. I know, we had this bill around the medical practitioners, which was then withdrawn. But I guess it's high time that we should have the right protocols. But more importantly, within the right protocols, we should have the understanding that not all the hospitals can be sort of treated in the same manner. If I take the case of say the insurance price, which is in some ways has a analogy to what we are trying to do over here, is that single pricing norms for all different kind of hospital doesn't work. So therefore, when we are talking about the ethics, we just have to make sure that we do have the infrastructure to be able to implement. Because if we implement, just remember, corporate hospitals are just about 3-4% of the total industry. It is for the balance 94-95% to follow. So do we have the infrastructure in place to implement it or not? While everybody is targeting the corporate hospital, but the issue is going to be somewhere else.
Sir, little out of time, but I have to ask you this question. Y'all are known for your ethics and professionalism. Amrit Hospital is known for that. I'm sure you also know about the rest of the industry. What is your advice? What are the learnings that other healthcare providers, hospitals can take from Amrita hospitals to ensure good, fair practices and, possibly the word profit doesn't come instinctively, profitable healthcare business? What's your
So I think a complete doctor is one who has clinical excellence, who also does good teaching and mentoring, who also does research, and who also does public health. So once he is complete, he's not looking for something more. Because everybody, like you said, why the plumber's son wants to join in. Every doctor wants to become a doctor because he wants to serve. We really don't know what happens in this 5 years and then remaining 3 years or 2 years of teaching, that he becomes a very wild, trying to earn as much as possible. So we have to definitely look at that, and that change has to happen. My personal feeling is, if there is a selfless work, there are endorphins which gets released, there are dopamines which gets released, there are serotonin which gets released, and people will be happy if you do selfless. I'll give you an example. Like, there is a big central area in our hospital which is called as Aarti Court, and there is a 6:30 morning and 6:30 evening bhajans which happens, and the patient and the attendants can participate. It's a large area. We have on the back side, we have seed balls. So every employee has to give their 10 to 15 minutes. They just mix the sand, cow dung, and a seed and prepare balls, which is just thrown for tree plantations. There are 3,500 construction workers, and there are kids. And for last 6 years, we run a school for them. Every employee has to go and take class for them. We have adopted close to 15 villages, and we have our camps are happening. Every employee also has to select a disadvantaged girl who could be brought in for a GDA and a housekeeping and a training, and we give free of cost training. Once you participate in this selfless work, you start feeling good and you start feeling connected. And that is, I think, the critical thing, because as our founder says, that love is the most deficient thing right now. And there is an unconditional love. There is this compassion which needs to come in. And that is how the change will happen. If we start making change, change is not going to happen. Change is going to happen when we adopt and we also follow those practices, and people see, and then people also start following that.
Sunil, you wanted to say something, that's why.
Yeah, no, so, there are lots of these models of success, and even in corporate hospitals, the point that Dr. Sanjeev was making, but it wasn't sort of, on the path that he mentioned. And we were just chatting right before the session, and we've invested in some of those hospitals and examples that, you first of all, as an entrepreneur, you have to have that long-term vision. If somebody is thinking of creating returns in 3-5 years in a sector like healthcare, then you will shortchange yourself or the model in some of the other areas. If it's a long-term 10, 15, 20-year vision, then you can set the right elements to succeed. We had invested in one hospital called AIG in Hyderabad. It's known for gastric sciences. Phenomenal success, very clear. The doctors are not paid as high as what in other hospitals are paid. It has the highest volume possible. It still provides endoscopy at possibly 50% of the average market price, and is still the best gastric sciences hospital in entire Asia. It still generates mind-boggling EBIT. I can't disclose it, but it's because of sheer volume at a price point which is 60-70% best clinical practice across the region. Mayo, it is the only hospital that has a tie-up with Mayo. Second hospital in Asia besides one in Philippines, which is tied up with Mayo. So it is possible. I think the starting point is the vision and the length of vision. It has to be a long-term vision, long-term journey. You have to follow it with all the elements, which is doctors, staff, patient, all of it. The best doctors are in hospitals like AIMS, Safdarjung, where they're not paid as high as in private sector, and the best of clinical care is given in those hospitals, and the richest of the patients will go to those hospitals. So there is a reason why, right? Because the point that he was making is that not all doctors will work for money, but then how do you create an ecosystem where those kind of doctors can thrive, where they don't have the pressure of bringing patient. The hospital will bring the patient. You just focus on clinical care and you focus on research.
Wonderful. So what you're saying, I just want to summarize, is issues really don't, the issues that are magnified in the media are not really with the corporate hospitals that are visible. They are a lot with the unorganized sector. What you're also saying is a little counterintuitive on the investment strategy, that don't look at a short-term investment strategy. Look at 11, you actually said 11 to 20 years, and I was wondering which investor is going to hold out like that. What you're saying, Doc, is something that I'm struggling with personally. I keep telling my children, you can come first in class, you can make a lot of money, you can do whatever, but if you are not giving back, it's all kind of meaningless. And I mean, I'm right now struggling with the reverse. My older one earns 2 years, and I'm not saying this to be vain, but 2 years into, she's a clinical psychologist. Her 30 to 40% of her money goes into charity. Right now, also as we talk, she's taken the car and taken a rescue dog to this. So, but I think they've experienced the joy of giving. I think medical practitioners have to get that feeling of making that difference. Thank you. I'm sorry, there's a time's up. Fortunately, the bomb's not gone off like in the movie Speed. But thank you for being a patient audience. I'm afraid we don't have time for questions, but I'm sure y'all will be around, okay, to address questions later. A big round of applause for the gentleman. Aditya, all yours.
Thank you so much, gentlemen. A picture, please. May I please request Sunil Khurana ji, MD of BPL Medical Devices, to please join us on stage and help us present a token to these gentlemen. Thank you so much. Thank you. I will now, I think, ask the question again, what I'd asked before this panel. The same thing. How many of you believe that, yes, corporate hospitals dilute the ethics in healthcare? Anybody for yes? 1, 2. There's 1 here, 3, 4, 5. And how many for no? How many for maybe? Only 1. Okay. With that, we move towards our last panel, which is on what should pharma companies be doing beyond manufacturing medicines. And to share their viewpoints, please join me in welcoming on stage Alok Khetri, COO, India Business, Bharat Serums and Vaccines, Dr. Sujit Paul, Group CEO, Zota Healthcare, Manakshi Nevatia, Country President, Pfizer India, Dr. Sanjeev Panchal, Country President and MD, AstraZeneca India, and this one will be moderated by Harbinder Narula, CEO of BW HealthcareWorld and of BW Wellbeing World. Let's please welcome all of them. Thank you. Harbinder sir, lots of experience, time bahut kam hai. It's on you. All the best.
Thank you, Aditya. So we have the last panel. So between us and the awards is just our conversation. So, but since we're talking of medicine, drugs, so I think that's fine. The reason we wanted to have this conversation is that pharma plays a very, very important role when it comes to healthcare delivery. At the center of the healthcare delivery is the patient, and the pharma becomes a part of every part of the healthcare delivery systems, and sometimes also gets the blame for increasing cost, shortage of medicines. So इस सब को solve करने के लिए, we thought that we should have a conversation to understand that, when we are manufacturing drugs, is there beyond that something that we are doing? I believe there is a lot that we are doing, but it does not come to the light of the audience. So Meenakshi, I'm going to start with you. What do you think is the role of pharma companies beyond just manufacturing medicines? And what is it that you have demonstrated globally, and what is it that you're doing in India to showcase that you care for the society beyond just selling medicines?
Thank you, Harbinder. So firstly, hello, everybody. When you started the question itself, I wanted to, kind of phrase it almost differently, to say that the manufacturing part of what we do, the manufacturing of medicines, is really, one step in a very long process, right? And the first starting point is really the entire research and development that goes into, defining the drugs. And I'm sure many of you are, know what it takes, but I think the research phase and the development phase are probably the most critical phases for most of our pharma companies, because the energy, the investment, the failure rate is extremely high. Just to give you an example, for a simple drug development, the costs could be anything between $250 to $300 million. So it takes a lot to actually get a drug to a stage where we can manufacture. So sometimes that gets forgotten, but I think it's our responsibility to remind. Of course, the manufacturing is important, but there again, it's not just the manufacturing, it's the entire quality control, quality release process that we invest a lot of energy in. Then we come to the entire supply chain and logistics, which is also, I think, COVID brought it to life. But just to give you an example, people are surprised when we remind them that the average run on chemists is at least 3 times a day that they're getting their supply. So the supply chain is very, very just in time, and that's what we have to manage. And then, of course, is when particularly we are bringing new drugs to market, new innovations, new chemical entities, the entire education, the entire medical education, the entire experience, the entire data sharing, the scientific, selling, that is all extremely important, because in most cases we are bringing, just to give you an example, we are just going to launch a drug in medical dermatology, and there's been no drug for the treatment of atopic dermatitis for the last 30 years. Now, it sounds like a fantastic opportunity, but on the other hand, every single doctor is very used to writing certain medicines. For them to change and prescribe something else, it will take a lot of scientific conviction, a lot of scientific selling, a lot of scientific knowledge sharing. So that is really the whole spectrum that we're in. And it's just a good reminder that the manufacturing piece is just one very, very narrow sliver of the whole thing. I think the second question to Harbinder's question was, what else are we doing beyond just selling medication? The answer to that is again very long, so I won't get into it because I'm sure my colleagues will add a lot to that as well. But I think there's a lot. I mean, we don't see our responsibility as manufacturing and selling drugs. That's not what gets us up every morning. That's not what motivates our people. It's a lot to really make sure that we're doing everything we can to get the right product to the right patient at the right time. Now, what does that actually mean in terms of access, in terms of distribution, in terms of making sure we have the right price for countries like ours, driving screening programs, particularly when it comes to oncology. And I hope we get a chance to talk about that as well. But those are, there's a lot that goes into it. So our job, the way we define it, is not about manufacturing and selling medication as much as possible. It is really about, the purpose is breakthroughs that change patients' lives. And the idea is to actually make a difference to as many patients as possible. So I think it's a long answer to a long question, but I'll hand over to my colleagues to maybe add to that. Yeah.
Absolutely. Thank you. Thank you, Meenakshi. Sanjeev, let me come to you. You know, AstraZeneca, when we look at this company, it is always known for its commitment towards patient-centric innovation. You know, what is it that the company does to engage and support patient empowerment, education, engaging into initiatives that enhance the health outcomes?
Thank you very much once again for the great panel. So at AstraZeneca, we, and like every other company, would start with the purpose of our company. And our purpose of our company is to keep pushing the boundaries of science. And if one word which defines us, one is science, how we bring that science to patients, because a huge, long process. At the same time, our own values to bring those science to patients. And let me give you some examples here. So one is, we are looking at patients as people first, as part of our purpose itself, and not patient as patient. So if you look at patient as patient only, then you are just talking about just medicine manufactured and giving it to them. And even in our narrative, what we are trying to say is we want to really unlock the power of science for healthy people, healthy society, and planet. So what we are bringing, and you're asking the question about how do we look beyond manufacturing, we are looking at people, society, and planet as a pharmaceutical company to make a difference. Now, when we talk about people, and I want to give this example of our vaccine, we are not a vaccine manufacturing company. And when COVID came, the collaboration which we did with Oxford and with the government, and how we technology transferred the whole COVID vaccine to India, to SII, this is really helping the patient outcome. And that is not a medicine, actually, that is more of a prevention, what we are trying to do. But more importantly, we really feel proud about on that people part is that we were giving that vaccine as an equitable access at no profit. So the first company in the world, we were delivering 3 billion doses of vaccine to the world, saving the lives of the people across the world, along with Pfizer also did the same thing. But the important point is how do we bring beyond just manufacturing medicines and keeping the people at the center. The second thing we want to talk about is what we are recently doing on the climate, and which is more focused on planet. AstraZeneca announced last year, and I'm so proud to do that for India, that we announced 64 million trees to be planted in it. 64 million means 6.4 crore trees in India, in Meghalaya, of 27,000 hectares, giving employment to, let's say, farmers of 50,000, but focusing on planet. So again, we're not talking about just manufacturing medicines, but we are talking about the planet and how do we decarbonize the whole healthcare system. And the third is about the society. So one is how we are doing young health program. We are bringing the early screening for cancer, early screening for diabetes, which is the third part. But I think the overall outcomes which we are bringing is not only medicines, but how are we doing it much more early for the people and also for the planet. So we're going beyond to answer a question, just not only manufacturing, but thinking people, society, and planet, and sustainability becoming more core of our DNA across the healthcare system.
Awesome. So since we're talking about society, Alok, let me come to you. I mean, BSV has always had a focus on women's health. We know it very clearly that in India, women's health is the most neglected. Women are most neglected when it comes to healthcare. They don't even access healthcare. What we see in the urban areas is very, very different from what the interiors of India is. Is there something that BSV is doing to address this particular space for the nation?
Thanks, Harbinder, and good evening to all of you. Basically, like if I look at BSV, again, we are patient-centric. We are working basically in the area of women health, in the area of critical care, hematology, and emergency medicine. So first question is beyond manufacturing. So I would like to really state that pharma companies' two main jobs are R&D and manufacturing, okay, which is drug innovation, approval, and manufacturing. And second is medical marketing and sales. These are the two main jobs. Yeah. Now, in between, all the other functions are also very critical. But definitely, I think if these two things are not there, it is very difficult for any organization to really grow and do the needful with regards to patient centricity. Now, coming to this very nice question that, okay, you make a drug. I would say making a drug is one part, but providing healthcare solutions to the patients in India is a very, very important part. So we have a product basically in the area of Rh negative. Now what happens is Rh negative patients have a real problem in pregnancy. This is not even known to many people in public and many general practitioners also. People suffer, they have problems of miscarriages, etc. And this is one big area which BSV took up a few years back and have done a lot of education, like through Foxy and through various urban and rural areas, association of doctors, to really work on awareness, one, education, and also see how best we can get into the treatment by getting into the state government's protocol where the drugs are given free to the government hospital patients. The another area which we have worked on is anemia. Now 60% of women are anemic and a lot of problem occurs because of anemia, which is the basic cause. And I think that is one another area which we are working, especially in the awareness area. The third area is lactation. Now natural lactation is something which everybody talks about, but today's with the stressful life, this is becoming an issue. So today again we have partnered with Foxy for a program which is education on lactation, okay, across the country. And I think the most important thing is one more area is on program labor, you know, where you have, like, for example, normal delivery, how can it become more, less painful, more convenient, more comfortable. So that is the another area where we are working on. Now, these are the big areas of our awareness area, I would say, and treatment, where we are working with Foxy and other associations of gynae as well.
Lovely. Sujit, when we're talking of pharma, we know that we have been termed as the pharma manufacturing hub, but when it comes to R&D, there is not much that was happening until about 18 months ago or 24 months ago, when the attention suddenly was brought in that, we need to address the R&D in India. What do you think needs to happen, and what is it that Zota is doing to address this? Why is it that we can't have drugs where the research and development happens in India and the the innovation can happen in India?
Right. So I think, whatever I answer, my colleagues would understand and agree, because all of us are into the similar phenomena. So typically what used to happen is that it's not that we don't do R&D in India. India does and have very good R&D centers. And in the last close to around 3 to 4 years, we have seen a lot of new molecules coming up from India, quite a lot. At Zota Healthcare, typically, from the factory, whatever production happens, and our R&D cell that we have, we ensure that the desired amount of R&D does goes through, of course, some technology that we have to, inscribe from elsewhere part of the world to ensure more amount of automations, because nowadays R&D, what used to happen and the way R&D used to happen earlier 10 years ago is not what it happens today. The entire facet of R&D have changed. And when you do an R&D, it gets automated, and everything gets into the complete simulation towards generation of the drugs. So what the methodology that most of the companies out here or elsewhere, the entire focus and the scientific approach of R&Ds have changed, and especially in the last 3-4 years. So we at Zota Healthcare are doing, but wherever required, we do bring in innovations from outside, so that it's at the speed that we want. That's extremely important. So speed and accuracy towards ensuring that the R&D goes in the right direction and dimension for the output of the desired medicine is the most important thing. And we are in generic medicine. So that's what is the need for India today. And that's where, we are working to ensure that we optimize the cost for Indian healthcare as an ecosystem and globally much larger at large to ensure that we optimize the cost of getting into affordable healthcare for mass.
Meenakshi, let me come to you. When we look at your portfolio, you have a very strong portfolio in the cancer domain as well. But as an organization, we also need to understand what is it that we can do to help the society. Now, when you look at cancer, it is absolutely clear that cancer can be managed if the diagnosis happens much early. Now, as an organization, what is it that you are doing to create this awareness? Because much as, even in the urban areas, when there's a higher level of literacy, education, etc., we still do not go in for early diagnosis or even regular checkups. Is there something that the company is doing to create a focus on early diagnosis in this space?
Yeah, thanks for the question. So absolutely, I think oncology or cancer is a big part of our portfolio. And of course, linked to our products, we're doing a lot, but your question is much more above and beyond that, right? So I think this was something we absolutely realized, and we decided to work through very credible partners. So our biggest partner here is Tata Trust, where what we have done is we started in the Northeast and now it's expanding, is through their hospitals set up a huge screening program. So almost every patient that walks in for at the hospital is invited to, not everybody wants to, but is invited to do a full NCD screening, non-communicable disease screening, which includes cancer screening. And that's been a huge eye opener for us as well. I mean, we've almost screened this was about 2 years ago that we started. So about 2 lakh patients have been screened and almost 22,000 have been detected for follow-up in oncology in some shape or form. So that was the eye-opener, that there is actually, now obviously that is a very specific population that's coming to the hospital for something, but we thought that is already a good starting point. So that was the first thing that we started. And now we are looking to expand that whole program across the country, but also go beyond footfall in hospital. The second thing, which is extremely underestimated, is the impact of a patient who gets diagnosed with cancer, particularly if they don't have the levels of income that's needed to afford many medications. What do they do to actually get the, how do they figure out what funding sources are there, who they can tap into? Because there's a lot of funding available, but for a patient to navigate it is very complicated. So this is another program we've set up with Doctors for You, which is at 14 government hospitals, where patients who get diagnosed with cancer, doesn't matter what medication they're put on, and in many cases they are not our medications. It's how do we guide them, counsel them to navigate through funding sources, mental support, family support, so on and so forth. Because it's not just the drug, it's the whole ecosystem, the whole life that changes when a patient gets diagnosed. So from that minute on, how do we handhold? So these are just a few examples. And most recently, what we started doing is supporting investments in startups who are doing a lot for cancer screening. So our proudest moment was a startup we funded in called Pragma Tech, who've come up with a cervical cancer screening where the woman can do self-screening at home. Now, this is not a commercial investment. It's through our CSR, so we have no stake in it. It's completely, arm's length. But what we are finding is there are a lot of startups who can actually help us expand the footprint of screening much faster. So there's a lot, the list goes on, but I think absolutely, to your point, we see it as our responsibility, not just to bring the medications, but to do what we can to support screening, but also that first point of diagnosis, how do we support the patient?
Awesome. I think this is brilliant because I'm compiling a book and on cancer and, what can it help? How can patients who are dealing with cancer muster the courage to go fight it out? And one of the issues that came up very blatantly, which I was not aware of, that the biggest problem that people are facing is the finances. How will my family manage the finances for my treatment? So I'm so glad somebody's addressing that. Second is, I think, one of the things that, if I can, share my perspective, is when we're talking of diagnosis or helping people go take that test, I think we have to start speaking about positivity so that people are not fearful of the result. So, if we can talk about how many people who took the test and they were found to not be facing cancer, I think that could be really, really helpful. Sanjeev, let me come to you. When we talk of AstraZeneca, not only AstraZeneca, I think it's an industry thing. There's a huge challenge that we face in terms of hiring. And there is a focus, very deliberate focus towards hiring women professionals, qualified women in this area. We see a lot of women who have studied science, but they do not end up working in that field for whatever reason. I mean, their family pressures, or unsure of where they will be married into or where the factories are. And this could become a potential challenge few years down the line. Is there something that AstraZeneca is doing to create the comfort and the confidence of building a career in the field of science, especially chemistry, so that the industry has enough women manpower qualified to take on and fill the positions?
That's a very good question, and I will answer in two parts. One is, I think, first, as an industry, we need to demonstrate what we're doing, and again, with the purpose of bringing science to patients. There has to be a pull which needs to be created. Nobody would just join you. You have to showcase what we are doing for the people and society and the planet. And I've been interviewing people. When we talk about a narrative, that this is not only about just giving medication, but it's also about how do you help the society? How are you helping in sustainability? I can clearly see a lot of pull coming. The younger generation are looking for how an organization is helping the whole society and people and the planet. I think that pull and that narrative needs to be created by us as industry leaders, and keep talking about it, because awareness is very, very important. The second thing is, the another pull which needs to be created is about, so for example, AstraZeneca, we are working with the state government a lot. And we recently announced a big partnership in which we wanted to bring with the Health Minister of Karnataka and Health Minister of Goa, that how are we working at a grassroots level to bring early diagnosis of lung cancer. And the purpose there is to eliminate lung cancer as a cause of death. So when you're interviewing people, again, you're not just selling medicines, you're just saying that what is the purpose of there and why should they join our company? Is it beyond just selling medicines or beyond that? That's number two. Number three, AstraZeneca at a global level, we are now working on a STEM. We really believe that the STEM and the women and girls in STEM needs to come forward. And we are doing a great effort around that piece, and we'll also be further enhancing that in India. We are already doing it globally, and this year we have taken inclusion and diversity as a challenge. So STEM is something which we need to talk a lot and bring it much more early. So two parts: you have to create a pull to show to the world that what women leaders, and of course, diversity and inclusion is important for the country, but also bring some programs specifically focus on STEM, and which AstraZeneca is doing, and we want to further strengthen that in India for the Indian girls and women's in science.
Awesome. Alok, there's a lot that every company wants to do, including the large ones like yours. But there's not much that we can do beyond the resources that we have, despite having much more resources than any other company would have. At the same time, we are living in a times where technology is there. Technology advancement has made it easy for small companies to create some innovations. But if you look at the startup scenario, a lot of these innovations die before seeing the light of the day, just because they have no support of the industry. They don't know whether, how to go to market. They don't have enough financial support to be able to do what they are doing. And they fear the large players like yours. Is there something that you think the industry or the large players in the industry should do to support these startups and help them go to market rather than seeing them as potential competition for some segment of your business?
Very well said. This is a very good question, actually. And digital, technology, if I look at pharmaceutical, the adoption has not been really very good. Now, when I say this, definitely I would say that, especially if you look at one of the areas is like omni-channel marketing. One of the area is also in the area of production. Then the area of, for example, customized based treatment. So there are various areas where we can actually use digital technology. I remember when I was in Singapore with Sanofi, where I worked for 35 years. We started omni-channel marketing in pharmaceuticals. We looked at AI models to engage customers. Okay. When I came to India last year, I realized that pharma marketing is still digital, is very, very limited. Now, 40% of the work which is done in marketing area can be done very well by AI to support the field force. And 60% can be only done by field force because, that cannot be done by machine. The relationship, as well as the communication, the power of influence, all that cannot be done by machines. So I think it is a very important area where we can get into. When we are talking about doctor-based engagement plans, customized engagement, we can definitely tie up, for example, with startups, because some of them are doing a great job. So instead of reinventing the wheel, as a company, we can do that. Second, today in the area of recruitment, it plays a very important role. Third, in the area of supply chain, when we talk about SNOP processes, etc., there also we can get in. So today we are trying to really see how we can bring this transformation, which is the digital transformation, in different areas of the business, which is not limited only to sales and marketing. And analytics is a very big area, actually, where I think Indian pharmaceutical industry has to do a lot of job, where already all big companies internationally, they have actually now an analytical head who's at the XCOM level. So definitely it's a very good opportunity.
Sujit, every manufacturing organization today is expected to have strategies, policies towards environmental protection. What do you think Zota is doing, and what do you think should be some strategies that every pharma manufacturer needs to adopt in today's day and age?
Yeah, I think for India, this is a very strong piece that most of the manufacturing companies have taken it up. As far as Zota is concerned, we ensure that every single compliances are done towards. I would not still say a zero emission, because that's more of theory for us, but as minimal as possible, of course, within the governance limits that goes through. When the question goes to what every pharma company should do is that, and now if you see a slice of India, pharma manufacturing is broken down into very large, mid and small. So you have very, very small pharma manufacturing as well if you go to multiple places. So along with the government policies and what the ownership of every pharma manufacturing should happen is to ensure that environmental health policies are taken up in line with the government policies towards minimizing any detrimental effect of environment. Why I did not use the word of carbon or zero emission, because I know that practically at this point of time, it's not possible for even the small manufacturers. It's a good thing to say, but for small manufacturers, if you go to their factories, it really does not happen in that way. So within permissible limits, if they do it, at least it's a good start for everyone.
Thank you, Sujit. We have a minute left. So I'm going to ask one question, and maybe whoever wants to address it first can take the lead and others can follow. We have been talking about inequity in healthcare. We have healthcare where you have large corporate hospitals where the treatment is really expensive. You also have treatments which are available, which are affordable. while India is known for affordable treatment compared to the globe, other places worldwide, we are still more expensive or very unaffordable for the Indian population. Similarly, if you look at the medicines that we are producing, some of the medicines are really, really prohibitively expensive for the general population in our country. What do you think pharma companies need to do to align the objective of serving the community with the corporate objectives that they have? So whoever wants to.
I'll take it first because it is a very relevant question for us. We run more than 700 retail pharmacy stores in the country by the name of Dawa India. More than 700. And it's well spread up all across Jammu and Kashmir, Kerala, Kolkata, Bangalore, everywhere. Now, these are very high-end generic medicine stores where affordability is taken as a key parameter. I myself work in the rural India. I have seen if you go to the deep of villages, people really cannot afford expensive medicines. And that's the truth which is there. So it's extremely important that we ensure that affordable medicines, affordable good quality generic medicines should be the only mantra when we talk of OP, so that at least people can afford. These are the people who can't even afford food properly. Forget about any branded medicines. They can't afford expensive drugs. They break the pills and take because they can't afford. They skip morning, evening, night to only morning, night or morning, evening because they can't afford. So first and foremost thing, I think it's very, very important that we must ensure that affordable medicines reaches to the pocket of every single Indian. And once that happens, then the basics are being done. Then we come into, the hospitalization, the tertiary clinics, the subsidiary activities, etc. But if those medicines don't reach, if those good quality, low cost medicines don't reach to the common mass of India, we are far, far away from what we actually aspire to achieve as healthcare system in India.
Anyone else? Meenakshi, would you want to address this?
I think Sujit summed it up really well. So I think that's exactly, sometimes there is an assumption that we have different objectives coming, and I think everyone has really the same objective, that we want to make sure medicines can get to the right patient at the most affordable price. That is what all of us are trying to do. I think how you are approaching it is extremely novel. That's one huge, it will have huge impact for all of us. It's exactly the same. So whether it's about trying to get India specific pricing wherever possible, we absolutely try to do that. Where we cannot get India specific pricing, we do it through patient access programs, so that, if you buy, one, then the subsequent 2, 3 can be free. We're all trying to get into Ayushman Bharat. That is a common thing. I'm sure all of us have, initiatives to try and get into Ayushman Bharat with our medication. So I think the objectives are very similar, whether you are multinational, Indian, vaccine, chemical, biologics, it's all similar. We're all trying to get it to as many patients as possible. And I think that's probably the way I'll close it. Yeah.
No, I think all have been said. I would say healthcare equity is an important subject, and it is even more after the COVID period. And there are two things which I will just close it by saying. One is that not only medicines, if we can bring equity or equitable access to even screening at all levels, is much more reducing the burden. So it's no more about just acute care. It's preventive care, equity, and equitable access to that is a very, very important thing. And we keep continuing work, bringing back, our medicines at an affordable price to India. Number two is, again, I will repeat the same thing, but one big model, and I'm not sure it can be repeated again, but bringing vaccine equitable at no profit was one big model. So 3 billion doses across the world, equitable, low middle income countries, and even for India at no profit was one example for that. But I think preventive care, preventive screening, if we can even bring equity there, we don't want people to become sick. I think the model will change towards that. Can we make less people sicker and screen earlier and bring equitable access to screening and diagnosis is a very big step which we all need to take together.
Yeah. So I think apart from all the points which have been added, one of the things is, if you look at India consumes the around, if I have to really look at, is around 8% of the total medicines, in the world. And our pricing is 1/8 of the world pricing in today's context. So we are the most economically priced medicines you get in India. That is the first part. Second, still I would say the treatment has to become affordable, but I would add it should be quality treatment which should be affordable, because we can't compromise on quality. Third area is, I think when the PMO started Jan Ashudhi, okay, I think this is one area which has grown very well. And now like Rota, for example, in your case. So we are looking at today generic market, which is growing faster than the branded generics market in India. So basically generic is doing very well. Branded generics are also doing well. So we are at a good position at this juncture, but still we have got an issue where people are unable to afford, and where we have Ayushman Bharat as one of the schemes. There are many, I would say, funding associations like Haq Darshak, etc., working with AIMS, and other big institutes, which is trying to see how we can fund some of the high cost, treatment in diseases like oncology, etc. So I think a lot of work is getting done here. As pharmaceuticals, we will try to do our best, because that is one area we want to really improve access. And I think as Sanjeev mentioned, I think it's also important about screening, because if you get early screening, many of the problems get solved. And digital health, especially done by startups, is one big area which I think as emerging, which will solve this problem to a great extent in future.
Awesome. I think with that, I'm going to close the panel and proceed further with the rest of the day. Thank you so much, panelists, for joining us. It was so nice to understand what each one of you is doing to contribute to the society and help building a healthier and greater society. Thank you so much.
Thank you so much, ma'am and gentlemen. I please request Mr. Rahul Bhargav, Chairman, BMT, and also Hematology at Fortis Healthcare, to please join us on stage and present a token of love and appreciation to all our panelists, please. We'll just... Thank you so much. Thank you. With that, we come to an end of the first bit of today. That was the conference. And before we move ahead with the celebrations, I think this is the moment to celebrate. We also have a launch of the BW Pharma. Hello. Thank you. We also have a launch of the BW Pharma World, for which I would request Mr. Harbinder ji to please join us. And he made an exit while I said that. Now he's back. Yes, sir. Let's first do this, and then we shall proceed with the awards ceremony, right?
I think a little over 2 years ago is when we launched BW HealthcareWorld as a magazine 360-degree media business. And the tagline that we chose was the business of healthcare. Because while we were all talking about B2C, there was nobody addressing the industry. And we were I was personally very scared because I did not know how we'll be accepted. But I must express my gratitude to all of you as an industry to accept us as one of the players and help us become a significant player in the industry. But while in the last 2 years that I've spent in the healthcare media publication, I realized that the role of pharma was too big to be included as a subset of healthcare. And that is when, me and Dr. Batra, who's the chairman of Businessworld and chief editor, we kind of deliberated and said that, this needs to be treated as a separate entity, not a separate entity, but a separate business altogether. And today it is my honor to announce that we have taken that first step. We're launching BW Pharma World. And for that, I'd like to invite Dr. Batra to the stage. Dr. Anurag Batra. Yeah, I was very tempted to have this conversation, Batra versus Batra today. So Dr. Anurag Batra, Meenakshi Nevatyaji, so if you can come to the stage. Meenakshi, are you there? Or have we taken her? Oh yeah, there she is. Mr. Sanjeev Panchal, Alokji, can we have? Thank you so much. Can we get? Oh. And Hoshi, are you there? Mr. Hoshi Ghaswala? So while we wait for Hoshi, Meenakshi, Sanjeev, Alok, can we do the honors and announce the launch of BW Pharma World?
Thank you. Congratulations, everybody, once for them for also the BW Pharma World. You can show some more excitement, everybody. This is a new journey that they're beginning, no? Along with all of you. Thank you. Also because it's time for all of you to come on the stage and receive your awards, no? You should have some josh and energy. Okay. Ladies and gentlemen, esteemed guests and also healthcare professionals, it's with great pleasure and honor that all of us gather here to celebrate the remarkable contributions of some of the most distinguished leaders in the healthcare industry. Once again, my name is Aditya Malik, and it's an honor and a pleasure to welcome all of you. Now, as you recognize all of their efforts, let's also take a moment to acknowledge their dedication and commitment to making a profound impact in this specific industry. Today, we honor them as a healthcare impact persons, celebrating their outstanding achievements and also the difference they continue to make in the lives of millions across the globe. To present the first award, may I please request Mr. Ajay Swaroop ji to join us on the stage. Sir is there. Once for sir, please. There's also the opening keynote session. Rightly said by sir, he is Sunil Gavaskar. So we शुरुआत sir ने करी थी रवि भी. Well, okay, I also have a brief introduction about our winners, but we shall do that once they are here with us. And the first leader to receive the Healthcare Impact Person for this year, please. Okay. You know what? Opening के मामले में सिर्फ सर अच्छे हैं because ये गलत था. So we'll do a take two as well. No, sir, yours is later. There's someone else. KK, are we ready with the right one? I'll build it up again. It's okay. Mr. Abhay Sinha, the Director General of the Services Export Promotion Council, Government of India. Now let's welcome him, please. May I please request Dr. Anurag Batra, sir. May I please request you to also join on the stage for this. We'll do the picture again. Mr. Sinha's visionary leadership has been instrumental in promoting and advancing healthcare services on a global scale. Thank you so much, Ajay sir. Everybody wants for Mr. Swaroop, please. And now to present our next set of awards. Dr. Batra is here. May I please request Harbinder ji. 1 second, just. Okay. I'll take the leader. I'll help you. I please request Harbinder sir, Meenakshi ji, and also Dr. Panchal to please join us on stage to help us present our next set of leadership awards. Please, aye. Let's welcome them, everybody. Harbinder sir. Okay. And the next healthcare impact person for this year. On the screen, please. Sanjeev K. Singh, the Medical Director of Amrita Institute of Medical Sciences and Research Center, Faridabad, and also the Chief Medical Superintendent of Amrita Institute of Medical Science and Research Center. Sir's expertise and tireless work in the medical field has significantly enhanced the quality of healthcare delivery. Congratulations, Dr. Singh, congratulations. And thank you so much, Meenakshi ji, for this one. Ma'am, thank you so much. No, sir, that's only for ma'am. We'll keep changing, sir. We've been told doctors are fit. We'll make use of it today. Thank you so much, ma'am. Thank you. Okay, and the next healthcare impact person of the year on the screen, please. Well, that is why, ma'am. This Meenakshi Rewate, the country president of Pfizer, India, everybody. He's not here. I've been told. Congratulations, ma'am. Her strategic acumen and leadership has been pivotal in driving innovation and also accessibility in pharmaceuticals, positively impacting countless lives. Thank you so much, ma'am. Congratulations as well. I also request Dr. A.S. Soin to please join us on stage and help us present awards to our next winners, please. Everybody wants for sir. Let's welcome sir. And the next healthcare impact person of the year on the screen, please. Sunil Khurana, the Managing Director of BPL Medical Devices. His relentless pursuit of excellence has revolutionized medical technology, ensuring cutting-edge solutions for healthcare providers worldwide. Congratulations, sir, and thank you so much. Thank you. Our next healthcare impact person of the year on the screen, please. Also, Sanjeev Navangul, the Managing Director of Bharat Serums and Vaccines Limited. And we have with us Mr. Alok Khetri to receive the award on behalf of Mr. Navangul. Sir, please. Under Sir's guidance, the organization has played a vital role in providing life-saving vaccines and critical healthcare solutions, particularly during challenging times. Congratulations, sir, to you and also to Mr. Navangul as well. Moving ahead, the next healthcare impact person of the year, please. This is Sanjeev Vashishta, Managing Director and CEO of Pathkind Diagnostics Private Limited. Everybody wants for sir, please. His innovative approaches and commitment to excellence have significantly contributed to advancing diagnostics healthcare services. Congratulations, sir. Our next and the last healthcare impact person of the year on the screen, please. Dr. Tarang Gyan Chandani, we have with us Deepa Pandey, Additional Director Medical Services, to receive the award on behalf of Dr. Gyan Chandani, the Group CEO of Sir H.N. Reliance Foundation Hospital. Yes, ma'am.
और ये करवा देना जितने पैसे मैं आपको ट्रांसफर करूँ, ठीक है, जो भी है इसका अब मुझे बता दे। Thank you.
Ma'am's transformative leadership has set new standards in patient care and healthcare delivery, exemplifying excellence in the specific field. Congratulations, ma'am, and also to Dr. Gyan Chandani as well. Thank you so much, gentlemen, for helping us with the awards. Everybody once for them, please. Thank you. And now we'll move ahead with the next domain, which is for doctors. But before that, sir, you wish to say something? No, sir.
You know, when we were planning this evening, one of the things that when we were, I believe a lot in gratitude. And one of the things that came into my mind was that when we are looking at this space, we sometimes wonder that, aage kya karna hai? And what is the next development that is going to take place? But we forget that we are living in a world which is much safer. We have medical help available. And we must not forget the development that has already happened until now. And also the other thing that came into my mind was that aaj se 3 decades pehle, if somebody had a heart attack or somebody had a major health crisis, the first thing that someone would guide you was, why don't you take the person to the West? Why don't you photocopy all the reports, courier it to the West?
Mic band ho gaya.
But today we are living in a world where we feel safe in India. We feel that we are getting the best healthcare treatment in India. And even if we go abroad, it is most likely that the best doctor who will be treating us is going to be an Indian doctor. With that thought, we felt that, it is time that we acknowledge the work that some of our Indian doctors have done to make our nation be on the world or the global map when it comes to healthcare delivery. So we have, with us few doctors who have paved way for us to be where we are today when it comes to healthcare delivery. So the next set of, I won't even call it an award because it's an understatement. They are already well rewarded, well awarded. So the next set of people that you're going to see on the stage are the ones that we want to honor for their contribution in the field of healthcare in India. So over to you, Aditya. And Dr. Batra, Dr. Anurag Batra, before we actually start giving these honors, may I have you speak a few words, share with us your thoughts on healthcare and what we are doing?
Yes, please welcome Dr. Batra, everybody. Please.
Thank you for putting me in the spot, but as my friend Dr. Mukesh Batra knows, I don't know anything about healthcare. So thank you, Arvinder, and that to an audience who are experts in healthcare. But I will not talk to you about healthcare. I just want to say that I was just telling Harbinder on the stage, if you were wondering what I was chatting, I was asking him about the awards. Harbinder runs the healthcare well-being and now will run the pharma community. I just want to say that some of you have been part of our juries. We do our awards through a jury process. So I asked him, which are these awards? He said, these are a way to give gratitude, and that's what he was explaining. I just want to say that we're a young community on healthcare. We have ambition to be able to make a huge impact and be the #1 community, which is editorial led for this industry. I don't want to talk to doctors about healthcare. I've met my friend Sunil Thakur outside, who's funded so many healthcare and health tech companies. But I was very somber when I was coming here. Last night I landed from Abu Dhabi, and I got to know a friend of mine. He was very young, he's less than 50, PKD Nambiar. He was on television a lot, and he died. He had a heart attack. And I remember I had a dinner with him 2 weeks back. He canceled, saying, I'm not well. So I just want to say, I hope, and in the morning, Harbinder and me were talking about liquor, and I said, I'm very anti-liquor and I'm very anti-tobacco. Some of the senior people who work with me, know that, I mean, it's your personal choice. I can't tell anyone, I can't tell my children also what to do, what not to. But I did prepare a presentation because I was very somber. And I just want to talk to you about 3 things today. One is, I'm going to talk about that in a while, but do you know who this guy is? Who's this guy? Does anybody recognize him? Do you know about him? His name is given, so you can Google him. But does anybody know Dr. Batra? Do you know about him? Okay, so he's an Israeli. His name gives it away. He's called Nether Ben Yehuda. This is a photo that was taken almost 12 years back, maybe 12 and a half years back. In 2012, early 2012, he was aspiring to become the youngest Israeli to climb the Mount Everest. And he was very close to the base camp, and he was progressing to get to the Mount Everest, and he would be the youngest Israeli. And doctors are givers. You all are givers. You save lives, you build families, you give hope, you elongate the quality of life. So this is just as a gratitude to you. This guy had 2 choices when he was climbing up. He saw 2 of his friends, one almost dead who eventually died, and one who was about to be in the similar condition as his other friend. So he had 2 choices, either to go up in life and become the youngest Israeli to climb the Mount Everest, or to save a life. He did what you would have all done. He saved his friend's life. And that's why I'm talking about him. He then became a mountain climber. Go back, stay on the second slide. He became mountain climber, a search and rescue professional, a photographer, and he's on the speaker circuit. But he also climbed the Mount Annapurna. So I'm talking to doctors. My wife had some eye issue, and I requested Harbinder. He got me an appointment in a hospital, and my wife is better. She had some issue with her eye. And doctors do this daily. But I also want to say to you, I'm sure you look after yourselves. So do look after you. While you're kind to others, be kind to yourself. I have doctor friends who are my batchmates, and they're the best lot I know. I have been on the receiving end of kindness from a lot of people. Here I can see 2 people on the first table. So I just want to say to you that in a world where everyone can be anything that he or she wants, doctors choose to be kind. You're a great role model and example for others. So your kindness is an inspiration for everyone in the room to be kinder. Second is, one of the things that as doctors, I know when you go, I remember I went to Dr. Batra, he asked me, how many hours do you sleep? He asked me about lots of personal questions, trying to gauge my emotional stage, because it's holistic healing, homeopathy. The one thing that I keep talking about and I follow it is sleep. This is a book I read 10, 12 years back whenever it came out, and I read it again in June or July, going for a healthcare event in Bangalore. And I keep saying that sleep is the most important thing. Again, I don't have to talk to doctors about sleep, because this is the foundational pillar of health, food / nutrition and movement / exercise, these 3. But sleep is very important. I sometimes find my doctor friends sleeping lesser than they should sleep. Dr. Gupta is nodding. I know walking is the third, which is movement, but sleep is the most important part of health. So I'm reinforcing something that you as doctors preach. I sleep 8 hours every night, or if not every night, 25 nights in a month. That's the good thing about what I do. So I do want to re-emphasize the I don't have to evangelize to a group of doctors what sleep can do, but I'm just bringing it top my mind because I go to conferences and most Indians are sleep deprived. They sleep less than 6 hours. 50-60% of people in every room that I go to have slept less than 6 hours in the night. A lot of them between 6 and 7 hours. Rarely more than 10% who sleep more than 8 hours or 8 hours. So we are doing an India sleep study with 30,000 people, and I'm sure we are a sleep deprived country, and there are many studies. This is the latest version of the book, or the latest edition of the book, and it talks about the amazing breakthrough which is sleep. I don't have to tell to doctors about sleep. We're in the era of artificial intelligence, quantum computing, blockchain. And again, there are two enemies of sleep. One is companies like Netflix, Amazon. You can binge watch. You can start watching something at 10 p.m. You can watch till 4 a.m. I've done it twice in my life in the recent times. Second is this food delivery company. You can order a pizza at 2 p.m. and eat. You can order chicken tandoori kebab or whatever you like to eat. So these companies are making, sometimes availability creates demand. It creates consumption. So really our lifestyles are getting impacted. The third thing, which is really, again, I've been talking at all the initiatives that we are involved, is that Donald Trump is wrong about a lot of things. He's also wrong about climate change being a hoax. The winters this year were irregular. They were shorter. Look at the temperatures in some parts of the world. In the Middle East, in the MENA region, some countries are getting summers 2 months ahead of time. Sub-Saharan countries are getting it 4 months ahead of time. Look at what is happening in terms of wildfires in Europe, in Australia, in America. So clearly, sustainability is a big issue. You all are leaders, promoters, founders, doctors who have an influence over a very large community. People listen to you because, that's how they do well in life. They listen to you because they're afraid about their health. They want an expert view. So in whatever you do, I'm sure you build sustainability consciousness in your conversation, in your practices. And this was a time issue. I read it, I think in August. I'm not sure whenever it is. May, whatever it says. Last year I read it, and when I was preparing, I said I must show this. This talks about how oceans are shrinking. It says the most important place on earth. The oceans are shrinking. I remember going to a conference where my daughter was speaking, a UN conference 2 years back, 9th April 2020, and the head of the Navy was talking of shrinking oceans. And I heard him and I said, is that serious as he makes it out to be? And then I went on to do some research, and the oceans are genuinely shrinking because we are building habitats everywhere. And shrinking of oceans is again a bad thing because, as you would research and some of you would know, that the flora and fauna and the big mammals, and especially their excreta, absorbs a lot of carbon dioxide, and that is very good for the planet. So while it's good to build new habitat, new real estate, new man-made wonders, I think the natural wonders need to be kept there. So I just want to reiterate that you're very kind, gratitude, because you not only nurture yourself, you nurture everyone. I know doctors like this. Harbinder was telling me that some of them like their drink. I have friends, and some people say you can do anything in moderation, it's good. But I keep saying that, you're putting pure acid in your body. It's just, it is acid. And I have done a bit of it in my early days, a lot of it. So I just want to say that I hope that all of you look after yourself. You're able to sleep 8 hours plus because your life is such that people are always making demands on your life, both personally and professionally. Second is whatever you do, build sustainability consciousness. You have influence over a very large group of people. You're chairmen of large medical institutions, you're founders of companies. And third is kindness starts at home. So be kind to yourself. And I do want to recommend a book which I read. And I've been the recipient of kindness of many people in this room. I read this book sometime in March last year, and since then I've gifted many copies. And it's a very contrarian view to what Harari takes, that human beings are very competitive. Which they are, human beings are competitive. We are competitive, but they come into their base form and they claw into each other if you leave them alone in a room. This is a book written by a young Dutch philosopher which really trashes every Harari claim. It has a lot of interviews over the last of people who were involved in certain incidents that have been quoted to make human beings look unkind. And he's gone and done interviews with people. And he basically says human beings are very kind. And there is a very large history, not just, he's not just talking out of his hat or it's a point of view or an opinion. He's given example after example. So human beings are very, very kind. We know that doctors are very kind, very nurturing. So I just want to recommend this book to you. I don't get any money on the sales of the book, so I must give that disclaimer. But I think it's a book, if you like reading, you will enjoy reading. I don't want to stand between you and the awards. The healthcare is amongst our BW Healthcare World is amongst our youngest communities. We have many communities in many domains, some of them absolutely leader editorially. And if you're editorially a leader, it then reflects in every aspect of what we do. So I just hope and pray that BW Healthcare World, BW Wellbeing World, and now BW Pharma World will be able to get your attention for the right reasons, have some value in your life, and be able to create a community that engages deeply with each other for the benefit of each one involved. Thank you. Our awards are done through a jury. These are felicitations. And as Harbinder said, we can't, all of you are well accomplished, well awarded. Some of you are Padma awardees. Some of you been bestowed with the best accolades that India has to offer. But it always helps to have you amongst our community. Your presence adds to the gravitas and to the joy of people who are getting awards. So really gratitude to this community. I think this community does more for all of us than anybody does. And clapping is good for heart muscles. Walking is also good, as Gupta ji aap kehte rehte ho mujhe. So thank you. Clap for the winners when they come. I do yoga in the morning. He makes me clap a lot of times. And I learned that clapping is very good. And slow breathing is also very good. So God bless you. Back to you, Ms. Malik. Ankit has been doing it since the morning. So give Ankit a big round of applause. Thank you, Ankit. I hope you'll bring more energy.
Thank you so much, sir. Mr. Narula, I'm missing Shoaib. How many of you attended the after lunch session? How many were here? For the ones who weren't here, you all missed that dance session, right, sir? You had fun? Would you want to try that again? No. Okay. Now, as we continue our celebration of excellence in the healthcare industry, it's my privilege to introduce a distinguished group of medical professionals who made outstanding contributions in their respective fields. Today and now we honor the prestigious healthcare honors recognizing the exceptional dedication and expertise. And to present those awards, please join me in welcoming on stage once again Dr. Anurag Batra, Chairman and Editor-in-Chief of BW Businessworld and founder of Exchange for Media. Joining sir is Harbinder Narula, CEO of BW HealthcareWorld and also of BW Wellbeing World. And joining them is Dr. Abhay Sinha, Director General, Services Export Promotion Council. Please. And the first doctor that you would wish to present our award towards, an honor for us to welcome him on stage, on the screen, please. Dr. Arup Mishra. the specialization, diabetes care, metabolic diseases, and also of endocrinology. Fortis CDOC Hospital for Diabetes and Allied Sciences. He's been presented this award for healthcare honor for contribution in diabetes care, metabolic diseases, and also for endocrinology. Congratulations, Dr. Mishra, and thank you so much for your service, sir. Thank you. The next healthcare professional in this list on the screen, please. Professor Alka Kriplani, Chairperson, Obstetrics, Gynecology, and also art from Paris Hospitals. Our healthcare honor for contribution in gynecology. I believe that Dr. Kriplani was running late. Is ma'am here? Just wanted to make sure that if she was here, we wouldn't want to miss out this chance. She's not? Okay, no man. We shall do that later once ma'am arrives. Yes? Chaliye aage badhte hain. Our next healthcare professional to receive this award on the screen, please. Dr. A.S. Soin, Chief Hepatobiliary Liver Transplant Surgeon and Chairman of the Institute of Liver Transplantation and Regenerative Medicine. He is being honored for contribution in liver transplant. Congratulations, sir. Thank you so much for your service. We also request Dr. Sunil Khetrapal, Director, AHPI, to please join us on stage and also help us in presenting these awards. Please, sir. Aye. And the next healthcare honor, it's for on the screen, please. Yes, Rana, Nephrology, Sir Ganga Ram Hospital. And this healthcare honor is given to Sir or presented to Sir for his contribution in nephrology. Everybody for Dr. Rana, please. Thank you so much, sir, for your service. Thank you. And the next healthcare honor, please, on the screen. Dr. Harsh Mahajan, founder and CEO of Mahajan Imaging, and this healthcare honor is being presented to Sir for his contribution in diagnostics imaging. Dr. Mahajan, please, everybody. Thank you so much, sir. Thank you, and congratulations as well. And the next healthcare honor on the screen, please. Dr. J. M. Hunt, Chairman and Director, Center for ENT and Cochlear Implant. Center for ENT and Cochlear Implant. The healthcare honor has been presented to Sir for his contribution in ENT. Dr. Hans, everybody. Congratulations and thank you so much, sir. Thank you for your service. Thank you. Moving ahead, the next healthcare honor on the screen, please. For Dr. Mukesh Batra, founder and chairman of Dr. Batra's Healthcare. And this healthcare honor is being presented to sir for his contribution in homeopathy. Dr. Batra, everybody. We also have a panel today, along with other doctors as well. Thank you so much, Dr. Batra, for your service. And also Dr. Batra, thank you so much. And the next healthcare honor on the screen, please. Orthopedic surgeon for fracture and bone clinic. The healthcare honor has been presented to sir for his contribution in orthopedics. Dr. Ahuja, everybody. Thank you so much, Dr. Ahuja, for your service. Thank you so much. Thank you. And the next healthcare honor on the screen, please. Naveen Dang, microbiologist, and also the director of Dr. Dang's lab. Now, this healthcare honor is presented to sir for his contribution in diagnostics pathology. Dr. Naveen Dang, everybody. Congratulations and thank you so much for your service. Thank you. Thank you. And the next healthcare honor on the screen, please. Dr. Ambrish Ritual, Chairman and Head of Endocrinology, Max Healthcare. Now, this healthcare honor has been presented to sir for his contribution in endocrinology. Everybody, Dr. Ambrish. Congratulations and thank you so much, sir, for your service. Thank you. Thank you. And the next healthcare honor. Yes, the last one, which I believe is not on the screen. I have the name here with me. It's an honor to present this healthcare honor to Dr. Rahul Bhargava, Chairman, BMT and Hematology at Fortis Healthcare. This healthcare honor has been presented to sir for his contribution in BMT and also in hematology. And while they're talking on stage, with this we come to an end of this list. May I please request all the healthcare honor winners to please join us on the stage for a group picture with your trophies only. We can let the certificates be for this one. Please, aye, Dr. Sirs. Please. And after this, we shall begin with the 7th edition of BW Healthcare Excellence Awards. I think now that they're here, let's also collectively congratulate all of them and also thank them for their service, for their contribution in various fields. Thank you so much. To all the doctors, thank you. Thank you so much. Thank you. Also, thank you so much, Dr. Sinha, Dr. Anurag Batra and Harbinder ji. Thank you. Thank you. And with that, it's now time for the 7th edition of BW Healthcare Excellence Awards. All of us are here to celebrate and honor the visionary leaders, trailblazing experts, and also innovators like all of you who continue to shape the future of healthcare with your unwavering dedication and also with your expertise. Before we move forward, I will also take this moment to thank our partners for today. Our event sponsor, BPL Medical Technologies Private Limited, our knowledge partner, Samsung, our heart care partner, Lupin, our healthcare partner, Reliance Foundation Hospital, and our event partners, Joy Travels Private Limited, Fandrum, Beanley Coffee, JustBath.ai, The Thick Shake Factory, Reality Plus, Exchange for Media, IWM Buzz, Impact, and Pitch. Usually, of course, Dr. Batra talks about this, but because we had Sir's introduction before, because of course, there are a lot of categories to cover today for our award ceremony. Now, when all of you apply for these awards, you believe that each of you nominating themselves or their organization, etc., are already winners because this is such an expert list outside because all of you work extremely hard to reach here. But फिर भी एक process है. There's a list that we have to sort of come down to the categories, winners, etc., etc., etc. Now, what really happens in the jury meet, how difficult it is for them to choose from you winners already. From that first phase of you applying to then meeting the jury to today, reaching here to this list of winners that I will also get in a while. We really want to show you the entire process of that in a jiffy. So can you please have the jury meet highlights, Avi?
Thank you, Team Business World, for being a part of the esteemed jury for deciding the Business World Healthcare Excellence Awards. The entire selection and the shortlisting of the institutions was great. Itself was a great learning experience for us because it gave an insight to us to see the wide array and cross-section of the healthcare delivery systems in our country. Thank you, Dr. Batra, Mr. Harvinder Singh Narula, Sanjana, Bilkis, and Bunny. Hope to work with you again. Thank you. It has been a fantastic experience to be a jury of 7th edition of the Healthcare Excellence Award organized by BW Businessworld. It's a really commendable effort taken by the organization. I could see that they are trying to identify talent, foster their growth, and cultivate entrepreneurs for our nation. So I'm really glad to be a part and I wish them good luck.
Recently, we had the privilege of participating as a jury member in the Health Excellence Awards organized by Business World, and it was wonderful to meet the jury, the diversity of nominees, well selected, well prepared, and the presentations were crisp, fast, and efficiently conducted throughout the day. Congratulations to BW team for doing such a wonderful award and taking healthcare forward. All the best. Thank you.
As a jury for Business World Healthcare Excellence Awards 2024, I found the whole process of awards quite seamless, efficient, and transparent. The jury, along with Business World team, virtually interacted with each and every nominee after their brief presentation on the awards category they had applied for and taken a call for the awards. Thank you, Business World, for the opportunity, and my best wishes to the nominees and congratulations to the awardees.
I would say that the quality of applications and organizations and individuals applying for the awards is truly exceptional. And there is a lot of innovative work happening in the healthcare space that these awards recognize. And for that, I would congratulate Business World for doing a fantastic job on recognizing, encouraging, motivating innovators in the healthcare space. Thank you.
Business World team has done a great job of having this awards contest, curating the entrepreneurs and startups, and I wish them and all the participants all the best for the Business World Healthcare Jury Award function.
So I have been onto a lot of juries and trying to identify talent that is making a difference. So when it comes to institutional awards, it is very tough because each and every player in this field is already doing a great job. So one cannot pick one from the other. But what really happens is to identify what is the innovation that each of these companies are making and how sustainable these efforts are and what is the impact that they're creating in the field of healthcare. So this time the jury process was such, it was very transparent, but it was extremely tough for us to pick out who should be rewarded, who should be left behind. And I think the other jury members did an amazing job of identifying the players, asking the right questions that helped us identify who the lucky players are going to be, who will be awarded for their efforts in the healthcare industry.
I think let's collectively give a big round of applause to all our jury members. A big thank you to all the jury members who are also present here and otherwise as well. Thank you. So tonight's awards ceremony is being streamed live across all BW Businessworld platforms, including the social media channels and also on www.bwhealthcareworld.in. Please join in the celebrations of the evening by using the hashtag BW Healthcare Excellence Summit. An important announcement before we begin with the awards ceremony. All the winners, once you've received your award and once you step down, please proceed to stage left to get a picture, and then also stay back till the very end for a group picture again. Now, both of these will be used for the editorial coverage, and also we request you to please ensure that you also give your video interviews for BW TV, which is right outside the exit door there. You'll see a setup there with our team members to welcome you as well. And now let's welcome the felicitators for this ceremony, the first set of awards. Please join me in welcoming on stage Dr. Anurag Batra, Chairman and Editor-in-Chief of BW Businessworld and founder, Exchange for Media Group. Joining sir is Harbinda Narula, the CEO of BW Healthcare World and also of BW Wellbeing World. Joining them is Sanjeev Panchalji, Country President and MD of AstraZeneca India. Harsh Mahajanji, a founder and CEO of Mahajan Imaging, and also Sanjeev Vashishtaji, CEO of Pathkind Labs. Please, gentlemen, let's welcome them, everybody. Also get your hands sort of warmed up. It's time for you to congratulate your colleagues and also yourself. So you first have the category and then, of course, the institution / organization that wins it. And the first category on the screen, please. Gangaram Hospital for Institutional Excellence in Healthcare Research and Development. We have with us the team from Sir Gangaram Hospital. We please request you to join us on stage and also to receive the award. And also request Dr. Ajay Swaroop, the Chairman of Board of Directors of Gangaram Hospital, to please congratulations, congratulations. May I please request, sir, or anybody to please say a few words?
I can only say very proud moment for us. Department of Research, we started about 17, 18 years back, and we invest quite heavy, and I'm very happy to announce that today we have got such wonderful scientists. They are not doing research with only intramural grants, but they are getting in a private hospital, trust-run hospital, from extra grants from government sector, not only from national but international also. And we are now not only clinical research, we are in molecular research. And they are all shining stars. I am very proud of them.
Thank you so much.
Thank you and congratulations. Please don't forget the picture, the individual, and then of course, group picture at the very end. Okay, our next category, it's Institutional Excellence in Oncology. And the winner, please. Healthcare Global Enterprises Limited. There's Mr. Kuldeep Kumar, the center head of New Delhi, to receive the award. And of course, congratulations to the Chief Executive Officer, Mr. Raj Gure as well. Everybody, please. Healthcare Global Enterprises Limited. Sir, Ayana, please. A couple of words from you.
Thank you so much. This is on behalf of SCG, sir. Thank you so much, sir.
Congratulations to you and the entire team that awaits this trophy back home. Congratulations. Our next category, it's institutional excellence in hospital design. And the winner, please. Mr. Ajay Saigal, Group Business Director, Avion We, for excellence in healthcare communications. Everybody please for Mr. Saigal. This category is excellence in healthcare communications. The consultant media at Avion Week. Sir, on behalf of Chief.
Good evening to all my seniors and ladies and gentlemen. I'm thankful to the jury and especially to Businessworld for choosing me for the Healthcare Communication Award. Thank you so much for 25 to 30 years of experience in healthcare communications. It has been a wonderful experience, wonderful journey, and thanks for the recognition. Thank you so much.
Congratulations. Yes, sir, please. The picture. You know what? I think why the winners, let's also have the screen reveal the category for us. Sort of makes it more exciting. The next category and the winner on the screen, please. Sciences Faridabad for Institutional Excellence in Hospital Design. We have with us Dr. Sanjeev Singh, the Medical Director at Amrita Institute of Medical Sciences and Research Center, Faridabad, and also the Chief Medical Superintendent at Amrita Institute of Medical Sciences. Everybody, please, for Amrita Institute and also for Dr. Singh. Sir.
I would like to really thank Dr. Batra, Mr. Batra and Mr. Narula for this award and all the juries. We have built this new setup. This is at Faridabad, and we basically have worked under the guidance of Mata Amritanandmayi. This is a fantastic setup with excellence as our buzzword. We have worked on the hospital, which is 2,600 bed with the clinical excellence. There is academic excellence. There is medical nursing and allied health science school. There's a big research block, which is doing human medicine plus good manufacturing practices and all genomics, bioinformatics work. And there's equivalent emphasis on public health. So all four components are there. And I would like to really invite all of you to visit and keep guiding us because we are basically from South. And I'm enjoying doing this work, but though I'm lying, I was very happy in Kochi doing this, and it's a completely new setup. So learning from all of you, and would like to have your continuous feedback. Thank you so much for this.
Congratulations, sir, and all the very, very, very best for this endeavor. Congratulations. Moving ahead, next category, and the winner on the screen, please. in healthcare, bone marrow transplant, and hematology. We have with us Dr. Rahul Bhargava, Director and Head of Hematology, to receive the award. One more, sir. Dr. Bhargava, please. Sir.
I'm thankful to BW Awards for acknowledging a very rare branch, hematology and bone marrow transplant. As we all know, neurology, cardiology, and gastroenterology, and so other fields. And at the same time, it's a proud privilege for all of us that this just not in the center of heart in Delhi we are doing transplants, but also doing transplants in the remote sites of the country where the last mile can get a free bone marrow transplant done. And that's the beauty of Fortis and this country, that even the last mile has now an ability to get free transplants in Indore, Bikaner, Patna, and ESI Faridabad. And this is the best model what we have heard throughout the day of a PPP model, where you practice in a private hospital, but still contribute to the growth and the prosperity of the nation. Thank you, everybody. Thank you for acknowledging that. Thank you.
Congratulations, and to everybody at Fortis Healthcare as well. Congratulations. Moving ahead, our next category and the winner, please. Institute for Institutional Excellence in Healthcare Education Academics. We have thus Dr. Swati Bhatt, the Director and Head of Academics, and also joining her is Dr. Pankaj Sorangi, Founder and CEO. Everybody for them, please.
A special thanks to Mr. Harbinder Arora, BW World, and Mr. Anurag Batra for giving us this opportunity to be here on this platform today. Bottom of my heart, I give my thanks. Also, a word of thanks to my CEO and founder, Dr. Pankaj Sorangi, who has instilled his faith in me and who thought I could do this and made me the academic head of varsity. Thanks for instilling that faith in me. Over to you.
So just a few words about the pain medicine. I think this branch is new to India, and most of us are not aware of this specialty. But it's a very proud moment for all of us that India is the first country who has given this super specialty status to the pain medicine in India. So that's a good proud moment for India. Thank you.
Congratulations. Please don't forget the individual picture and also the group picture at the very end. Moving ahead, our next category and the winner, please. Excellence in CSR initiatives, healthcare. We have with us Mr. Arun Arora, the head of Chetak Foundation, to receive the award. For Chetak Foundation, please.
Good evening, everyone. I'm humbled and
obliged to receive this award. I thanks Dr. Batra and the jury for considering us for this award. And we at Chetak Foundation, we do a lot of work for the education, health, safety, and nutrition. And we hope with the wishes of you all, we will continue all this work, good work for the community, to give back to the community. These are all, we feel that we should give back to the society. And this event is really wonderful. Dr. Batra and your team has done a very great job. And Dr. Narula, maybe, I don't know, maybe I made him doctor. So yeah, so it's really, thank you very much, jury, and thank you very much, Dr. Batra.
Congratulations. That was the director, Mr. Mukesh. Moving ahead, the next category and the winner, please. For Institutional Excellence in Senior Care and Out of Hospital Care, we have with us a co-founder and Chief Operating Officer, Dr. Rima, to receive the award. Okay, it's Senior Care, please.
I would have stayed back because I would really like to thank Businessworld and all of you, the jury, to give this award, because we are one of its kind, starting our new wings in India in geriatric care, wriggling our way between super specialties like cardiology, neurology, oncology, etc. So we are starting, and it's very encouraging for us to get this award. Thank you all so much.
Congratulations, ma'am, and all the very best for this journey. Moving ahead, the next category and the winner, please. For healthcare, venture capital, we have with us the managing director, Mr. Ajay Mahibal, to receive the award.
We are honored to receive this award. I'd like to thank BW, Dr. Anurag Batra, Harbinder Narula, and the rest of the jury for bestowing us with this award. At HealthcareWorld, we are backing innovative models which are solving for affordability, accessibility, and quality of care. We positively influenced 10 million lives last year, cumulatively 50 million lives till now, and on our mission to influence 1 billion lives positively over the next few years. Thank you so much, and this is a great vote of encouragement. Thank you.
Congratulations, sir. Congratulations. You and to ma'am as well. Please don't forget the individual picture and also the group picture in the very end. Moving ahead, our next category and the winner on the screen, please. And genomics, we have with us Mr. Amit Arora, the Associate Vice President, along with his team to receive the award. Everybody for them, please.
Good evening, everyone. Thank you, Business World team and the jury members. We are certainly honored to receive this award. We at Trivitron Healthcare are doing our bit to make healthcare accessible and affordable in the country, and we'll continue our journey with the same. Thank you.
Congratulations. Please come. Okay, our next category and the winner on the screen, please. Training in IVF care. We have with us Dr. Shweta Diwan, the Chief of Clinical Compliance and Excellence, along with Sir, to receive this award.
Thank you very much, BW Healthcare, for giving us this award. I think the foundation of our Indira Fertility is our academy, IFA Academy. We take young doctors, 35 years is the average of age of our center head, and we have a state-of-art academy in Udaipur where we train them for 4 months. So we are able to get clinical outcomes at par to the best from 35-year-old doctors. So that is the foundation of our best clinical outcomes. Thank you for recognizing the effort.
Congratulations, ma'am. And with that, thank you so much, gentlemen, for having the awards. Dr. Batra. Sir, आपका तो आखिरी तक है. My script says rest. Of course, you have an urgent call to make. Thank you so much, everybody. Once for them, please. I please request Dr. Sunil Kate Report, Director EHPI, Mr. Sunil Khurana, MD of VPL Medical Devices, and Dr. Abhay Sinha, Service and Export Promotion Council, Government of India, to please join us on stage and help us present awards to our next set of winners. I only have sheets and sheets and sheets on my dash today. Okay, a request to all the winners, because my screen says we have a couple of awards to give and वक्त थोड़ा कम है, so can we please try and keep your thank you speech in 12 seconds. I was going to say 10, but 12. Yeah. And I also request Dr. Mukesh Batra ji to please join us on stage. Sir. Okay, very quickly, moving ahead, the next category and the winner, please. Health and Wellness. We have with us Dr. Shiniket Mishra, Chief Medical Officer, along with his team to receive the award. Everybody, please, Hiro Morocop.
Namaste, good evening. Thank you, Businessworld, for recognizing my organization for programs, policies, and initiatives taken for employee health and well-being. Our management top priority is employee wellness, and we focus on preventive healthcare mostly. So prevention of occupational diseases, prevention of lifestyle diseases, prevention of mental health issues, and psychosocial. So we cover all the aspects of holistic health. Thank you, Businessworld.
Thank you, sir. Congratulations. Aye. Okay, quickly moving ahead, the next category and the winner, please. Consultancy Services, we have with us Mr. Gaurav Tripodi, the Director and Group CTO, to receive this award. Everybody for them, please.
Thank you, Business World, all the jury members, both Dr. Batra and Mr. Narula. Thanks a lot for recognizing Innoplexes. We started very much from Bharat and then became what the German media calls us as the German AI champion of Europe. And we have been working with top 30 big pharma and top 5 CROs, helping them on drug discovery and development. And now I can say we are writing our Bharat story, where we are looking at healthcare in Bharat. We are already working with few of the largest hospitals. We are working with governments in a couple of large projects, and that's what we are looking with IP being the cornerstone. We have a patent portfolio of almost 190 plus patents. We are really looking forward where we can make a difference to the healthcare in Bharat. Thank you.
Congratulations and all the best. A humble request to all the winners, please try and keep your winning speech as short as possible, because everybody's looking at me now, along with the timer. Yes? Our next category and the winner, please. Metropolis Healthcare Limited for Institutional Excellence in Diagnostics, Chain Pathology. We have with us Dr. Geeta Chopra, VP and Chief of Lab Operations, North Strategic Business Unit, to receive the award on behalf of Metropolis.
So 12 seconds. Thank you so much from the entire Metropolis, on behalf of entire Metropolis group, national and international. Thank you to the entire business world. Thank you so much.
You know, Mr. Narula, जिसने 12 सेकंड का बजट दिया ना, उसको पकड़ो एक. It looks at me as though I give it. I didn't, I promise you. It's not a part of my KRA today. Okay, moving ahead, our next category, next winners, please. Screening Technologies, we have with us Mr. Manjula Sharma, Head, Corporate Communications and CSR, to receive the award. And then please, everybody.
Thank you, everyone. Thank you to the jury members. Thank you to BW Healthcare Excellence. And I'm taking this on behalf of the 500 people from Roche Diagnostics. We have simple mantra, doing now what patients need next. And that's our mission. Thank you so much.
Congratulations, ma'am, to you and to other 500 members as well of the family. Congratulations. Moving ahead, our next category, next winners, please. NHMC for Institutional Excellence in Ordinary Medicine, we have with us the CEO, Ms. Dipali Nagila, to receive the award. Please.
Thank you so much. Good evening, everyone. Thank you so much, the presenters and the jury. At Neminath, I would say that we have been treating patients from all over the world through the science of homeopathy, and it's wonderful to be recognized finally. Thank you so much.
Congratulations and all the very best for the journey ahead. Moving ahead, our next category and next winner, please. And wellness, we have with us Swarnima Bhattacharya, the co-founder, along with the founder, Ms. Sherry Chopra, to receive the award.
Good evening, everyone. Thank you. We are Gayatri. We believe in delivering differentiated and a different standard of care for women. Learned a lot from everyone today. Thank you, Mr. Narula and the jury. I'm very grateful to be joined by my two young colleagues who make the hustle of an early stage startup worth it all the time. Thank you so much.
Congratulations, ma'am, and to the youngsters as well. Congratulations. Moving ahead, the next category, next winner, please. Hospital Ghaziabad for Institutional Excellence in Healthcare, Distinctive Technologies, Yada's Vice President of Quality, Dr. Saurabh Raha, to receive the award. Everybody, please, for Yashoda Super Specialty Hospital, Ghaziabad.
Good evening, ladies and gentlemen and seniors. Many thanks, BW Businessworld, all the juries for conferring us this award. At Yashoda, our motto is embracing technology in healthcare, and we are working on it to go digital very soon. Thank you all.
Congratulations, sir. Quickly moving ahead, the next category and the next winner, please. Technologies, we have with us Mr. Amit Arora, the Associate Vice President, to receive the award.
Good evening once again. Thank you again for this award, BW team. And we are certainly honored to receive 2 awards today. Thank you so very much.
Congratulations, sir. The second one as well. Congratulations. Don't forget the picture. Moving ahead, the next category and the next winner, please. Legal services here, Mr. Alisha Naqvi, the founding partner. Joining him is Abhijit Das, the partner, to receive the award along with the team. Everybody, please. Legal services.
Thanks a lot. Good evening and thank you to BW Healthcare, Harvinder, Anurag. And as a law firm practicing in healthcare domain, I can't agree more with what Anurag said earlier. It has been an enriching experience. Of course, it's rewarding professionally, but being one of those few law firms in India which actually practices in healthcare sector, and I can't agree with Anurag more, that it's both fulfilling also, because when I see this evening is about you, this celebration is about you. When I see you people devoting time, energy in healthcare of general people, we also are helping you out in our capacity as lawyers, feel so grateful. So thanks a lot. Keep doing the good work. And thank you, Businessworld. Thanks to the jury. Thank you, everyone. Thank you. And I also mention my team here, Abhijit, Jyoti, and Pragya, who have been there with us in this journey. And thanks a lot. Thank you for your contribution. Thank you.
Congratulations. Please don't forget the picture. That was for legal services. Next category and the next winner, please. Healthcare for institutional excellence in healthcare, mental health. We have with us Mr. Kubashi Sudana, DM, Marketing, to receive the award. Everybody, please, for Fortis Healthcare. We're taking care of the mental health bit. Thank you. Congratulations. On behalf of everybody at Fortis Healthcare. Okay. Moving ahead to the next category, next winner, please. Institution Excellence in Multi-Speciality Hospital. We have with us Mr. Aditya Bahadur, the CMO, to receive the award. And also Dr. Deepa Pandey, if ma'am's here. The Additional Director of Medical Services to receive the award. Everybody, please.
I would like to speak on behalf of our group CEO, Dr. Tarang Chandani, for recognizing and thank the BW team for recognizing Reliance Foundation Hospital. And this is a real proud moment for us. Thank you so much.
Congratulations, ma'am. Moving ahead, the next category and the next winner, please. Hospitals for Institutional Excellence in Healthcare Innovation. We have with us a General Manager of IT, Mr. D. Venkat, to receive the award.
Thank you, BW team and jury members. Thank you so much. I am honored to take this award. And when it comes to the Meringo group, we always focus on patient experience, how innovation can bring the change in the patient experience. Thank you. Thank you so much.
Thank you and congratulations. With that, the next category and next winner, please. Safety. Compliance, we have with us Dr. D.K. Gupta, Chairman and Managing Director, along with his team to receive the award. Everybody please for them. देखिए आपका नंबर भी आएगा and you need their support as well. Might as well celebrate.
Thank you so much, BW Healthcare, Dr. Batra, Mr. Narula, and all the jury members. We are one of the fastest growing hospital of Delhi in the last few years only, and we are doing on all the numbers great. And despite that, we are focusing on core value, that is patient centricity, especially focusing on quality and safety of the treatment. And this award is dedicated to each and every team member of Felix who are working tirelessly with perseverance, high commitment and dedication. Thank you so much. Thank you so much.
Congratulations, sir. Congratulations to your team. Well, we've crossed the halfway mark. So I'll try and be as quick as I can while we celebrate the achievements of all our winners. Our next category, next winner, please. It's Lord's Mark Microbiotech for Institutional Excellence in Screening Technologies, in vitro diagnostics. We have with us the CEO, Mr. Subodh Gupta, to receive the award. For them, please. We're also celebrating the 25th anniversary of Lord's Mark Microbiotech. They deserve an applause for that at least. They've managed to pull along in extremely well, I believe.
Thank you so much. Thank you, BW team. And we are really honored to be on the dais today. Thank you for the recognition. Our mission is to provide affordable healthcare, which is based on innovation, patient centricity, and affordability. And that's how we work with the premier institutions of this country, like the IITs and the Baba Atomic Research Center, to bring Indian technology to the people of the country. Thank you so much.
Congratulations, sir. Moving ahead, the next category and the winner, please. For institutional excellence in healthcare marketing, we have with us the Chief of Clinical Compliance and Excellence, Dr. Shweta Diwan, along with her team to receive the award. Everybody. Congratulations again, and thank you again from them. Moving ahead, next category, next winner, please. Excellence in healthcare marketing PR campaign Pan India. We have with us Ms. Manjula Sharma, Head Corpcom and CSR, along with Sir Sanjay ji to receive the award. Let's please congratulate them, everybody in the audience. Congratulations and thank you from them to you. Moving ahead, next category, next winner, please. Nutrition, we have with us the owner, Ms. Tina Sapra, to receive the award. Let's try again, no, and congratulate our winners. So I love your smile. He's smiling on every award. The gentleman there.
Thank you, Business World. Thank you, Mr. Narula. Thank you for recognizing nutrition as an alternate form of medicine and Dr. Diet as an institution to be worthy of being here. Thank you.
Congratulations, ma'am. Please don't forget the individual picture and then also the group picture in the very end. With the next category and the winner, please. Education and training, continual education with hospitals. We have with us a VP of Product and Technology, Mr. Sai Krishna P, along with his team. For Medland, please.
Thank you, BW Health and the juries for this award. And to everyone, we are the most trusted training platform for more than 300 plus hospitals in India. catering to 100K medical professionals on our platform with a vision to reach 1,000 plus hospitals in the next 2 years and 1 million HCP. Yeah, that's it.
Allow you to smile when you say that. Congratulations and all the best. Congratulations. Next category and the winner, please. And this time for Institutional Excellence in Healthcare Education and Training, Academics Alternate Medicine, we have with us the Director, Mr. Devesh Gupta, to receive the award. For them, please, for NHMC, this time for Alternate Medicine Training.
Thank you to the BW team. Deeply honored and humbled to receive this award. It's a testament to the incredible team and support we have at Neminath. Thank you.
Congratulations, sir, to you and to everybody back home. With the next category, next winner, please. In diagnostics chain pathology, we have with us the General Manager Marketing and Sales, Mr. Joginder Singh, to receive the award. For Leoborg, everybody.
Yeah, thanks BW Healthcare Excellence and the jury for choosing us for this Excellence Award. We are really humbled and honored with this. It's a privilege to us, and we'll keep ensuring to bringing the new innovative technologies in India in excellence for diagnostics. Thank you very much.
Congratulations, gentlemen. With that, may I please request Hoshi Kaswala, the CEO of BW Engage, to please join us on the stage, sir, and join us. With that, the next category and the next winner on this screen. In infertility treatment and IVF care, standalone. We have with us Dr. Arvind Ved, IVF specialist and center head, to receive this award. Everybody, please. For Zero IVF Delhi.
Thank you so much for this award. We started this center in 2014 December, and we are catering more than 450 cycles in a month in nearby NCR. Right now we have 15 center, and in Delhi NCR and Pan India we have more than 120. Thank you so much for this award. Thank you.
Congratulations to you, sir. Please don't forget the individual pictures, winners, and then the group picture in the end. With the next category, next winner. Excellence in public health outreach. We have with us a Vice President of Network and Marketing, Mr. Nitin Vineet Das, to receive this award. For the one who was smiling for everybody, I think he deserves the loudest applause. He's been cheering for everybody and smiling all throughout. No, Nitin, I thought you were a dentist first. But now I know.
Thank you, very kind. Thank you very much, Business World, Dr. Anurag Batra, Mr. Narula, the eminent jury. It's recognitions like these that keep us startups going. Today, Medibuddy is touching almost 45,000 lives daily through our primary and preventive care platform. And that's roughly about 16.5 million a year. It's a very small beginning to reach our vision of touching 1 billion Indians, providing them quality yet affordable healthcare. And we can't do this without the lovely audience that we have over here of eminent healthcare leaders. And we continue to be motivated through recognitions like these. Thank you very much. Thank you.
Congratulations, sir. Congratulations to you. With that, the next category, next winner, please. In healthcare security services. We have with us the General Manager of Security, Mr. Rajendra Singh Negi, along with his team to receive the award.
Uh, 35 years of being a security professional. When I came into healthcare sector and joined the JP Hospital, I came to know how different and how important is security of the healthcare. Thus I realized first. Now I thank very much the business world to choose, last but not the least, the support services also one of the events for this awards. And secondly, I thank each member of the jury who chose our team to have this award here. Thank you very much.
Congratulations, sir, to you and your entire team. Very quickly, next category, next winner, please. For change maker in healthcare. We have with us Executive Director, Ms. Sudhabdi Bora, to receive the award. And we also have with us Dr. Madhurya Bora to receive the award as well. Executive Directors.
A warm thank you to the organizers and to the esteemed jury. It is an honor. Thank you, sir. Thank you.
Congratulations, ma'am, and of course also to Dr. Nobel Charra for receiving this award. Congratulations. Please don't forget the picture. Moving ahead, next category, next winner, please. It's time for Institutional Excellence and CSR initiatives. We have with us again Ms. Anjula Sharma, Head Corpcom and CSR, to receive this award, along with Sanjay sir. Again for them, please. Ladies and gentlemen. Thank you and congratulations. Yes, on your behalf and also to you. Okay, next category, next winner, please. Institutional Excellence in Healthcare Marketing Regional PR campaign. We have with us Ms. Shraddha Pandey, Manufacturers PR, the PR agency for India IVF to receive this award. Thank you so much and congratulations again. Quickly, down to our last 5 now. Next category, next winner, please. For institutional excellence in CSR initiatives, healthcare, education, we have with us Dr. Nidhi Singh, Chief of Labs, to receive this award along with her team. For them, please. Thank you so much, ma'am, for being my constant team member in doing this. Thank you and congratulations. I love this bit. Okay, moving ahead, our next category, next winner, please. For institutional excellence in public health initiatives, we have with us Manager of Public Relations, Mr. Christian Mishra, to receive the award. Everybody for them, please.
Thank you once again. We are really honored and feeling proud moment for behalf of our Newburgh team entirely. And the credit goes to our PR team and all the Newburgh team across India and larger world. Yeah, thank you so much.
Congratulations, winners. Please don't forget the picture and then, of course, a group picture in the end as well. Our next category and next winner, please. Institutional excellence in nursing. We have with us a nurse manager, Ms. Sheila Grace, to receive the award. Everybody for Manipal Hospital, please, for excellence in nursing.
Good evening, everybody. It is indeed an honor and privilege to represent Manipal hospitals in this gathering, more so nursing, which is usually not recognized. So I thank BW Healthcare Award people for recognizing the importance of nursing and adding value to the excellent services we provide. Thank you, everybody. Thank you, sir.
Congratulations, ma'am. And I think with that also congratulations, Arvinder sir, and to everybody for doing that bit as well. Congratulations to all of you. Next category, next winner, please. Mental health. We have with us Miss Simrat Singh, psychologist, to receive the award. And she's been clapping for everybody all throughout. So please give her the love that she also deserves. Come on, louder, come on. She's been there for all of you. At least one constant supporter.
Good evening, everyone. So I accept this on behalf of the entire team at the Mood Space. What an absolute honor. I'll just take a quick minute to also reaffirm the commitment of our organization in providing quality care, which is empathetic, client-centered, and also far-reaching in its impact in terms of both accessibility and diversity. So thank you. It's been an absolute honor. Thank you so much.
Congratulations. Please don't forget the individual picture. With that, our next category, next winner, please. In infertility treatments and IVF care chain, there's a Dr. Arvind Vaid, the IVF specialist and center head, to receive the award. Please, for them. Sir, ये अपना पूरा वक्त लेंगे for his pictures.
So thank you for recognizing the effort made by Indira IVF in making affordable infertility treatment accessible to the masses, with over 120 plus centers now and growing rapidly. So thank you very much.
Congratulations, ma'am. And the next category and the next winner, please. In healthcare in rural India. We have a video from Dr. Manish Manchureddy, Regional Clinical Coordinator. As an acceptance, please, can you have the baby?
I sincerely thank BW Healthcare Excellence Award for recognizing our services in the rural India and providing us with this prestigious award of Institutional Excellence in Healthcare in Rural India Award. This will boost our enthusiasm and our efforts in transforming the rural healthcare sector in India. And I sincerely thank everyone for the bottom of my heart. Thank you.
Congratulations to him. With that, we come to an end of the awards ceremony, but because before this, we also had the healthcare honor, and we had missed out a doctor because she was on her way. Now she's here. Let's also please celebrate her win. Please join me in welcoming on stage Dr. Professor Alka Kriplani, Chairperson of Obstetrics, Gynecology and Art, Paras Hospital. And this healthcare honor has been bestowed upon ma'am for contribution in gynecology. Everybody please, Dr. Professor Kriplani. I think the only one who's angry is the photographer today, because you aren't standing in a semicircle. Now a few words from you, please.
Good evening. Thank you, BW Healthcare, Dr. Batra, Mr. Narula. And I'm happy I'm late because I saw so many newer fields in which so many people are working are getting recognized. This is, I think, an excellent endeavor on your part. These awards and recognitions, they inspire you to work harder, and the love and the respect one gets, one feels like making it manifold and returning it back to the society. By the way, I'm a practicing gynecologist and teacher and trainer of gynae surgery in this country. Thank you. Thank you.
And with that, we come to an end of the awards ceremony in its entirety. I please request all the winners to join us on the stage with your trophies only. Aye. Please. And after that, it's a Saturday dinner and dash awaits us. Dash because I've been asked not to say it out loud. हाँ सर आप सर अपने आप प्लीज 1 घंटा और फोटो खींचो सर, कोई दिक्कत नहीं है हमें अब. All the winners with your trophies only. If any of your colleagues or winners are outside, I request you please उनको भी अंदर बुला लीजिए. Come, please come. Getting a bit of it, huh? What yours we made. Sir, अभी आप settle कर लो. Where's the photographer? Where's that young angry man?